Good evening. Oops, sorry. Needed to mute that, sorry. Technology. I now call the February 8th meeting of the Wallingford-Swarthmore School Board to order. In opening, as you're willing and able, please rise and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. I'd like to start by asking Ms. Figueroa to take the roll call.
Mr. Ballas?
Here.
Ms. Semino?
Here.
Dr. Downey? Dr. Downey?
Dr. Downey is not able to join us this evening.
Okay, thank you. Dr. Huff?
Here.
Mr. Cudis?
Here.
Mrs. Lentz?
Here.
Mr. Sullivan?
Here.
Mrs. Walkman?
Here.
Dr. Grandy?
Here.
Mr. Berman?
Here.
Dr. Palmer?
Here.
Ms. Patel?
Here.
Dr. Grandy, you have 8 voting members present tonight.
All right, thank you, Ms. Figueroa. So to begin our meeting this evening, I am going to start with our student representatives report. So Ms. Patel.
Thanks, Dr. Grandy. At SRS, the virtual book fair is happening now. SRS will receive 30% cash back for all orders placed before February 14th. Dr. Tuck encourages everyone to consider buying a little treat for Valentine's Day or to build a diverse home library in honor of Black History Month. Also, as part of SRS's service and civics programming, the Home and School will be sharing a series of activities to recognize Celebrate Diversity Month, started in 2004 to honor the diversity surrounding us all, and Earth Day. All of the activities can be safely completed at home or in our surrounding community throughout the month of April. Students strive every day to be kind, be respectful, and be responsible at SRS. These activities and events will support those efforts and help children get a deeper understanding of each other and the world around them. Some of the events will also help us celebrate the SRS traditions that are not possible during the pandemic, like Asia Week and the Arbor Day celebration. More specific information, including volunteer opportunities, will be shared soon. NPE will host their 25th annual Jump Rope for Heart event during the month of February. Due to safety guidelines related to COVID, NPE will have a socially distanced event during PE classes instead of holding a large group event. Raising money for the event is completely optional. For those that choose to raise money, you can use the collection envelope that was sent home to NPE families, or you can use the American Heart Association's website. At the middle school, Black History Month is being celebrated with lessons and activities on historical figures and events in disciplines all across the school, as well as with our Listen Up in February program, in which famous African American musicians are highlighted in between classes over the PA system. Also, Strathaven Middle wishes a warm welcome to the school's new administrative assistant, Brittany McNeil. Many will recognize her as she was the former athletic trainer for the past 2 years. At Strathaven High School, students remain committed to supporting organizations and causes they care about. Amongst other initiatives, the Green Haven Club is selling reusable straws as a fundraiser with Penn Environment and encourages everyone to buy one. Also, seniors are now able to vote for their official class flag as well as superlatives for classmates through the Class of 2021 Google Classroom. Underclassmen are encouraged to submit selfies for the yearbook to capture the stay-at-home experience. The high school's 5th Social Emotional Learning Workshop is on Mindset Matters and will take place for students on Wednesday, February 17th from 10 a.m. to 20 a.m. Students who are not taking the Keystone exam that day should attend the workshop being provided by their school counselor with the support of behavioral health staff. Lastly, guidance counselors have already started to meet with juniors in preparation for post-secondary planning. Students are very grateful for all the support and flexibility from teachers and counselors during this time. That's it. Thank you.
All right, thank you for that, Ms. Patel. Next up, we have the superintendent's report, Dr. Palmer.
Thank you, Dr. Grandy. At our last school board meeting, I was quite long-winded, so I thought I would be very brief tonight. And I'd like to talk about one specific item on our agenda, and that item is the 21-22 calendar. And before I talk about the calendar highlights, I'd like to thank everyone who shared their comments, their likes, their dislikes, and their preferences with us. It seems like everyone is divided in their opinion on almost every topic these days, and the calendar is certainly no exception. The complete draft calendar is available within Board Docs, but I wanted to highlight where we started and where we are tonight with our recommendation. So 2 board meetings ago, Mr. Abbott presented the draft calendar as part of our focus topics. Included in that calendar was a start before Labor Day, or August 30th, which would be our first student day. Our school year ended in that particular recommendation on June 10th as the last student day. November 2nd was a teacher in service and a student asynchronous learning day. We moved from that focus topic presentation to the one at our last board meeting, where we moved the start date of the calendar for the first student day to be after Labor Day, or September 8th. And we also moved our last student day to June 17th. Still included in that draft that was presented at the last meeting was November 2nd as a teacher in service day and a student asynchronous learning day. What is before the board this evening is a little different than the last one as well. We've kept the recommendation to start the school year after Labor Day. So to recap, it would be on September 8th would be our first student day. We would have a corresponding last student day of June 17th. We still have November 2nd as a teacher in service day, but it would not be an asynchronous learning day. And recapping everything, when we look at our calendar and we total our number of days and our number of minutes, one of the things that comes to mind, since we just recently had a snow day, was how many emergency or weather days are built into the calendar. And there are 2 days that are built in across all of the levels. So I thought that might be helpful to know as well. And I'm hopeful the board will take action to approve the calendar this evening. And Dr. Grandy, that is my short report tonight.
Thank you, Dr. Palmer. So that takes me to board announcements. I have 2 announcements to make, and then we'll move into our first focus topic this evening. The first announcement is an update on the superintendent search. So the application phase has closed. We've accepted applications from 32 candidates. The board will begin introductory first round interviews this week and continue those through next week. We expect to meet approximately 10 first round candidates. Our goal is to complete second and third round interviews, including writing samples and presentations by late March for an early April appointment and a July 1st start. The second board announcement is that the board met in executive session prior to our meeting this evening to obtain advice of counsel. So that takes us to our focus topics this evening. We have 2 of those on the agenda this evening. The first is the big one, which is on the elementary transition plans and discussion. And the second one is on the 2021-2022 preliminary budget. Before we introduce our first speakers for the focus topic, I do want to make some introductory remarks. So please bear with me for a moment. I know we probably have many people in our district and community watching tonight, as there has been a great deal of discussion in our community about plans for our elementary students for the remainder of this school year. The question, as everyone knows, is whether to shift from our current hybrid model to full-time or close to full-time face-to-face instruction for this academic year. And I know that this issue impacts everyone in our district in many ways, and we've heard from many, many parents over the past week and a half. I want to assure everyone that the board reads each and every message. It's not always possible to respond to every single message, as there has been a record number of communications with the board. We are doing our very best to communicate, but please know that we read every single message carefully. Every single board member sees those messages, and we appreciate that outreach. As you know, We canceled our special board meeting last week, given it was in the midst of the snowstorm, and we had so much of a desire for comment that we decided it was not the best process to convert that to an all virtual meeting. And so we will start that discussion tonight and do so here with the opportunity for some folks to talk to the board in person. Over the past week, I also did ask the administration to examine one other possible option that would be somewhere between what you'll hear about tonight and our current hybrid plan. The administration reviewed that with the Education Committee on Thursday and felt it was not a viable option, involved too many disruptions to instruction, and so we'll focus on one option this evening when we get into our focus topic discussion, which is a 4.5 day in-person model. And so let me start by reminding everyone about our process. The elementary plans are only for discussion this evening. We have two guests with us this evening from CHOP, Dr. Coffin and Dr. Rubin, who are going to start our focus topic this evening. And we will talk through with them, and then we'll talk through with our administration on what these plans might look like and have a chance to discuss them in detail. Following this meeting, we'll have a survey for parents to complete to share their views and plans with us, should a change be made. And then our next board meeting is scheduled for February 22nd to consider this change. And I want to say this loud and clear. There is no decision that has been made yet. I've certainly not made up my mind yet, and I've heard that some people seem to think a decision has been made, and that is absolutely not the case. I also want to speak to all of our community members this evening and really try to emphasize a few points. First, and I think I speak for everyone on this board, I know how hard everyone is working during this pandemic, teachers, parents, everyone. We are all taking on roles we never imagined, and I know people are juggling extraordinary demands. And just when we all feel like we get into some kind of rhythm, something seems to change in the world around us. Our teachers have had to adapt over and over again, and I understand that none of this has been easy at any point, going back all the way to last March. And second, everyone in our community has their own unique health and safety concerns and their own challenges in their child's education. We all have to understand that each and every person comes from their own unique set of experiences and perspectives, and everyone has their own valid views and concerns. There is no right or wrong in these discussions. I've heard of too many instances, honestly, over the past few weeks where some do dismiss the concerns of others, and in some cases, shout each other down. And I hope we can be a model for our students about how we can have a civil and healthy dialogue. In the end, we won't all agree with one another, but we certainly can have a constructive and thoughtful debate. I received, and the board received, I believe the full board got a fantastic letter from two parents last week. And they said, we know that the topic of school reopening has become extremely polarizing in our community. And prior to this meeting, you will have received petitions and letters from parents, both adamantly supporting reopening elementary schools and asking for them to remain in the current hybrid model. The purpose of this letter is not to take either one of those sides, but to encourage all of us to acknowledge this is more nuanced than being right or wrong. And I think that letter is an excellent reminder that we have to have this discussion with respect and understanding, and I know our community can do that. I certainly have faith in this board to do that. I've gotten to know all of my fellow board members extremely well during this pandemic, and I know every board member is trying to do what they think is right at a time when, frankly, there are no easy answers. There will be a time when COVID is in our past, and when that time comes, we'll still be neighbors, and we have to do everything to keep our community and our district strong. So how do we get to this point this evening? We started last summer, if you recall, thinking we might be able to have students in full-time. And summer came, and so did recommendations to open schools using hybrid models. And then we started the year virtual for a few weeks. We did so when we were concerned about rising summer rates, and we were urged to not open. We were actually worried at the time that our hybrid plan would not prevent transmission when rates were high. We successfully transitioned to hybrid at the end of September, and it has been a remarkable success from a health and safety perspective. For most districts, including our own, we've seen far less transmission in schools than most would have ever thought possible. We've had more and more scientific evidence, particularly in the past 2 months, that have shown that elementary schools have not been a significant source of transmission. We'll hear about some of this discussion with our colleagues from CHOP this evening, But I'll just highlight a few points. A study in Mississippi looked at a large group of children diagnosed with COVID and found that attending school was not a significant driver of infections, but rather out of school gatherings and not wearing masks. A study in North Carolina tracked students over 2.5 months, also found low rates of transmission and no student to staff transmission. And another in Wisconsin came to the same conclusion. And there is certainly anecdotal evidence from other states like Rhode Island and districts in our region that have moved to 3-foot minimum distancing of their students. And is that type of evidence that led to that report that so many people are talking about out of Harvard and Brown that recommended elementary schools move to 3 foot of distancing, even at high rates of community transmission. But transmission is not zero in these studies, and the mitigation in place in these schools that are being studied also vary a lot. So I don't want to say there's a single study that answers the question about what schools should do right now, but the evidence is growing to say that schools are far safer than certainly what many thought last summer. Right now, we're still seeing relatively high rates of COVID in our county, but rates have improved dramatically over the past few weeks in our county and our district and in the region. The snowstorm earlier last week could have had some impact on the really nice reduction that we saw in rates last week. But I don't think the snowstorm explains the whole thing because our positivity rate also went down in our county last week, which is a sign of whether there is enough testing being done. So all of that is encouraging. I know there is concern about COVID variants and what that means for schools. I know that is what has been universally true during COVID is there's always another threat on the horizon. But we still have to start planning our next steps as COVID will not be gone anytime soon. And if at some point we take a step forward and are forced to take a step back, that always remains a possibility during this pandemic. Our district has very aggressive measures in place, including universal masking, which is not necessarily the case in schools overseas and some other states. I think that partly explains why we've had so much success at limiting transmission in schools. We also will soon have a testing program that you'll hear about from our guests from CHOP this evening with the goal of adding a new layer of protection. So how do we move forward in this discussion? The board asked Dr. Palmer and the administration to prepare a plan for a return to full-time instruction along with a timeline, and that is how we got to March. When we look at the rest of the school year, we have about 3.5 weeks of school in March. We have 11 weeks of school after spring break, if I reviewed the calendar correctly. And planning and switching can't happen overnight. It's not a light switch that can just be turned on one day, and you'll hear about a lot of the work that goes into this transition this evening. But what I do feel now is time to start the conversation. If we want to consider a change during this school year, we have to make some decisions about where we want to go as a district sooner rather than later. And that is what we promised we would do at the beginning of the year, is continually revisit our plans. I know our community has been very divided on this question. We have gotten a ton of communication. I promise you, we've heard varying perspectives with views on both sides of this issue. So we will be discussing this plan, but we will not be voting this evening. Again, we will survey our parents after this meeting and have those results before our next meeting. Now, I do want to say, and bear with me, I know my comments are long. These are all important things I want to say. I do want to say a word about the survey. We had originally intended on 2 surveys, one this week just to get a sense of likely choices as well as parent views, and then another after the next meeting on actual choices. And I've had a lot of discussions with Dr. Palmer and Ms. Walkman over the last few days, and what we really need to know in order to complete this planning effort and to make a good decision is actual parent choices so that we know the implications of making a change. So we will ask our parents for a decision this week. But we will also ask for parent views on that same survey. And so again, no decision has been made yet. My mind is wide open. I want to hear from our families. I know this whole board wants to hear from our families, but it's very difficult to make this decision without understanding exactly the full implications of implementation. And the only way to do that is to really ask our parents to make a choice right now so we know how to make a good decision that's in the interest of the whole district. In this debate, there is no right or wrong. I hope people realize there is no winning or losing. Let's have a thoughtful discussion, gather more information, and I believe we can make the best decision possible. I know that all my fellow board members are all trying to do what is best for the students of Wallingford-Swarthmore School District. So thank you for listening to these comments. I look forward to the discussion we're going to have this evening. And with that, I would like to move into our focus topic discussion, which is the elementary transition plan. So we do have our team here in the district to present, but before we do that, Dr. Rubin and Dr. Coffin from CHOP. Dr. Rubin runs Policy Lab and has been very involved in many discussions, both nationally and locally, around school policies, as has Dr. Coffin, who's an infectious disease specialist at the Children's Hospital of Philadelphia. So Dr. Rubin, maybe we could start with you. I'm hoping you could maybe start this discussion off this evening, perhaps sharing an assessment of where we are in the pandemic in our region, our county, and how you are thinking about schools reopening further.
Yeah, thanks for those introductory comments, Dave. I think you really pointed out in those introductory comments something that we ascribe to, and Dr. Coffin has joined us as well at CHOP. We have a team, when we have our blog that comes out every week, that's not just a product of, what folks at I might think at Policy Lab. We have a full team that includes multiple people from our infectious disease division. Dr. Coffin leads that group. With a diversity of opinions, trying to navigate what we're learning and what we still do not yet know about what is a novel coronavirus. And we're still going through this pandemic. That said, we've always kind of thought about this pandemic in 6 to 8 week blocks and prepared to incorporate new evidence, remain nimble to the time that we were in. And I think you really nicely summarized the different phases, the concerns late in summer without any evidence on transmission, with some rising rates before Labor Day, about not moving too quickly, to give yourself a longer runway. Areas in the Midwest actually went straight into school and then had much earlier peaks, and not just in school, but among their youth, but also among just their communities at large. They opened very quickly in the fall. We were able to mostly make it very close to the holidays, and that may have been a product of a little bit of patience in early fall that gave us a little bit longer runway once we got started. Once we got started, we recognized what we know is true, that these safety plans that we have developed have worked extremely well, particularly at low and even higher incidence, to protect against in-school linked transmission. Much of the transmission we've seen, and that's now been confirmed in multiple studies, has occurred out of school, among staff out of school and the activities, sometimes with each other after the school day. Youth sports has been a real challenge, particularly outside the context of the school day, particularly when safety protocols have not been followed as well. And within the school day, even when there have been clusters, it's been some smaller clusters, particularly when safety protocols have been followed well, of maybe student to student transmission and occasional staff to staff, let's say in a break room, et cetera, but very infrequent student to staff transmission, which which has been reassuring. And for families out there in your school community, we have not seen widespread outbreaks under most circumstances. Much of the data that we have, particularly that's been peer reviewed, goes through late fall, right before the surge after Halloween. Halloween was the turning point in the fall pandemic. Within a week or two, it was like a hurricane coming in. For those that remember, our positivity, even among kids, particularly older youth, dramatically increased very quickly. And I do believe there's still a question at very high case incidence. I do believe outbreaks did occur. They weren't everywhere. But there were certainly, and there have continued to be some linked in school cases. They're rare. And certainly as cases are now declining, we've gone through a very difficult winter now. And as cases are now declining, I think the opportunity, we always, in our recommendations, when we talked about a pause before the holidays, talked about reopening in January, because we did not see the major gatherings on the horizon. And we presumed that we would eventually move past peak in January, which we did. And we've seen a nice decline in cases and in hospitalizations as we move towards spring. And so now, as we're considering the next 6 to 8 week interval, I think it's an appropriate time to start thinking about planning and taking advantage of the window you may have, and reappraising your safety protocols by focusing on not relaxing, but strengthening the things you know that work well. Masking, hygiene, keeping sick kids out of the school, strong sort of protocols around your sports teams, particularly around locker rooms, on buses, all the things that work well, so that you give yourself a potential opportunity to make other choices around your safety plan to get closer to a resumption of a normal school day as we move towards spring, and with the hope that we still see declining incidents. And I suspect we will. I think there's a lot of optimism as we look forward in our models. We've seen it for several weeks, but there's also some uncertainty. And the uncertainty has been a slower than desired rollout in vaccinations because of inventory, particularly because of inventory challenges and these new concerns about variant strains. And so part of our message to you tonight is plan as you're doing, but also be patient and not act too quickly. Or we have a saying, walk before you run. Don't do too many interventions at once. And we're proud, we're excited to offer a testing program that will add another layer of mitigation to your schools. And I'm going to have Dr. Coffin describe that in just a moment. But I also want her to describe what we're learning about the variant strains and how they factor into our desire to be just a little bit cautious as we start to plan our next move. So Dr. Coffin, do you want to chime in here?
Great, thanks, Dave. I won't spend a really long time talking about the variants, in part because we don't have a lot of information. But what we do know is that virus mutation is a normal phenomenon. And so what's going on now, and we're seeing in multiple parts of the globe of new strains of the virus cropping up, isn't unexpected. What catches everyone's attention is that there are signals, and they're not terrific signals, but there are definite signals that some of these strains may be more easily passed person to person. And with that, lots of questions. How does this alter our understanding of current prevention protocols? How does this inform our future walk back as we get to low levels of virus? And how do we do that safely, having not experienced outbreaks with these new strains? So like Dave said, I think there are things that we can do to move ourselves forward, taking advantage of low rates of viral spread or falling rates of viral spread in our communities, while remaining cautious and not pulling out all the stops until we have a better understanding of where we are with the virus, these variant viruses. We do know that there have been at least a handful of isolations of the UK variant in our state, and that there are likely more. The question we can't answer is how many more, what proportion currently of all the tested people are having this variant virus, and how will that change over the upcoming weeks. And so it's those pieces of information that we really crave before we accelerate our move towards spring and a move towards dramatic changes in how we approach bringing kids in for in-person learning. Like Dave said, I love the walk before you run metaphor. Some of the things that I think school districts that I've spent more time talking with have a real advantage to do is to think about how can they maximally use their space while adhering to the 6-foot distancing. There may be a place to move between where you are now with your hybrid learning model and bringing more children back for more hours of instruction in the school while still adhering to 6 feet. And I definitely would encourage schools that do see that opportunity available to them to take good advantage of it now. And so that brings us to something specific that our team at CHOP has been working on, which is adding an additional layer of assurance to existing safety plans that schools are using, whether or not a school is moving from all virtual to hybrid learning or trying to further their activities within hybrid learning. And that has to do with using rapid testing as a way to inform smart decision-making to achieve a couple of goals. One is to minimize the frequency with which someone who has an asymptomatic infection spends time in our school buildings, understanding that a significant proportion of all infected people may actually be asymptomatic. The second part of our testing program has to do with the early and appropriate diagnosis of coronavirus. So we can make smart choices during the school day. If a staff member or a student comes down with symptoms that look a lot like coronavirus, rather than panic and send this child home and say, please call us as soon as you have your test results, and knowing you're going to be sitting for 48 hours until those test results become available. A rapid test performed at school gives us a chance to make a clear decision. Yes, this child has coronavirus. We are going to have to act and engage our public health response and do the appropriate quarantining. Or few, this child does not have coronavirus. The child still needs to go home. They're feeling sick, but we can continue our school day otherwise. And we really think that this use of these kind of paired approaches to using rapid tests can provide both confidence and actual additional safety that will allow the school day to go on with less risk and people feeling happier and more confident in spending time at school. So with that, I'll pause, and I'm not sure, David, how you want to go forward with additional questions or comments.
Sure, thank you. And I'll look for hands in the room. I'll look for hands up in the participant list on Zoom. I do want to start with a question, which is, essentially our district, many other districts are all facing this question right now on February 8th of how to plan for the spring. And as I mentioned earlier, there's not like a quick switch to flip here. And so what we're looking at is, I forget how many weeks, but I think about 5 weeks from now takes us to mid-March, which is the timeline that we've been looking at. And I guess the question is, thinking about 5 or so weeks out into the future, mid-March, keeping all, we're looking at keeping all of our very aggressive mitigation measures in place that we've been doing since the start of the year. We're looking at maintaining that full 6 feet of social distancing in high-risk settings like eating, masks off, all those other types of things. But in order to really bring kids back into the classroom, our district, and I think most other districts, in order to repopulate the classrooms, really need to relax on the 6 feet a little bit in order to achieve that. And so, I think that's the fundamental question facing a lot of districts. And, I think as we talk about potentially backing off one measure slightly in the classroom when students are in desks in full masks as being the only scenario where we look at kind of relaxing that a bit, but also at the same time, introducing another layer of protection with the testing program. I guess I'm curious of your reaction to that, because as a practical matter, it's hard to, there's not a lot of other options in terms of how to bring kids back into the building with the space constraints that our school has, with the space constraints that I think a lot of other schools have.
So, I guess I would start to say you're not unique in that deliberation that's going on. And having worked with a lot of school districts throughout the area, we're very familiar with this, discussion that's going on. And we've learned from our school districts just how much planning goes into place. And I think it's, suffice it to say, I think it's understandable that planning for a move, you're not just going to turn on the switch in mid-March or in April. We've urged patients to wait for warmer weather in spring because I think that plays to your advantage. It also gives you a little time to absorb what the true impacts, if any, of the variants are going to be. You could plan and certainly kind of observe the case incidents and see whether the hypothesis that we've had that suggests that perhaps we're not going to see another big surge actually comes true. So you just need to plan around. I think for many districts, it's just the decision of timing. Is that mid-March or is that April, coming back from spring break? How much time do you want to observe just to be careful? But I think we've always felt optimistic, and particularly in the recent weeks, that if we continue to observe the case incidence declines in the context of now adding an assurance testing program, that particularly in our elementary school kids, a resumption of a normal school day was possible.
I'm just going to ask one other question, then I'll see if other board members want to chime in. with the introduction of more access to testing, I guess, potentially opens up the opportunity, not necessarily for in-school testing, but also, kids who are out on quarantine who've, been potentially exposed in school. Like if we were to start to repopulate classrooms and the availability of more widespread testing, it seems like it would be a little easier to start to find early signals of potential transmission in schools, whereas we haven't really had that early signal up to this point.
Absolutely. You have two aspects, and Dr. Coffin can mention this too. I mean, number one, you're going to be doing, under our program, the weekly assurance testing of staff. And so that's a signal you'll watch to see, we've seen, in a very similar district up in Lower Merion, we've seen very infrequent asymptomatic infection. We found it a few times, and the value of viral reduction, not elimination. You never eliminate all risk, but we've been able to remove some potentially contagious individuals infrequent, and it's alleviated anxiety among the staff and the school community, just to see how infrequent it was, and created a lot of optimism there. And I suspect the same would happen in your own district. One of the use case, we're also, have a number of districts that may start testing kids out of quarantine based on CDC recommendations that negative tests at 7 days could be used for children who remain asymptomatic. And we're encouraging a number of districts who may be interested to think about that as a use case, because as you start over the next month and a half, or wherever, where your current state, for those students who might be identified in the school setting for whom you quarantine students in nearby desks, if you're seeing very infrequent or no infections testing out of quarantine, or that will be helpful and create that baseline trend that as you start to make changes in the spring, if you continue to see infrequent infection, the question that's not been reliably answered is, as you move within 6 feet but you're wearing the mask, how much protection does that offer? And I would rather see some more declining incidents to put you on the better side of that. But then your testing out of quarantine will also help you see whether that test the assumptions as you move forward. And we'll have data coming from multiple districts that are doing that. And I think that'll help in terms of the decision making.
Thank you. Dr. Huff.
So I just want a little bit more clarity on who we are testing. So if I understand it correctly, we're doing weekly testing of the teachers and only symptomatic testing of students. Is that accurate?
Let me have Dr. Coffin walk through all the our recommendations for testing.
Yeah. So we try and split things into two different buckets. One is asymptomatic testing, and that's the quote unquote assurance testing, making sure that people who don't have symptoms don't have hidden infection. For that, what we're recommending is that teachers and student-facing staff, so people who are in the buildings or driving buses or helping kids get to and fro school, participate. And we really do encourage near full participation, and every district gets there in their own way. But this isn't something for people to opt in and opt out of back and forth. That testing would be weekly. Again, we're kind of looking for negative tests, making sure people are all negative. The other population in which we're currently encouraging schools to think about including are kids who are coming to school who have sensory issues or other special educational needs that make them unable to wear masks. That's another group where we think that a weekly assurance testing application could be a good thing for both the students and their families, as well as for the teachers and aides in that classroom. So that's the assurance weekly testing. The symptomatic testing, we focus on anybody who gets new onset symptoms during the school day while at school. So could be a student, could be a teacher, could be another member of the school staff. And there our idea is to quickly figure out who's got coronavirus among somebody who looks like they have coronavirus, recognizing that not everybody who's got the sniffles is going to end up with coronavirus. With that, it could be just 1 or 2 tests a day. You could have 4 or 5 tests a day that an individual school nurse or the proctor at that site might be doing. And so I hope that helps kind of clarify the 2 different approaches to testing and populations to be tested.
Thank you. That's helpful.
We have other questions? Jerry. Jerry, you're muted.
So a little clarification on who administers the test for all the kind of testing, the school nurse for each.
So this is a test that does not need to be administered by a medical professional or someone with medical training. It does need to be administered by somebody who has been trained, and we have a 3-step training program that we, for people involved in our program, we insist that people participate in. There also needs to be an on-site medical professional providing some oversight of a testing site. But we have tested coaches, or we have trained coaches, we have trained administrative staff, as well as many school nurses to do the test.
What's particularly exciting, I think, is we designed this program to not interfere with the school day, to make it as easy for families and staff to participate on site in your schools, to kind of cut through the red tape, to make it very easy to administer the program on a school site, and to very easily report the results up to public health. And that's no small feat, because of just how complicated their systems can be. And the early experience, as we're growing quickly now through the region, has been extremely positive in terms of both how easily they've been able to adapt this process into the school day, but in addition, just how much anxiety it truly has alleviated.
Marilyn?
Yeah, I do have one more question, because I know that there has been the CDC administrator made a statement recently, and then there's also been talk about the CDC coming out with some guidance sometime soon for schools and reopening. And I'm wondering if, since I'm sure you guys follow that more closely than most, if you could give us maybe an idea of what kind of guidance, not the details, but what kind of guidance we might be expecting?
Well, I'm not privy to the detailed guidance. What I can tell you is that there is a focus on the tried and true basic measures. There's a discussion of the potential role of 2 additional strategies, vaccination and testing, and also the recognition that at this moment, none of those strategies can allow us to walk back in a significant way, things like masking, et cetera.
Yeah, and I think that you have to interpret. I mean, the guidance and CDC has been consistent around 6 feet, and I think that's based on pretty sound evidence in terms of transmission. Like I said, the unanswered question is the risk of transmission within 6 feet if both individuals are wearing masks, and for how long. That remains the topic of debate. That said, I mean, it's public health guidance, and we have viewed our multi-layered safety plans from the perspective of, if you are going to walk through that threshold or go through that threshold, is to boost your other measures, and that includes testing and reinforcing the things that work well.
Thank you.
Dr. Rubin, Dr. Coffin, thank you so much for being with us. I did want to actually follow up to that specific point about the other safety mitigation measures, and what within that context do you find to be, is there any one thing that stands out aside from the masking that is particularly important? And curious in particular about disinfection of surfaces and what the current science says about risk of contracting coronavirus from surfaces, and any comments too on ventilation that you might be able to share with us.
So I'll make a couple of comments.
Go ahead, and then I'll make a comment about a couple of things I've observed over the seasons.
So I think if you were going to lighten up on anything, lightening up on your environmental cleaning would be a place to do that. I was just told about a school district that has assigned a environmental service worker to go around and wipe the backs of chairs every time somebody stands up. And that's not a good use of time, nor does it address risk. I think the focus on keeping the environment generally clean on places that are on spots that are high touch is reasonable, but really underlying that the virus is not going to come off of the doorknob and cause an infection unless somebody's hand goes to from the doorknob to their nose, their mouth, or their eyes. And so moving the focus from environmental cleaning to hand cleaning is a reasonable way to shift that. Mask wearing, I think we understand is critically important, but there are so many opportunities to improve the quality of mask wearing. I think David and I both chuckle as we go through the hospital, seeing way too many noses hanging out of masks. Seeing people thinking that somehow their chin needs to be protected by a mask, or sometimes just wearing a really flimsy, thin mask. I still see people wearing bandanas and gaiters, not worthwhile. And so I think really upping the ante and emphasizing, when we say wear a mask, we want you to wear a good quality mask and we want you to wear it correctly. And then the last questions around ventilation. These are tough. They've been incredibly contentious. They are at the heart of a lot of disputes right now. What we know is that there are many, many examples of school systems who have been unable to do substantial changes to existing and often old HVAC systems, who have not put in air purifiers, who have not added UV light, who have not had windows open in -20-degree weather, who have successfully mitigated risk in schools by, again, really emphasizing the basics. And so again and again, you want to fatten up and toughen up your layers that you have the best control of, particularly if there's a layer of prevention you have less control about.
Yeah, I'll add a couple of my observations. I mean, I like to say that, 80-90% of all the protection comes from masking and spacing kids out, and then keeping sick people out of the school, right? Those are the backbone. And these other things are adjunctive, and hygiene's really important. The ventilation is really an adjunctive measure. You do it if you can, but it's not. We've never considered that to be the primary in what we do. And then I would, encourage you, the advantage you have right now is you're moving into warmer weather. Spacing kids out is going to be easier. You can move kids back outdoors and again and take advantage of outdoor space as you move into spring. And then declining incidence has always been your friend. Everything about the fall, starting later, what we went through in the fall was with the knowledge of the seasonality of this virus and that we were going to face this historical surge that was going to potentially overwhelm hospitals in many regions. And I have to tell you, as hard as it was in the Philadelphia region, we saw half the rates of what they saw in the Midwest. I'm actually proud of the way a lot of our communities handled themselves, how strong our schools worked. And as devastating as it was, we never exceeded the capacity or had to set up a field hospital in our backyard. And a lot of that is because of the smart decisions at the right moments about whether to go remote or not, and when to kind of pick it back up and keep moving forward. And so now you're facing the opportunity at declining incidence, your risk for error or your potential for error, even in a moment when people slip up, goes down because there's fewer people knocking at the door. And that's what creates such a great opportunity as we move into spring. You're much better about your protocols. But then you have this potential with warming weather, declining incidents to really kind of give yourself a fighting chance as you try to get back to normal school day, because eventually we're going to have to accommodate. And I think I'm one of those people that believes the worst is beyond us. It doesn't mean we're going to not see other moments where we see some bumps or continued cases in our community. But I believe the worst we have just encountered. And I'm hopeful that if we're smart about the next 6 to 8 weeks, we can continue to see the declines we need to kind of move into what should hopefully be a nice spring and summer.
Jen?
Hi, Dr. Rubin. Hi, Dr. Coffin. Thanks for being back here with us. I just have a couple of questions. I was listening to the Midwest. I just want to make sure that I also hear you correctly when you say that, when you're saying that they had some different experiences out there than we did, but they, as best I know, a lot of those areas also had different communities on the whole, when they had different guidelines and rules generally that may have also contributed to those instances and those rising incidences out in the Midwest, as, such as controversy over masks in schools, businesses opening, bars opening, restaurants opening. At least that's what I read when I just want to get away from the idea that it wasn't.
You're right to say you can't disentangle other things, but there were some there. You know, when you look at the Chicago area and what they went through, I don't think you can ascribe it to a lack of you know, they're not that dissimilar from our region in terms of composition. And so, you know, I do think we have to accept, I'm not laying at the doorstep of schools, certainly not.
Okay, yeah.
I'm not, I don't want to say that the schools are responsible for what happened, but I want to say that our vigilance as communities, you know, and in general, you know, when we went back and reviewed some of the data recently from the fall, we saw that within a couple weeks before Thanksgiving, that's when that moment hit, right after Halloween. People changed and transmission rates went down, and it's because I think people became more vigilant, and I think we did better than many other areas of the country, and we just want to continue on that trajectory. You know, take advantage of the opportunities in front of us, and then try to get back to what we see as normal, but do it in a thoughtful way by making incremental progress. That's all I'm saying.
Yeah, thank you. I knew that when you were saying it, there was several factors, but I just wanted to make sure that that message was also being carried through. And then, you know, as Dr. Grandy said in his opening remarks, you know, we've been walking and we've had tremendous success in our walking so far this year from a health and safety standpoint. This doesn't include all of them, but just going back to the precautions you talked about, we do the masks, we do the PPE and the hand washing. And I think we're going to hear a lot about our ventilation systems and that they're not antiquated, like maybe some other people or some other schools are dealing with. No sharing of items. And I believe the plan we're going to hear about is going to talk about keeping kids 6 feet at lunch. So since we've been walking so well, I guess I'm so excited to hear about this testing that's going to be done so regularly through your program. It seems like that is a piece that is being added that for no fault of anyone's has been missing prior till now, that could really add so much to what we've been contending with, this mystery of virus. And I know that as a board member, that's tremendously exciting for me to really hear Dr. Coffin talk about that and flush that out and make that available to us. So thank you, first of all, and thank you for talking about it with us and helping us who are not in the medical arena to understand that a little bit more. It sounds like from all of these different measures that we've talked about, that I don't think anyone's going to contest that we have in place, that, and with the planning, the weeks of planning we have coming up, that it may not be unreasonable to pick up our pace a little bit and start our running from what you're saying. And I think that's, it's great. It's great news. It's really great news. I wanted to know if each of you could talk a little bit about who you were before COVID came. To most of us, we know you as Dr. Coffin and Dr. Rubin, who are from the CHOP Policy Lab talking to us about COVID, but I'm sure you were people before that. I wonder if you could talk to us a little bit about what you do and help the lay people, which is me, understand some of your experiences and how you came to be part of the CHOP Policy Lab on COVID for us during this pandemic.
Susan, do you want to take that first?
I'll take it. I'll leave you to do cleanup. I'm a pediatric infectious disease physician. I've been working at CHOP for over 25 years. For the past probably 20 years, 15 to 20 years, my area of expertise and specialization has been infection control and hospital epidemiology, which made me, prior to COVID, the last person that somebody would get excited about talking to at a cocktail party when I said my work, but has all of a sudden become interesting to people. And so this is really, I've spent a lot of time working on pandemic influenza planning. I work in the city Department of Public Health, initially in their healthcare infections branch, and now just more broadly, transmission of viruses, burdens of disease in communities, interrupting transmission. These are the things that, for better or for worse, I've spent a lot of time thinking about. And for better or for worse, this is, for me, a really, interesting, challenging time to kind of flex my intellectual muscles to address a very new and different challenge. So.
Yeah, and I'll add that, my background, I'm actually, I'm a general pediatrician. I still see patients as well at one of our CHOP practices. But I have a background in epidemiology. I was trained in epidemiology at Penn. I also was board certified in child abuse pediatrics and spent a lot of time in my early part of my career working with the child welfare system before moving into broader issues of population health, which really looks at the organization of our services for children across the region. Certainly tackles issues of health equity, and also the intersection of our programs and the policies we have for children. A lot of my work early has been over my career around what I call local area variation. That if you want to understand what's happening with children and families, you need to look very locally. And the reason we started this effort back in March and April was because national models and state models actually did not tell the story for every community, and broad policy action did not give the flexibility for communities like your own to make individual decisions about policy, when to open schools, how quickly to open for certain types of services, when to resume normal activities, sports, all these other things. Our county level models have been very helpful to try to achieve a more balanced approach for making those decisions that give a lot of local communities the data that they need. Our school guidance has tried to provide a middle ground of what we know and what we don't know, to try to help people navigate what are very uncertain, a very uncertain time. And then beginning around November, we pivoted to not only creating the guidance, but actually adding programs we thought that would create, like you said, an additional layer. What we like to call our testing program. People, we're thrilled about vaccinations, and they can't come quick enough. But to not underestimate the value of testing as going on offense against this virus, and adding a really strong mitigation layer. So all the stuff we've worked on is really sort of the reflection of a career of doing this work, and it's been a terrific reward to work with my partners in infectious disease like Dr. Coffin along the way.
Right. Any other questions? Okay. So it sounds like, again, I know that this is a very difficult needle to thread in terms of laying out a series of steps. But from what I'm hearing, if we were to continue to see significant reductions in our cases, we get closer to spring, launch a testing program, there could be a window there to start to look at some increased densities if we're seeing lots of positive signals. It sounds like in the interim, there'll be some insights maybe that you all develop from some of the testing that happens out of school for kids in quarantine, to see to the extent that we're not seeing transmission that somehow we thought wasn't occurring, but confirming that it's not occurring.
I think the answer is yes. We remain optimistic and hopeful. I think that's the message here tonight. But it requires patience and always, COVID's proven to us several times just to be nimble and to always be looking for the data that you didn't expect.
Yeah.
And so, but I do think there's a lot of optimism from our team tonight that there are windows of opportunity opening up as you move to spring.
Great.
I
Well,
think just always have the plan B. As you move forward with your plan A, make sure you don't abandon, the plan B. We taught ourselves that lesson time and time again, that your backup plans can and will be useful to you.
that we know. Trust me.
Yes, the whole universe has learned that lesson.
Yeah, exactly. So, the good news is I think our plan B in some sense is what we have now that's been very robust for us. And I think plan B is about to get better with testing. And so we will always have that at our disposal. So thank you very much. I'm going to let you guys go before we have our administrative team come on, unless for some reason you decide you want to sit for a very long discussion, which I don't imagine you do. But we very much appreciate you sharing your time with us.
Good luck, everyone.
Thank you.
Thank you.
All right.
Thank you.
Okay, let me introduce then Dr. Citarelli-Jones, who will kick off our presentation from our team about elementary transition.
Good evening, and thank you for having us here tonight. I'm going to take you through several slides, and the team, I'm tall, AJ, and the team that I have with me today has been part of the investigation team that has been taking a look at what our options are moving forward. And so I'm going to introduce the team to you and go around. So we have Gabe Savage, who is the principal of West Elementary School. We have Megan McCullough, who is our director of behavioral services. And we have Al Heinley, who is our principal at NPE, that elementary school. And we have Angela Tuck, who is the principal of SRS Elementary School. And right behind me, we have Nora Wheeler, who is our director of instructional technology. And right behind me is Gina Ross, who is our director of student services and acts as a pandemic coordinator for our pandemic learning team. And I'm Denise Citarelli-Jones. I'm the director of education. So in consideration of returning the elementary students to a full in-person learning model, the school board tasked the administration, and specifically this team, with an investigation of the feasibility of such a change, along with a timeline should the school board decide to make a change. So tonight, this investigation team will share the work of our investigation to help inform parental decisions on an upcoming survey. The work in these areas is ongoing, and as we will show later in our timeline, will make it possible to transition to a full in-person learning model should the school board decide to make such a change. What we're looking at are two options possible for the WSSD elementary learning model outside of the online academy, which will not change. Option one is a change to full in-person learning for K-5 students with an increase of student in-person days from 2 full days to 4.5 days in person with no less than 3 feet of social distance. Option two is to remain in the current hybrid model with 50% of the students at one time in cohorts learning for 2 full days in school, 2 full days of Zoom learning, and 1 asynchronous day with 6-foot social distance. So I want to take you through the full in-person model, presuming that the general public understands what the current model is. So I will not be sharing what the current model is. I really will be focusing, and the team will be focusing on what the full in-person model might look like. In this model, students would attend school for full days, Monday, Tuesday, Thursday, and Friday, and a half a day on Wednesdays. That would happen in the morning. And that is where we get our 4.5 days of total in-person learning, full instruction. The daily schedule for full in-person will likely stay the same. Right now, we're investigating our options for our specials classes. So that's not something we can announce at this time. We need to do a little more work with that and the Elementary Education Committee meeting. In fact, we have a meeting this Wednesday, and we'll be discussing those. Also, it should be noted that the instructional minutes between the full in-person and the online academy learning models will be equitable. This is important for point number 3, which is an adherence to the learning outcomes. The learning outcomes are those standards that are both mandated by the state and that we have had in our programs all along. Those standards and learning outcomes will continue to be similarly paced and achieved between both the online academy and a full in-person model. I want to talk about Wednesdays as soon as this advances. There we go. For the Wednesdays, we are looking at a morning of in-person learning. During that time, students would attend that half day and they would follow the half-day schedule. It's the same schedule we would do if we had an early dismissal or another type of half day. The AM and PM kindergarten students still attend. I really want to stress that. I've had some parents reach out and say, if you're just in the morning, then only AM elementary will come in. That is not true. Both the AM and the PM kindergartners will come in. Also, because we leave at the half-day mark, the lunch is not served on Wednesdays. The second half of Wednesday is asynchronous learning at home. This is what our students are very used to doing, asynchronous learning at home. They will continue to complete work assignments through Google Classroom and Seesaw, K2 for Seesaw and 3 to 5 for Google Classroom. This is also where our teachers will attend the same types of meetings that they've been attending now for our asynchronous Wednesdays. These are the critical IEP meetings, the professional development sessions we're offering. This is their technology time. This is the time for them to work in collaborative planning. If you think back to a slide ago when I said that online academy and the full in-person learning, what's hybrid learning now, those teachers are staying on pace. Those teachers are talking about and deciding on learning outcomes common across both modalities. And they have to talk about how they can stay paced with one another so that when we graduate a class of 3rd graders, let's say, they are in significantly the same place as they would be if they had been together, so that when they come into 4th grade, we don't have differences between the 2 different modalities of learning. Lastly, we need to keep Wednesdays as an option in the event that the state does not waive the PSSA. The state did not waive the Keystone. So if they stay on trend, they will not waive the PSSA. We will need to test those 3rd, 4th, and 5th graders who are in the online academy, and there is no test at home option. That means we will need to bring kids into the buildings in order to do testing, and we will need asynchronous time in order to do that, because then we would have every student in the building, and that's not something we can guarantee a 3-foot social distance. So that's built into that time. In fact, we may even need to do full asynchronous days. We'll see what happens when we get there. In terms of attendance and Zoom, what we're looking at is that students with a need to quarantine or students with a doctor's note for an illness beyond 3 days, so past 3 days, would be permitted to attend classes via Zoom. When we say attend classes, we are saying for core instruction. However, some parents may prefer for their students to Zoom for the entire time, and this will be dealt with on a case-by-case basis. But with a student who has an illness under that 3-day mark, we would revert to what we have done in the past, which is that our teachers will have support for those students typical of those absences that happened in years prior. So that is a little bit of a change in terms of what we're used to, and it will decrease the amount of time that students will need to be learning via Zoom. So that's going to be an important component that the administration feels pretty strongly about in order to guarantee that we're going to have really concentrated teaching that happens in the classroom, and also to guarantee that students are doing as much of their learning in person as possible. Oh, sorry. You're changing and I'm changing. I'm going to turn this over now to Nora Wheeler, who's going to talk a little bit about technology in the classroom.
Thank you, Denise, and good evening. I think we all know right now the integration of technology has been critical, and it remains so even when students come back into the classroom. And so this plan would ask for students to bring charged devices to schools daily in order to access activities integrated into different subjects throughout the day. Most importantly, the continued integration of Seesaw and Google Classroom, as Denise said, which are our management systems that we use in K2 and 3.5. Of course, we envision teachers will be able to increasingly so go back to some of the traditional methodologies and activities that merely require a book, a piece of paper, a pencil, a crayon, all of which are extremely important in the elementary experience, and I would argue up through high school as well. But we want to continue to provide student choice and voice that is available through innovative options, as well as to be able to continue to integrate the digital tools that we've been using quite well throughout this. And I think more and more see the value they will have even beyond the pandemic. We have the ability to collaborate digitally, where we don't have our kids necessarily in small groups right now, but technology allows us to have kids continue to collaborate through the device that they have. In addition, we want to continue to limit the use of shared materials, whether those be manipulatives, printed resources, or assignments being done in partners and in small groups. And the iPads and Chromebooks allow us to do that and make those possible in this environment. So that is key to why we see bringing those devices to school each day. Not the charger, but the actual devices to school every day is going to be critically important as we move forward. At this point, I'm going to turn things over to Dr. McCullough.
Thanks, Nora. Good evening. I'm Dr. Megan McCullough, and I'm just going to talk a little bit from the student service perspective. Okay, AJ, can you advance? Thank you. Student services, just as Dr. Citarelli-Jones was saying, aims to keep our learning outcomes the same and to minimize the disruption for students, particularly who struggle with transition and change. So it's important to know that 504s, IEPs, and GIEPs will continue to be implemented. However, the one thing that we do need to have considered is that if we were to return to all in-person learning, there might have to be some changes to case managers or to related service providers simply because of scheduling. We are at this point able to keep personal care assistance or one-to-one assistance assignments for students the same. They will remain unchanged. And we will be able to implement PASA through the DLM through May, implementation for that, which is the adapted PASA testing or PSSA testing. We'll be able to implement through May, and we'll be able to do in-person testing for that, even if a family were to choose to go to the online academy. So with that, I'm going to turn it over to my co-director, Gina Ross, who's going to talk a little bit about health and safety.
Hi, good evening. As we were tasked with the goal of looking at what 100% all back in for 4.5 days would look like, we really sat down and looked at the health and safety plan and the health and safety assurances. So the next couple of slides, I'll be able to review what that would look like in that model. The first is that we have clearly said that students will be no less than 3 feet distance. However, there are some caveats to that. Snack, mask breaks, and lunch would remain at a 6 foot. Anytime students needed to remove their masks, they would then be placed at 6 feet rather than the 3 feet. In terms of cohorting at recess time, we talked a lot, a couple of board meetings ago when we first looked at the health and safety plan about what recess would look like. Students will continue to be cohorted at different areas on the recess playgrounds based on their classroom. So before they were A or B by their classroom, now it would just be a larger section. the elementary principals and I have been looking very closely at how do we need to manipulate that environment. So our blacktop tends to be our smaller area. Looking at, can we cone off, can we barricade certain areas to make that larger? But protocols will still be in place. Balls will be assigned to different cohorts. They'll be sanitized in between use, things like that. In terms of special areas, this is one area that we're still debating, still looking at, and a lot of it will come down to the schedule that's finally developed as we move forward. Special areas may be held within those specials classes, or they may come to the homeroom areas. The other option, as Dr. Rubin said, we're coming into warmer weather. So again, you'll see tents on grounds, and we'll have that option to have classes outside, such as PE, music, things like that. The next area deals with the hallways and the stairways. We have previously indicated, and we will continue to indicate, that we will be staggering schedules to ensure that there are less number of individuals in the hallway or stairway at any given time. One thing that we're currently working on is the protocols for drop off and pickup. We know that the vast majority of our parents have moved away from the busing and to dropping their students off, and that has caused a backup. As we come together between A and B cohort, that will increase the number of cars in line. So we're going to be looking very closely at how can we schedule that and ensure that we are not backing up into the public streets. Additionally, we'll be looking at when students are coming in. So currently, students come in our space 6 feet. We'll be looking at expanding the areas that we utilize, and students will be spaced 3 feet apart, just as they would be in the classroom. Another area is talking about additional PPE. So you heard Dr. Rubin talk about if you're decreasing here, how can you bolster there? Students will continue to have access to masks, to shields, to hand sanitizer, to disinfecting wipes, sprays for staff. Same thing for staff members will have access to that. However, the district is currently working to acquire clear cubbies so that students can have them stationed on their desk as an added layer. We do have other PPE that is available to our high-risk students and staff, and those conversations have been going on with building administration and with our HR office, and we would continue to have those conversations. Finally, I want to talk about the topic that Dr. Rubin and Dr. Kaufman spent a lot of time talking about. As we move forward, looking at any type of more students coming back, we will be continuing to contact trace. So currently, when there is a positive case and that student has been within the district, whether it be practice, an activity, or school, within the 48 hours prior to their symptom onset or test positive results, that we contact trace and we identify if there are any close contacts, and that's when the community and the close contacts receive letters. We will continue that. We will also continue that if you are an individual who is either a probable or a positive case, you will isolate for 10 days. That is the current recommendation. The second side of that is quarantining. So if you are a close contact, the district is currently implementing quarantining for 14 days. There is an alternative approach that Dr. Rubin and Dr. Kaufman talked about where you can test at day 7 and then you can come back. As the district moves forward with the BINAX testing, which we expect to have in place within the next 3 weeks, our nursing department will be finally the 3-tier tested and complete that evaluation, and then we will be able to move forward. We're working on the plans for that. Once we're able to test individuals, then we as a district may make the decision to move to the alternative quarantine. However, at this point, we're staying at 14 days. As I said, we're moving towards the BINAX testing. The BINAX testing is a rapid test. It is not at the level of a PCR, but is a good indicator. So we are looking to start with staff, and we hope, as Dr. Kaufman said, that we have a high number of staff members participating, because that's how this can be most successful. We would like to start there, and then we would like to expand potentially to our athletes. There were other groups that Dr. Kaufman spoke about, and they would be down the line as a possible consideration, but it's not where we're starting right away. We know that this will be a major undertaking, and our nursing department is ready for it, and they're planning for it, and we will do, as I indicated, expect to have that in place in the next 3 to 4 weeks. I will turn it over to Ferg Abbott to further discuss.
Thank you. So as we have been doing, we will continue to provide hand sanitizer, disinfectant, and alcohol wipes at all the locations. So if you go into any one of our classrooms, any one of our offices, you will see those three there. Alcohol wipes are in a tub. Hand sanitizer is in a bottle, similar to you as a board member, what you have in front of you, except much larger. And then also the disinfectant, which are in squirt bottles in all locations. We are cleaning and disinfecting frequently touched surfaces regularly. In each one of our schools, there will be somebody going around during the day, spraying down a surfaces that are frequently touched. Also at night, in addition to our normal cleaning process, there's staff that's here at night that are charged with cleaning the buildings thoroughly after each academic day. They are cleaning the surfaces, and then they will also squirt down the frequently touched surfaces with disinfectant. Twice weekly, we do whole building disinfections. What that involves is using an electric static sprayer. And what this device will do is it will charge the particles. It will charge the disinfectant that comes out so that that disinfectant is attracted to the surface. So every Wednesday night and every Friday night, they go around with these units, spraying down all classrooms, all areas that can be accessed. And we encourage all our staff to move papers aside on those evenings and on every evening so that we can spray those surfaces down. We're also doing that on the outside playground equipment. During the day, the custodians will go out there at least once a day with these electrostatic sprayers to spray down the equipment. The gyms, the jungle gyms we have outside. Drinking fountains are closed. Our bottle fillers are open, but the drinking fountains are closed. Anything that's shared, whether it be materials or play toys, they're being disinfected after each use. We monitor the building climate conditions daily. Between the HVAC technician that the school district employs and myself, we are looking at units throughout the district to make sure that things are operating effectively. Now, we always rely on staff to tell us if something's not working right. It's too cold, it's too warm, but we're going through and monitoring the levels, such as humidity level, although things are dry right now. We're monitoring how much fresh air is coming into the systems as well. We have increased our fresh air intake by adjusting these HVAC systems and opening windows when the outside weather permits. We can adjust these HVAC units either manually, or the vast majority of them are adjusted via the computer to allow more fresh air to come in. And if you've done research, the more fresh air, the better. The more air circulation, the better. Now, I'd like to get into a little bit of the weeds on an HVAC unit in a classroom. You have an individual unit typically that controls the air in a classroom. We also have systems that operate on a wider scale that bring in fresh air. So there isn't just one unit controlling the climate in this room, for example. There are a couple units. In one of our buildings, we actually have 3 units that do that. So it's not just one, and I say that because of that fresh air coming in. And also, we've increased the amount of air circulation that takes place. We've increased the ventilation by turning things on earlier, keeping them on later, So that way we're creating air circulation before people arrive to the building and once they leave. We've had systems in the past that didn't run all year long because we didn't need them to run. They're running now. And in our large area units, we're increasing the filter rate. We're putting in a denser filter. Now, I will say, if you've done research on this, you got to be careful with that. Because if you increase the medium of a filter, it's harder to push air through it. And one of the keys here is to have high air circulation. So we're monitoring those. As we put them in, we monitor them. Last summer, also, the HVAC technician and myself went through every building. We went through every different type of room we had in every one of our buildings to take a look at those areas that, to take a look at what's happening in each type of area. In some of our smaller areas, we may not have had enough ventilation. We've added HEPA units in those areas. Coming this Wednesday, because we are considering this change to 100% in, we have a third-party vendor coming out to take a look at this possible transition and provide suggestions, if any, for what we would do. Thanks.
Thank you, Fred. So I want to talk a little bit about the fact that this implies change. And in terms of the education plan, there are certainly changes that will have to be made, that the teachers will have to make certainly in their classrooms. And we understand that there are changes that will be needed for things like space and safety, but even our instructional methodologies, how we have small group instruction will have to change. When we have large groups, how we distribute materials. These are things that teachers have to think and rethink and plan and test. We have to look about how do we do active learning? How are we going to give our tests? How are we going to give our quizzes? How are we going to do our project-based assessments? How will we do science labs? We also have to look at classroom library book sharing. That is a really big cornerstone of our ELA program in our classrooms. We have to think about specials and so much more. When we talk about it's not just flipping a switch and that it's easy. Every nuance and decision that we've made in the 100 years that lie before this point, those were decisions that were made over time, that were tested and retested, and we finally honed it into a perfect craft. We don't just immediately come up with the best new ways to do it on research that does not exist on how to do pandemic learning. So what we're really asking for as an administrative staff is that everybody exercises a little bit of patience as we continually brainstorm and evaluate these problems to create solutions. And that is not to say that it matters in the timeline. Whenever we would come back to full in-person learning during this pandemic time, we will have to solve these problems, and we will solve them whenever that timeline would happen. But I just really encourage everybody to have patience when it comes time, because our teachers really are problem solving deeply and also at the speed of light. And that's a big ask. I'm going to share with you the timeline. This is what we were tasked with, and I think the words were sort of an aggressive timeline. What could be the most aggressive timeline if the school board decided to move to a full in-person model? And the following dates that I'm going to show you really represent our most feasible timeline for the necessary building, education, and transportation preparedness actions. We have not compromised on quality. It was important that we tee us up for success rather than rushing and then potentially having flaws in the plan. Right now, we're looking at a parent survey that will go out starting tomorrow. That is a survey where parents will be making a choice. It is not a preliminary survey. As Dr. Grandy talked about before, we are changing it to a binding decision-making survey. That ends on February 15th. After that, February 16th through the 19th, you can see the short window there. Feedback, enrollment, and transportation data will be analyzed. This is a big decision-making data point for the school board. So to have that information earlier will help them with their decision. On February 22nd, there is a school board meeting. Two things could happen at that school board meeting. Either the school board would bring forth a motion to move from the hybrid learning model to a full in-person model, or the school board may decide not to make a change at this time, and then no more motion would come forward at that time. In terms of our education and health and safety plan work, there is work in progress. There is work that began as soon as we were tasked with this. There was work that continued today, will continue tomorrow, will continue through February 19th. We keep working on this. There's a certain sense of inevitability about students coming back to school at some point. We have to be prepared for this. Last year, March of 2020, we were not prepared. This year, March of 2021, we can be more prepared. It's a matter of proactive actions. So we are continuing to look at our health and safety in the classrooms, the shared spaces, the hallways, the buses. How can we optimize it? We are going to analyze our schedules to make sure that we are staying on point with our learning outcomes, one of the most important things that we can do here. We are looking at our procedures for lunch, recess, arrival, and dismissal, and we're running them through tests. Remember that any procedure we come up with is theoretical. We don't know how it will work until we begin to do it. And as we do it, we refine immediately. It's a constant scientific inquiry into how we do things well. The last is that we have to have ongoing meetings between teachers, staff, administration for these planning and procedures. The more voices we can have, the smoother it goes. It's the reason we have an elementary education committee that has been in place for months so that we can immediately have feedback from teachers and so that they feel they have a voice. In fact, this group is probably one of the best, most healthy groups I've ever been a part of. We can really get down and dirty with what we have to think about and problem solve with. And this is a group that just steps right up to the plate every single time. Now, in terms of an assignment of teachers, this is really important for people to understand. And so I'm just going to put it right out there. If there is a school board vote to change to full in-person learning, students that move from the online academy to the full in-person model, or who move from full in-person to the online academy, meaning they're switching their modality, in that case, that child would have a teacher change. Families that do not change their enrollment would only need to change teachers if there were significant shifts in class size, and that could happen. We can't stand here and say it won't happen. It could happen, and we feel that it's important to put that piece of it out there. There are no guarantees for that. Secondly, I just want to put an eye on the teachers again. Our teachers may also have a new assignment. They could have a new assignment where they are changing their students that they had before. And so it's important to know anything could happen when we start to see the data come back from the parent choice survey. We may find that we have to hire. And hiring is a process. Our director of operations is also our HR director, and he can tell you what we're looking at is 2 to 3 weeks to ensure teacher quality. Wallingford-Swarthmore has some of the best teachers around. We want to make sure that every student is getting the best teacher around. That takes time to hire. Also, there's planning and transition time that is essential in cases where teachers are changing assignment and their students mid-year. So it's something that we have to make sure that our timeline allows for. I'm going to continue into March. In the early parts of March, we would be communicating to parents any transportation issues, if there has to be a change of teaching assignment, any of the transition day procedures, things like arrival, dismissal, what will happen at recess, lunch, that sort of communication would be going out to parents. Also, that's time for our final teaching and learning preparation. That includes lesson plans. It will be like the first week of school in many cases, where we'll be doing procedures again with the students. So we want to make sure that we're doing that well. We'll be looking at technology surfaces. We might be looking at reconfiguring the tech in classrooms. All that stuff would happen in the beginning of March. Now, these are important dates, March 15th, 16th, and 17th, the 17th being a Wednesday, which is already an asynchronous day in the schedule. Our transition days for building preparation. It can't go understated. There's a reason in August, no kids are in the building. We have to actually move the furniture and get ready for those kids coming in, not something you can do with bodies in the building. So to reconfigure that, to put stickers in the hallway, to move the desks, to move the cafeteria tables, to set up the tents for recess, that sort of work would happen over those 3 days for building preparation. Then on March the 18th, which is a Thursday, we would be recommending that would be the first day of full in-person learning. Students would come in on Thursday and Friday, and then the full next week. I believe there are parent-teacher conferences, so it might only be the first 3 days, and then we would move into spring break. That's an aggressive timeline, but it's a timeline we think we can get to if the school board decides to go for a vote for full in-person learning. And at this point, if you have questions for the investigation team, school board members, we can do our best to answer them.
Thank you, everyone, for all of those details. I'm going to open things up for board members. I'll look on my Zoom list and look in front of me. I see Matt.
So I have two quick questions, one for you, Dr. Citarelli-Jones, and I think one for Ms. Ross. So Dr. Citarelli-Jones, can you give us some sense of where our elementary schools are in their curriculum compared to a normal year? I know there's been a lot of transition. It's, different teaching modalities, and I'm just wondering where we are this year compared to where we would be in a typical year.
Yeah, what we're doing now in the curriculum office is we're starting to gather that data. What we use is a combination of benchmark data, standardized type of data, and we also use our own tests, our own internal measurement for that thing. So we have something called Easy CBM. That's one of our benchmark tests. The second application of Easy CBM is coming up. That helps us because it tells us where kids begin, where they are at the mid-year. And that helps us to measure against last year and also to measure within the current year. So when we have that data, we'll have a little better understanding of where we stand benchmark-wise.
Okay.
As for our own internal tests, our students are doing remarkably well. What we have in place is sort of our scope and sequence of skills, let's say, and some of this is sort of deductive reasoning. I mean, I'll go ahead and say that. But when we know, for example, that we're going to hit fractions at a certain point of the third grade year, our teachers wouldn't push kids to fractions, for example, if they weren't ready, if they didn't have the requisite skills to reach fractions. We are at the same point in our curriculum as we always have been, with no sense of we have to slow things down for our students. Where we have students who are not doing well, potentially in this modality, these are students we have to get our eyes on, and we have to work individually with them so that we are not doing some broad stroke statements about students not doing well. There are students who might not be doing well, and they might not have done well anyway, or it could be the pandemic learning model. And we have to do our due diligence to circle the wagons around those students. The curriculum office has been working hard to thinking about ways that we can ameliorate that regardless of the school board vote and also through the summer. So we'll be talking about plans in the next probably 2 to 3 weeks for that sort of work. But we feel really confident in where we are right now. Our teachers report confidence in where they are now. A few of them volunteered to come and talk about it. But since this isn't a data report, we didn't go there yet.
That's great and reassuring. Thank you.
Mm-hmm.
And then Gina, you had in your presentation had talked again a couple of times about no matter what, we'll achieve the 3-foot distance if we were to go in this direction. That would be, our new threshold for the closest we would put students together. If we were to just, assuming nobody switches from online to cohort model, if we were to just put cohort A and B together right now, what kind of distance will we be looking at in general? I mean, I know it's going to change class to class.
Absolutely. So Mr. Abbott actually did this, but I can speak to it. We went out and reassessed each of the rooms and looked. We are looking at somewhere between 3 and 3.5 feet. It really varies, not based on the classroom, based on the numbers, but that is as we sit today. If the two cohorts were to come together, we're not quite sure what that will look like once we see if there is flip.
Okay, thank you.
That's center desk.
Yes, so when we measured, it is center to desk. So it is 3 feet nose to nose.
Okay.
Actually, I'm going to go back and forth here. Unless, did you, is a follow-up on that?
It was from Ms. Ross.
All right, and then, no, go for it, and then I'll go to Jerry next on Zoom.
Yes.
Okay. And the seating, everyone facing forward.
We can't hear her.
Oh, your mic's off.
Let me start that over. Ms. Ross, masks still at recess?
Yes, masks will be utilized at recess.
And everybody facing forward in their classrooms?
Yes, in order to utilize the space to our best ability, we will need to maintain that.
Okay, thank you so much.
No worries.
Jerry.
Given the timeline that was shared and the plans for the rapid testing, can we assure that all the rapid testing will be fully in place and the first round of tests for the teachers will have occurred prior to the 18th?
That is our goal. As I indicated, our nursing staff is in the process of completing the 3-step trainings. We do anticipate that the pandemic coordination team will be working to identify the protocols that we'll be utilizing, and then we are looking to implement as quickly as possible. So that is certainly our goal, barring any unseen barriers.
Okay, thank you.
Kelly?
Another question for you, Gina.
I'll just stay up here.
Yeah, you might be there for a while. It's 2 parts, actually. The first part was, I just lost that first part. So I'll start with this. Actually, found it. So if first part was if a person were to test positive in a classroom where we are at that 3.5 foot distance, do you actually have to quarantine the whole class, or are you quarantining, you're going to have more people within that 6 foot distance, or what?
Correct. So at this point, there is no changed guidance that would say a close contact would move to 3 feet versus 6 feet. So we would anticipate that we would be looking at the close contacts and then quarantining those individuals. That does not necessarily mean a whole class. So for example, if the teacher is not moving about the class and class is not having small group instruction that's floating in and out, that we can't go back and contact trace it, then we might need to close an entire classroom. However, we would be working very closely with the teams to ensure that we would only have to look at those within the 6 feet for more than 15 minutes.
And if we were to make this change, are we still able to maintain the 6 foot distance, teacher to student? And I'm assuming we would be still looking at the adults, any of the adults in the building, we would still be asking them to stay at the 6 foot distance from one another.
So Dr. Rubin hadn't mentioned it tonight, but I have heard him speak to this previously, where the recommendation will continue to be 6 feet for adults. That 3 feet would be for students.
Okay, thank you.
Others? Hang on, let me then, I have a couple things.
For me?
Yeah,
Okay,
sorry.
I thought I was okay then.
You had mentioned the clear cubbies. Can you just describe what you mean by that?
Yes, so if you think to a traditional cubby that we've utilized for like study carrels, things like that, we had purchased them for students and staff who are at high risk or students with complex needs. And so we look to expand that to every elementary student. So it comes 3 sides and can be adhered to the desk. It does not come out to the side of the individual. So we've talked about some of the lean in instruction for times.
Great, thank you. So you're anticipating those like across the board for students?
Yes.
Okay.
And we are in process of acquiring them. We have confirmation of the order.
Okay. And could you just, I know you mentioned it, but if you don't mind just summarizing again what our current approach that we would then apply in this setting of how we do contact tracing in the building. So what is the process that the district is going through when there's a case?
So when we are made aware of either a positive COVID case or a probable COVID case, and a probable case, that identification is an individual with symptoms that has had contact. So if there's a family member who is positive and now that student or individual is exhibiting symptoms, they're identified as probable. So either one of those, we are made aware of that either via an email, a phone call, or our symptom tracker. We're having conversations to identify the onset of the symptoms or the date of the test. So when that is determined, we look back 48 hours, which is what the CDC, the Department of Health, and the Chester County Health Department have all indicated is the window. If the individual has been within our environment, as I said, whether it be school, an event, or a sporting activity, then we begin the contact tracing. That contact tracing consists of conversations with either the student themselves, depending on their age, with the parent, with the staff that may have been involved, to determine was there any breach of our 6-foot protocols, or were they involved in any type of contact sport or anything else. When we identify that close contact list, we then send out the community letter and we send out the close contact quarantine letter. And so those individuals are then quarantined for 14 days. Our nursing department does do their best to stay in touch with all of the quarantined individuals to get updates, because then if they begin to exhibit symptoms, we would then ask them to have a test and then would continue the process with them from there.
And I know there's been questions in the past about, like, if a parent wants to know how many cases there have been in a building and they're looking at our dashboards that are online.
Mm-hmm.
So that would be any student who tests positive that was on campus in any type of activity
Yes.
in that 48-hour period of contagiousness.
That is correct. It does not include any individual who is in the online academy and not in another activity. Those very clear guidelines can be found in the PDE website under the attestation page. That has been very clearly outlined.
Okay, thank you.
You're welcome.
I think I'll go to Jen, and then I know Marilyn's got her hand up.
Thank you, Dr. Brandy. I had follow-up questions for Dr. Citarelli-Jones and for Ms. Wheeler, I think. Dr. Citarelli-Jones, I'm looking at the slide that you put out, and I'm looking specifically at the timeline for March, between March 1st and 12th. I'm wondering, I mean, it seems somewhat long.
Sorry, AJ.
Seems somewhat like next one, I think.
Okay. This is the stuff we continue to do. Here's March.
It's actually your last slide. There you go.
Yeah.
It seems like somewhat of a long period of time to do those tasks. And obviously I'm not behind the scenes, so I hope that doesn't sound offensive in any way. But when I'm looking at that, I'm just wondering if there's a way to push it forward, simply because if our board decides to do this, you know, it is February 8th. And while I can appreciate how much time and planning, I mean, it's evident just listening to all of you would go into this, time is important. And that the 18th is it 4 or 5 weeks away?
Yeah.
Do we really need from the 1st to the 12th to do those particular tasks?
Well, and so, and thank you for asking the question. I mean, I've reduced it down to 2 bullet points, right? But that communication piece can sometimes be back and forth, right? So there's transportation, there's teacher assignments, there's then things that could come back to us, then readjustments that we'd have to make. Really talking about 10 business days at the end of the day when we're talking about that kind of thing, even fewer actually. And final teacher and learning preparation, we can't know how quickly we can move on that kind of pivot until we're in it. And what we wanted to make sure we did was not shortchange that process by rushing forward. I think one of the things that is important to the investigation team, certainly to the curriculum office, is that this goes well. Our teachers have been upended, and our students really, frankly, for that matter, so many times that if we go in with something that feels half-baked to everybody, it's not going to give us the support that we need to move forward. And we're asking teachers to be troopers for month number 12 and 13 and 14. And I just, again, I keep saying it can't be understated. Could that timeline go up? In the moment, we might be able to say, we have this, we can go up by 1 week, but I wouldn't want to promise that's possible now.
And then we still have the 15th to 17th, which might not,
Well, so, but
are
that's
they
actually,
movable?
yeah, that's actually the building preparation, right? So that's we need everybody out so that we can move. What we have to do in that classroom is we have to take everything out of the classroom to make that possible. Where are we storing it, right? Where are the kids going to get books if shelves are gone? How are we going to have little ones? No, you can't walk past here on your desk. If you have to get up and sharpen your pencil or blow your nose, how are you going to do that? So we have to do all of that spacing, marking, that sort of thing. And we've already, Wednesday is asynchronous. So the 2 days that we would have of doing that, the Wednesday being asynchronous, could we bump it up and have Wednesday be the start again? Possibly.
Okay.
Yeah.
All right. I can appreciate the physical lift of the 15th to 17th. I was just sort of wondering if everything could be condensed, but.
Yeah.
I guess we
And
need
actually,
to
while
know.
I'm at the podium, I wanted to add something for the question that you asked, Kelly. The 6-foot social distance between the teacher and the student, that has always been problematic. You know, our teachers, especially, and the principals will tell you this, especially at the elementary school, it's close, you know, and physically close. That's how our teachers work. Kids gather on the rug and teachers sit in the rocking chair and they read the stories and they talk about it. They move in and out of groups fluidly. We have teachers who will bring kids to the kidney table and they'll work with small groups, especially so that we can do remediation and extension. They're always working with small kids. This idea of keeping 6 foot between the teachers and the students is almost as physically unappealing to our teachers as like swallowing bad medicine. So they can do it, they will do it, but it will change the dynamic of the classroom. It has changed the dynamic of the classroom. It is sort of the unfortunate part. I've heard some school districts that are putting, you know, like plastic up in front of them. These aren't tellers at a bank, you know, these are teachers who want to be able to be right around their kids. And so I want you to have the accurate picture of what this looks like even now. It doesn't change for full in person. It's still the same 6 foot, but I just, people aren't in the classroom, so you're not seeing it, but I just want you to understand kind of the actual picture of what it looks like. It's hard for our teachers to not be able to gather those kids in the way they would like to.
And I was going to ask you, Dr. Sitarelli-Jones, when will we know if the PSSAs are happening or not?
I know this is being televised and stuff like that, so I don't want to say anything disparaging about PDE. Ultimately, I don't want to. However, they're really slow to give us the information that we need. We were holding our breath for Keystones, hoping that there would be some last minute reprieve, and there wasn't. PSSAs is a really big undertaking that involves a lot of grades. And I think that's one half of it. So again, you have factions. I think the other half of it is that there is no testing data from last year. So if I'm PDE, I'm thinking, can we go 2 years without this essential benchmarking data that we use to measure the performance of our schools, the performance of our teachers? That's their evaluation goes into that. So you're going to have the group that says, but we need to get these PSSAs going. We can't do 2 years without them. And another who says, why are we rushing this? And we know that will force buildings to put kids together, sort of in reasons do we really need? And I'm sure there are factions battling it as we speak.
Okay.
It could take it right up to the minute. We'll prepare as if it's happening.
Okay. And if it does happen, at least with the Keystones, does it typically happen on the same timeline? Correct me if I'm wrong, but I think I recall it being like the 1st and 2nd week in April for PSSAs.
Well, they run over the course of 4 weeks, I believe. I think our principals might be able to give better, but especially for 4th grade who tests in reading and math and science. So they're over that time, and we have within that window to test. So how we test and when we test matters. There are school districts that kids test all day long, and then other districts that have them do half days of testing because we think about testing fatigue. We think about students just the ability to cognitively be on demand like that. So that whole window is available. We have to work within that window, especially when we have to bring online academy kids in. Be different for our students who are here if we go to the full in line, right? Full in person, because they're here already, right? We can do that. It's that online academy group that's the new sort of wrinkle in this.
Okay, so I'm wondering if PSSAs happened and we were kind of able to get our sea legs with the 4.5 days, assuming we went in that direction. Is there a time when it would be fair to reevaluate the half-day Wednesdays in that model, since a lot of that is directed towards the accounting for the PSSAs, and also getting off to a good start.
Right.
You know, I'm wondering if there could be a time when they're looked at again. I would have to think that there's certainly a value. There's a lot being asked in the beginning, but when I think about the end of May or June,
Right.
doesn't seem like those would be as necessary, or
Sure.
even the middle of May.
Yeah.
And when I think about the asynchronous days, I think about it in two ways. I think about kids being in the building for half a day, but then I think about the going home and getting on screens. And these are our absolute youngest learners. I mean, and I think that's sort of a double whammy for some of these, for these young kids.
Yeah.
So I would like to see a time when that half day is possibly reevaluated, if you think that that could still, offer our students what we want to offer them, and also let us plan and be prepared.
Yes. I think no plan is permanent until the end of the school year, right? So even now, when we're saying we could bring back students full in person potentially, if that goes awry, we've even suggested it here. It could be that we might have to pull back. If there's something that happens and we had to suddenly go virtually, we'd have to be ready to do that. Asynchronous Wednesdays as they stand now, and the half-day version of them, are also things that we have to continuously evaluate. When we no longer need them, we could pull back from them. That's a certainty.
Okay.
The uncertainty is, when is it the time to do that sort of thing? You said sea legs. It's a phrase I use all the time. To predict a teacher's sea legs, is tricky business, right? But when we're feeling that and we're feeling good, there's no reason to keep a half day asynchronous if we no longer need it. Our teachers are very good at saying whether or not something is needed. And I really take them at their word, because they're the ones doing it. I have to, at that point, take them at their word, and I've watched them be in my meetings and say, I can only stay here for another hour because I have an IEP to get to. I have students I'm going to work with, that sort of thing. The one thing that would remain true through the end of the year is that alignment between the online academy and the full in-person. That has become an essential component of Wednesdays. Could it be done over the course of every day? Maybe. We interviewed Central Bucks and asked them, what are you doing for your teacher meetings? They're ending the day an hour early every single day to give their teachers that time. That's far more than a half day in asynchronous planning for teachers. So we're actually doing less than Central Bucks is doing for their teachers at the start. We asked them if they would be changing that. They said, like you're asking, we'll constantly be evaluating that, and we would do the same.
Okay. So Dr. Grandy, I only have questions for Ms. Wheeler, I believe. So we can, if other people have questions for Dr. Citarelli-Jones, I will.
That's okay, because I don't know who people have questions. I only knew who I had a question for. So why don't you just go ahead?
Hi, Mrs. Wheeler. I had a couple questions. I'm disappointed to hear that these kids are going to be bringing these devices into school every day. Again, let's just pause and think about how little the 5-year-olds are in kindergarten, and then even up to 5th graders who are still really young and really little, which would even go for middle schoolers and then some high schoolers, because these are kids. You talked about wanting to get back to the kind of the old school crayons and paper. It seems to me that while some readjustments have to be made where screens could be advantageous, it seems to me that that would be sort of the exception rather than the rule. Again, not being in the classrooms, not being a teacher, but in the past, I don't know how much, I guess I'm wondering why do we have to do this?
Why do we need to bring them in?
Why do the youngest learners have to bring in their devices every day when the real goal is to get them back to this very in-person, stimulating, in classroom, looking at their friends and not at the screen type of learning?
Absolutely. I don't think it's an all day they'll be on the screen. I think what it is like, for example, they don't need to Zoom. They don't need to be and Seesaw all the time, but will there be value in having the ability to still push out an activity through Seesaw to collect immediate data? Absolutely. So I think what you'll see is probably teachers more strategically using the devices, in particular at the younger grades, but to be able to do things as, Dr. Citarelli-Jones was mentioning, that teachers having this zone of instruction that they'll have. Well, they can easily drop an assignment out to a student if they needed to collect some quick data that they may only use it for, let's say, 10 minutes during that language arts block. Don't foresee it being where teachers will be heavily relying minute to minute on using those devices. However, they can't use them if they're not there. We also have the issue of, it would be great to, especially for the younger ones, say, we'll just bring them in and leave them in school so we can use them as needed when here. The problem is we don't have an ability to securely store them, charge them, and keep them overnight. So that's just the reality of not having those devices and the magnitude of devices, I should say, until the pandemic. Those structures weren't in place as opposed to where I previously had been, where we had carts in every room. So the devices probably could have stayed and not be this something they had to bring back and forth and leave question to, are we just going to have the kid on a device all day? I don't think that's any of our goals, but I do think they're going to be important to teachers to use on a regular basis.
All right, is there, and I guess what you just said is what concerns me, how easy it is to drop an activity onto these devices. And so I'm wondering, so that parents can stay in touch with their children's screen time, which I think so many parents have just had it, they've had it. Is there going to be any kind of cap or any kind of regulation? And it's dangerous to micromanage that, I understand that. But is there going to be any kind of examination of how they're being used and how often, because parents now won't have the ability to know how much screen time their kids are getting. And I think it is upsetting and concerning for parents that when their kids are going into the buildings, they're going to have these devices. Again, little kids.
Well, to some extent, they will still be able to see in that, especially with Seesaw and having the app on my own phone when my child was using it, you can see the number of activities, right? So if you see the volume of activities you saw 30 activities today. That seems outrageous, probably because it is, whereas maybe you didn't see any that day. So I think is that full monitoring? Absolutely not. Will they get some indication of what's going on? Yeah. But to your point about how we monitor it, I put a lot of trust and value. I know I've only been here for a short period of time, but having sat in grade level meetings, having sat with teams of teachers, I can tell you they are critical thinkers. And I've been very impressed by the level to which they are concerned about those same issues. And if you think the kids have Seesaw fatigue and glue, so do the teachers.
Okay.
But I also think that they know that scrapping it completely from their repertoire would be unfair, both on the short run, but also in the long run. But I think they do absolutely, in particular the K1 and 2, I would say the most will look for opportunities to really strategically use the device. And in terms of asynchronous Wednesdays, now that they'll potentially see all of their kids on Tuesday, asynchronous Wednesday could potentially be entirely screen-free because they have the ability to pass out the information. Whereas when they only saw half your cohort, you had to have your copies on Monday to get that was just strategically, with all that's going on, impossible. Whereas now it's completely fathomable to be able to say Tuesday afternoon, hey kids, tomorrow during your half day, you're going to be doing it now they may still post things in case a kid forgets, or maybe record a video in case they need to listen to something again. But I think you'll see those asynchronous Wednesdays look quite different, especially for the younger ones. I still see, project-based assessment and maybe using devices be a part of it, but it certainly doesn't have to be all of it the way we're currently doing it, just because of the reality of how the cohort model works.
Okay, thank you. And I will tell you, your initial impression of our teachers is accurate. They're pretty fantastic. So,
yes, they really are.
Yeah, thank you.
All right, I think I have Marilyn next.
I suspect that my question is for Gina Ross, but it might be for others as well. I have a couple of questions actually. And it comes back down to the timeline, and there are so many moving parts in this, and there's so many things we would like to have in place before we bring kids back full time. I mean, it would be awesome if all of the teachers were vaccinated, and that doesn't appear that that's going to be possible. But I was a little bit surprised when you said that the testing would not really be implemented for 3 or 4 weeks yet. Is there a reason why that is taking so long? Is it possible that that could be sped up?
So as I previously indicated and Dr. Rubin indicated, there is a 3-step training process. Some of our nurses are in 2 out of 3, some have completed all 3, but the remainder are going, will be finished within the next week and a half. Additionally, the procedures and protocols that we need to put in place to ensure. At this point, we do not know how many staff members will participate. What we can tell you is that the rapid test takes 15 minutes. We know that staff are in class during the day, and there are strategic times when we'll need to schedule. So as soon as we are at the point where we have the procedure set, we're then going to send out a survey to staff members to identify how many staff members are interested and willing to participate. As Dr. Kaufman said, this is not a casual drop in, drop out. This is signing up for a weekly assessment. If we were to go the route of our student athletes, this is signing up for a weekly, one-time or two-time test. So there are many procedures and protocols that we have to put in place. There are also things that I know that Dr. Palmer is still vetting through the solicitor in terms of this is new and we're not quite sure where the case law and the legal side is currently standing. So while we're trying to move as quickly as possible, we need to make sure that we have the protocols in place and that we can do it smoothly and effectively.
Okay, thank you. My other question is about the cubbies because I'm a little bit confused. Are we purchasing enough of the plexiglass surrounds for all of the elementary students?
Yes, we have purchased. It's not actual plexiglass, so it's not that extremely rigid plastic that you might see in our front offices or things like that. It is a more flexible, actually portable version of it that has 3 sides to it.
And what is the expense associated with that purchase?
The cost per item I don't have on me exactly. It is a, oh, thank you. So I'm not going to be able to lift this up, but this is an example of the ones that we purchased. So they come 3-sided. I don't know if you can see it, Marilyn, because it's really clear.
I can see it, but if you stay at the microphone, that's quite helpful.
Okay. Thank you for giving me that kind reminder. I do have a loud voice, so I thought I'd be okay. So that is an example of it. I don't have the cost per item on me right now. I believe it might have been somewhere approximately $10 per item. We had purchased a number of them, as I said previously, for students with complex needs and students who are high risk. So there are a large number of them across the district that are currently being utilized.
And do we have a funding source for that?
I'm going to ask Dr. Palmer, who's giving me the high, that she'll answer that question.
Dr. Huff, one of the things that we would be doing is mounting these on the desks. While Gina said that they are portable, we're looking at affixing them to the desks. And as Mary's been talking with PIMA, we believe a funding source might be a PIMA grant. While it's not guaranteed, and we don't know if the money has run out, we know we can continue to apply. So it would be our hope that PIMA would be the funding source.
Thank you.
Kelly?
If one more, sorry. What seems like an hour ago, probably talked about if there was a lot of switching between online academy and in person, need to potentially change teachers. And we talked about whether we would even have to hire additional teachers. And I'm looking at Dr. Cinderella Jones. I'm not sure. It might be you. It might be Mr. Abbott. You know, I don't want to make that seem like the hiring of additional teachers is something that would be simple to accomplish. It's, from what I understand, extremely difficult to find teachers or substitutes at this point. So I wanted to put that out there just simply because, well, I'll ask you to confirm that, but I also, we need to be realistic in that if we did see a lot of movement, first of all, one has to think about whether that is accomplishing the goal if there's a lot of disruption. But secondly, could we even staff it would be, I think, potentially problematic.
I could have Ferg talk about how hard it is to hire. I'm not involved in that. I could talk about the other part though. You want to
there's no denying that staffing has become a much greater challenge during COVID. Staffing was becoming a challenge prior to COVID, but not so much at the elementary level. As far as filling vacancies, elementary has historically been one of the easier vacancies to fill. It has become challenging. We have kept a posting up. We continue to get a trickle of candidates in, but when you interview 5 people, let's say, you'll get one good person out of that. Finding candidates in the middle of the year is harder. You getting best time to get candidates at the beginning of the year and the middle of the year. Does that answer the question? Not really, but it's a challenge. We continue to get candidates, but it's a type of thing where we have to constantly be looking, as the elementary principals can attest.
Can you repeat the other part of your question? I want to make sure I answer it right.
Thank you. I think I was just commenting more than a question that if there is a lot of movement that would require many students potentially to change teachers, one has to question, at least I think one has to question whether we're accomplishing the goal, which is to create some continuity, some greater continuity, greater access to in-person education. Is it being, does it accomplish the goal if we're disrupting that teacher relationship?
I mean, I can comment on it just in terms of, my belief about the thing. There's a reason why elementary students typically have one teacher, 2 in terms of their specials, if you will, case manager, that sort of thing. And as you progress up through grades 12, at middle school, they'll be in teams. And even as a middle school administrator, we were always reluctant to change a child's team. Even a couple of weeks into the school year, we were reluctant to do that because those relationships become so paramount to the learning. Up through high school, a student can be taking, AP physics and then decide they're going to take something else, and the change of teacher doesn't have the same sort of impact. But when you're talking about our youngest learners, that bond and that relationship they form with the teacher becomes really part of their learning. There are teacher styles, there are student learning styles. They start to learn how to mesh those styles together by this point in the year. So for some students, a disruption like that could be an important thing for parents to consider. If I'm a parent making this decision, I would think about how adaptive my child is to change. Do they easily connect with adults? If they do, then the change might not be quite so difficult. If they're a 5th grader, maybe that, for example. If they're a child where if that relationship is in place, that student will learn, and if that relationship is not in place, they will not learn. That's a student for whom a switch of teacher may really be detrimental. So, I would encourage parents to really think through their child's adaptable, just the way that they look at relationships for the teacher. I think that's really part of elementary learning. And so I don't mean that to sound doomsday, but it is important that everybody thinks through their own child's needs in terms of a relationship with the teacher.
Right. Thank you. And it just speaks to how important it is for us to get the survey out, get responses to the surveys, because that it's just going to be such an important component of a decision-making process, in my opinion.
I agree.
And I'll also just add to that. I think that, some will wonder why we're asking for that binding choice this week. And I think it's become apparent to me, certainly in these conversations, that without that information, it's very hard to fully understand the implications of a change. And so I'm just saying that to take the blame. People will wonder, like, why do you need to know already? And, I think it's critical toward our decision making, because I think of the issues around continuity of education. And if we ask for hypothetical choices and then we find out something very different a few weeks later, I think it makes it very hard to adjust and kind of repivot all the plans at that point. So again, not a question, but I just wanted to piggyback on Kelly's comment to try to explain to parents why we're really asking for this now. because I think it is really central to decision making. So no comment necessary.
Well,
just say yeah.
but it did make me think of something, so I'm going to add it because I love a good microphone moment. For parents to make a decision right now, if I'm a parent, I want all the facts, right? And one of the things the investigation team agreed upon is that we would not rush the facts just to make sure that there was an answer. If the answer is not good, then it's better to have no answer. That said, this presentation is being turned into FAQs. And when that FAQ goes up onto the website tomorrow, we're working with Deirdre Abramson for that. As we make decisions, that's where you'll see the decisions. It'll be the 11th FAQ, the 40th FAQ. Each one of those decisions will get added into an FAQ so that we're not sending out the latest newest edition, the next newest, the 50th edition. It is go to the FAQs. That's where you'll see the latest decisions being made. And we'll probably put something that says like new so that people can get straight to what's new. We want to make sure that our decisions made in real time are communicated in real time.
Actually, it's a good question. Where should parents go to find this information? Is it the school reopening part of our website? Is that
after my 9 o'clock meeting? I will know for sure, but I want to have it as front and center as possible. I don't want a parent to have to go on a breadcrumb trail hunt.
So maybe when we send out the survey, we can send a URL.
And the link should be in there. I think that link should be embedded in the survey, and then that will be the continuous place they can go. Yes.
Great, thank you. I don't think there's any more questions. I know it's 9:20. We have one more short focus topic to go. So I think that's it. And thank you for all the hard work from the entire team.
Thank you.
Dr. Palmer, do you want to introduce our second?
I
I'll be
do.
a briefer, I think.
It will be briefer for sure. So tonight, Ms. Q is back reminding us what's in our budget, or at least in that proposed preliminary budget. I will remind everyone that the budget itself is very preliminary and very much a work in progress. COVID-19, as we've talked about tonight, has an ever-changing process of our educational plan and also looking at our health and safety plans. And it has been making our budgeting very difficult, to say the very least. As we prepare the 21-22 budget, I will reiterate that we remain committed to maintaining our excellent educational program, strengthening our mental and behavioral health supports, and broadening our diversity, equity, and inclusion focus. Procedurally, we started our budget countdown at the last board meeting with the beginning of the required steps toward the adoption of the final budget. We will continue to share more details and refine our estimates until June, at which point our board will adopt the final budget for 21-22. And I would like to clarify one important item before Ms. Q starts the presentation. At our last meeting, Mr. Ballas asked me if the online academy was included in the draft budget. And I said no. And I should have said not yet. So let me remind everybody, when we passed the budget for the 2021 school year, there was no pandemic planning. There was no online academy. We had not even thought about it. But as we sit here now, we have an online academy, K-12. We have full online options and in-person options. When I say not yet, I want you to think of the budget that we had 2021 and think that Ms. Q trended it forward. It is very early and she's involved in the reconciliation process for the 2021 school year. We still have a lot of planning for what the fall will look like. This evening, you heard about what even the next few weeks could look like. Then that could take us to the end of the year. We are having those conversations about what the fall could look like, but we haven't finalized the numbers. We haven't finalized the design of what it would look like, and we haven't finalized what our student needs are. So for anyone who thought I said there would be no online academy, I'm just saying it is not included in the preliminary, and the preliminary starts our budget process. We will continue to have the process where we will work through the finance committee meetings, and we will have additional presentations here. I can tell you we will have to make a provision for online learning. but I can't tell you at this moment what it's going to look like. So I thought it was important to put that out because I have seen some things, and actually some pretty nasty things written on the how could I be so foolish not to think that we would need online learning. And I'd like to convey I'm not foolish, and I didn't dismiss it. I should have said we hadn't included it yet. So hopefully I made that a little bit more clear. And Ms. Q, if you are ready, you can start the budget presentation anytime that you're ready.
AJ, do you have your slides up?
Yes.
They're up. Yep.
Okay. Good evening. As I noted in the last presentation, and as Dr. Palmer just said, we are very early in the budget process. There are many unknowns and a deeper analysis is needed on so many things. We will continue that analysis as we work toward the presentation of the proposed final budget in May. Doing projections for the current year becomes incredibly difficult with the ongoing COVID-19 expenses and related effects on district revenues. What other costs will the district have to absorb during this most unusual year? Getting estimations for revenues and future expenditures is more difficult as there are so many unknowns when you are talking about a time frame so far into the future where there is so many questions yet to be answered. We do not know whether we will receive additional relief funding from the state or federal government. However, the governor did make his budget address on February 3rd. We've heard the governor's budget described as bold, and it certainly had included in it unprecedented support for the education contained within it. We've also heard it described as dead on arrival for a number of reasons, including an increase in personal income tax rates, etc. To clarify a comment and to further reinforce what Dr. Palmer said, this preliminary budget is modeled on a full return to school for 21-22. This does not mean that this is the final say on what the district does regarding school in the coming months or at the start of the coming school year. This budget will continue to undergo many adjustments and changes from now until the final approval in June. So as indicated, we are very early in the process and many items need to be fleshed out before the final budget in June. Next slide. Let's review where expenditures are projected for this preliminary budget. Oops. Did you go 2 slides? Thank you. Salaries and benefits make up approximately 69% of the total budget. Purchase services represent just over 18%. Debt service and fees makes up just over 9%. Supplies are just over 3% of the budget. And the budgetary reserve represents less than 0.5% of the total budget, for a total expenditure budget of $89,110,694. Next slide. On the revenues, the local revenues make up just over 81% of the revenue budget. State revenues make up just under 17% of that budget. Federal revenues make up less than 1/3 of 1% of the entire revenue budget. We are also using the fund balance of $1.3 million to balance this budget to again come to that $89,110,694 in total. Next slide. There has been a great deal of discussion about fund balances in the past. Think of this as your savings account. You would pay for a large expenditure, such as replacing your roof, for example, out of your savings, but you would not pay your electric bill out of that same savings account. At this moment, the district is using its fund balance to pay normal operating costs, instead of saving those funds for those large unexpected items. If 21-22 finishes out at the original budgetary amounts, we will use approximately $3 million of that savings account, and the current preliminary budget has a $1 million shortfall. That would leave a fund balance of $4.1 million. The state does permit an unassigned general fund balance of 8%. That would be $7.1 million, or almost $3 million more than what this projection shows. But notice I have an asterisk here. There is a change to the fund balance that has a rather dramatic effect if things fall where it continues to look. Next slide. Please note that the $3 million budgetary shortfall does not include the COVID cost effect. The budget was finalized prior to knowing the effects of the pandemic. The costs of COVID, including PPE, instructional supports, including equipment, instructors, special education services, HVAC adjustments, and on, are in addition to that final budget for this year. So the fund balance has the potential to be even further diluted. We have been applying for grants and supports as quickly as we can. As this slide indicates, we currently have approximately $3.8 million expended on COVID-related expenses. We have gotten 2 PCCD grants, 2 ESSER grants, a GEAR grant, and yes, those are all abbreviations set by the state, but that only represents $1.6 million. So if nothing happens, we have an additional $2.2 million in costs that aren't counted for in this year's budget. Now, Dr. Palmer mentioned that we are applying to FEMA and PEMA to help recover costs as well. So we're hoping to get further funds through that. And we obviously don't know whether any other additional funds will come up to help offset the costs of COVID. Next slide. Act 1 and the Act 1 index. What is that? Basically, Act 1 was intended as an inflationary factor developed through the legislation in 2006. It is first calculated using the 3-year average of the statewide average weekly wage, or the SAW, and the Employer Cost Index, or the EIC. The resulting statewide number is the base Act 1 index, which serves as a starting point in calculating each school's district's adjusted Act 1 index. So basically what this boils down to is it's an inflation factor. For 21-22, that was 3%. However, in a year of a countywide reassessment, Act 1, according to the law, a district must use the prior year index, or in this case, the prior year was 2.6%. So our inflation factor is further diluted. By the way, this slide came from PSBA, so I thank them for their information. Next slide. Since I mentioned the countywide reassessment, we're still finalizing the reassessment values, but at this point in time, the district went from $1.4 billion in assessed value to $2.6 billion. If we reset the millage rate based on that new assessed value, we would go from 48.3 mils to 25.6 mils. We are eligible for a special education exception this year. This exception is based upon the 2 prior years of special ed costs. The expenditures for 18-19, which were just over $13 million, as compared to the expenditures for 19-20, which were $13.6 million. The state sets the years for this comparison, and they're using those 2 years. So this exception is basically providing the district funds for costs the district has already incurred. This budget includes both the Act 1 index and the full special education exception for a total of 1.1 mils, or a 4.34% tax increase. Please remember, even with that increase, we are still using $1.3 million from the fund balance to balance this budget. Each year, we talk about the effect on the median assessed value. In prior years, that value was $179,000, or approximately $8,600 in real estate taxes. Assuming an average adjustment, the new median assessed value would be approximately $318,000, or $8,482 in real estate taxes. As I said previously, some properties will see an increase in taxes while others will see a decrease. In a normal county-based reassessment, you should see 1/3 get a decrease, 1/3 get an increase, and 1/3 remain approximately the same. Next slide. So what's next? As I mentioned earlier, the governor made what was called a bold budget address on the 3rd. Including increases in education funding, but also including increases in the personal income tax to offset that additional funds. I am sure that they will be working on this through budget committees from now until June 30th, and we'll see what comes out of that process. As we continue on, we will have finance committee meetings in the remaining months from now until the May proposed final budget presentation, as well as working on it right up until the end in June when the board's final approval for that final budget. Any questions?
Any questions from board members? Kelly?
Ms. Q, thank you. I had a question about the fund balance, and I know that the situation that we're looking at, again, it's a preliminary budget, but the situation is one that's shared by many school districts coming out of a COVID period here. But my question is, does a fund balance that's approaching the levels that we're looking at have an impact on future borrowing capacity for the district?
If we continue to dilute our fund balance, yes, it could potentially affect our bond rating as we go to future usages of debt. That's one of the things they do look at. And if every year we continue to spend down that fund balance, it will definitely affect our bond rating.
Thank you.
Other questions? Matt?
Even beyond the bond rating, Martha, we're going to get to a point where we have no fund balance left to spend down. And we're getting critically close to that.
That is correct. In addition to that, last year when we did the presentation of the 5-year capital expenditure plan, that 5-year plan actually expended both the capital reserve as well as the general fund balance in its full extent. We have since diluted our general fund balance, so that 5-year capital plan, we don't currently have the funds to fully cover that plan.
Any other questions? Kelly?
Just a comment that as I hope that people are watching and listening to this is not a good position to be in. And so when we think about what this is going to mean to how we spend our money moving forward, we are going to have to make some very difficult decisions in this district. We're not alone in that. I want to emphasize that this is a strong district. We're in actually remarkably, even looking at that, we're in much better position than many districts in the state, but it cannot continue in the same way that we are accustomed to if we're that close to potentially eliminating a fund balance. We can't.
Any other questions, comments? So certainly we will be coming back to this in finance committee discussions and then ultimately back to the full board as we get further along in the budget season, and we'll get to a point where I think our estimates will get more precise in terms of thinking about what this current fiscal year looks like in terms of final expenditures. So thank you, Ms. Q. All right. So that takes us to our first audience recognition. Now, this is the time for items for action that are on the agenda. So that doesn't include our fairly extensive discussion about the elementary transition plan. So if there's people here to speak on that, I think we will get to that quite soon, but we're not quite there yet. But as a reminder, public comment is a time for the district residents and taxpayers to speak to the board about an issue that is before the board or may come before the board. It is a time for us to listen and hear perspectives and experiences from our community. And while we can't answer questions at the meeting, there's always an opportunity to follow up after meetings if there is a specific question for the district. As I've mentioned at recent meetings, for now, we have 2 methods to comment, in person and by phone. So members of the public wishing to address the board in person, we do have overflow space for this meeting to maintain adequate social distancing. And when it's time to speak, audience members are guided to the meeting room to speak. Everyone must wear a mask at all times. Members of the public wishing to address the board can also call 610-892-3470, extension 1102, to leave a recorded comment for the board subject to a 3-minute time limit. Any comments left prior to 5 o'clock today on the day of the meeting are transcribed and made available to the board and acknowledged at the meeting. Comments left after 5 o'clock but prior to the end of the meeting are still transcribed, distributed to the board, and made a part of the record, but not acknowledged during the meeting. So I know we have many called in comments, but I believe all of those called in comments are for items not on the agenda. So I don't think we have any of those to read at the moment. Is there anyone in the audience who would like to speak to an issue on the agenda this evening? Okay, so I don't see any. So that will take us to our first item for action, which is the approval of the January 25th regular business meeting minutes, and I so move. Do we have a second?
Second, Chapin.
I got Matt first on that. Thank you though, Chapin. Any discussion? Okay, Ms. Fagora, can you please take a roll call vote?
Mr. Ballas,
Aye.
Ms. Semino,
Aye.
Dr. Huff,
Aye.
Mr. Cudis,
Aye.
Mrs. Lentz,
Aye.
Mr. Sullivan,
Aye.
Mrs. Walkman,
Aye.
Dr. Grandy.
Aye.
The motion passes 8-0.
All right, thank you, Ms. Fagora. So we have 10 items for action and personnel. Are there any on the list anyone would like to separate from the rest? Okay. First, we have the approval of 3 retirements. George King, principal at the middle school, William Thorpe, math teacher at the middle school, and Gina Ross, director of student services. All the dates are listed in the agenda. We have the approval of 1 appointment, Jason Katransky, environmental science teacher at the high school. We have the approval of a new hire rescission as listed in the agenda. We have the approval of 3 leaves of absence as listed in the agenda. We have the approval of 2 changes of assignment as listed in the agenda. We have approval of the revision of compensation of staff for the Student and Staff Wellness Committee as stipulated. We have the approval of additions to the 2020-2021 activity supplemental appointment list as listed in the agenda. We have the approval of additions to the 2020-2021 winter athletic supplementals as listed in the agenda. We have the approval of the deletion to the 2020-2021 curriculum supplemental appointment list as stipulated. And we have the approval of payment of unused sick days as stipulated. All the items in the section are as attached or described in the agenda. Do I have a motion?
So moved.
Thank you, Jerry. Do we have a second?
Second.
Thank you, Larry. Any discussion? All right, Mr.
Dave?
Gore. Oh, sorry, Chapin, go ahead.
I was just going to say you had said 3 resignations, but Gina's, or 3 retirements, but Gina's not a retirement, right? Not that it matters. Just
Oh, I got you. Yep. How are those listed right now?
not that I'm not protesting. the whole
Yes,
thing.
okay. I got you. So retirement / resignation. So yes, that's a resignation. The first 2 are retirements. Thanks for correcting that. Any other comments or corrections or questions or discussion? Okay, Ms. Fagora, can you please take a roll call vote?
Ms. Semino,
Aye.
Dr. Huff,
Aye.
Mr. Cudis,
Aye.
Mrs. Lentz,
Aye.
Mr. Sullivan,
Aye.
Mrs. Walkman,
Aye.
Mr. Ballas,
Aye.
Dr. Grandy.
Aye.
The motion passes 8-0.
Thank you, Ms. Fagora. So we have 4 items for action in curriculum. Let me fast forward. Okay. Are there any on the list anyone would like to separate?
I would like to separate out the school calendar.
Okay. Any others? Okay, so we'll start with A, B, and D. So we first, we have approval of the 2020-2021 related services provider contracts as stipulated. We have the approval of a tuition contract for the 2020-2021 school year as stipulated. And we have the approval of the addition of the middle school to the 2020-2021 health and safety plan for competition and voluntary workouts. These items are as attached or described in the agenda. Do I have a motion?
So moved.
Thanks, Kelly. Do we have a second? Thanks, Matt. Any discussion? Okay, Ms. Fagora, can you please take a roll call vote?
Dr. Huff,
Aye.
Mr. Cutis,
Aye.
Mrs. Lentz,
Aye.
Mr. Sullivan,
Aye.
Mrs. Walkman,
Aye.
Mr. Ballas,
Aye.
Ms. Semino,
Aye.
Dr. Grandy.
Aye.
Dr. Grandy, the motion passes 8-0.
All right, thank you, Ms. Fagora. So then that takes us to the other item in curriculum, which is approval of the 2021-2022 school calendar. Do I have a motion? Thanks, Jen. Second?
Second.
Thanks, Matt. Any discussion? Marilyn?
So I understand the reasons why the start date has been shifted to after Labor Day for this year. I do want to encourage the administration and the board to really consider in future years bringing the start date to be before Labor Day. It is advantageous for many reasons. And I also want to encourage the administration and the board to start communicating those reasons to the community regularly so that it does not come as a surprise for the future school years.
Thank you, Marilyn. Any other discussion? Okay. Ms. Fagora, can you please take a roll call?
Mr. Cutis,
Aye.
Mrs. Lentz,
Aye.
Mr. Sullivan,
Aye.
Mrs. Walkman,
Aye.
Mr. Ballas,
Aye.
Ms. Semino,
Aye.
Dr. Huff,
No.
Dr. Grandy.
Aye.
Motion passes 7-1.
All right, thank you, Ms. Fagora. So we have 9 items in finance. Are there any on the list anyone would like to separate?
I'd like to separate out D.
Which one?
D, as in David.
Okay. Any others? Okay. So we will do all but D here. So 8 first. So we have approval of a contract to Russo Corporation for a general construction contract in the amount of $362,000 for the Strathaven High School Secure Entrances project to be paid from capital reserve funds. We have approval of a contract to Hirschberg Mechanical for an HVAC construction project in the amount of $134,900 for the Strathaven High School Secure Entrances project to be paid from capital reserve funds. We have approval of a contract to J.R. Metzger for an electrical construction contract in the amount of $83,500 for the Strathaven High School Secure Entrances project to be paid from capital reserve funds. We have approval of the first renewal of the third-party commercial driver's license skills testing services agreement between the Pennsylvania Department of Transportation and the Wallingford-Swarthmore School District as stipulated. We have approval of the 2021-2022 preliminary general fund budget of $89,110,693 with the following millage rates as listed. Nether Providence Township, Rose Valley Borough, 26.7886, Rutledge Borough, Swarthmore Borough, 27.0308. And lastly, authorization to apply to PDE for the Act 1 exception for special education expenditures. All of these items in the section are as attached or described in the agenda. Do I have a motion?
So moved.
Thank you, Jerry. Do we have a second?
Second.
Thank you, Larry. Any discussion? Kelly, is your light on for, oh, okay. Okay, Ms. Fagora, can you please take a roll call vote?
Mrs. Lentz,
Aye.
Mr. Sullivan,
Aye.
Mrs. Walkman,
Aye.
Mr. Ballas,
Aye.
Ms. Semino,
Aye.
Dr. Huff,
Aye.
Mr. Cutis,
Aye.
Dr. Grandy.
Aye.
The motion passes 8-0.
All right, then we return to item D, which is authorization for the Director of Operations after consultation with the Superintendent, Board President, Board Vice President To approve expenditures prior to school board approval not to exceed 15% of the aggregated total of all awarded contract values for the Strathaven High School Secure Entrances Project to be paid from capital reserve funds. Do I have a motion?
So moved. This is Marilyn.
Thank you, Marilyn. Do I have a second?
I'll second. And then
Thanks.
open the comments.
Sure, go ahead.
So given the discussion that we just had, I'm wondering whether this item is set at the right threshold. So the item here is to approve up to 15% of additional expenditures based on the contract value. It's a $600,000 contract roughly. And we just had a brief discussion about the significant issues we're facing with our fund balances. And this would be an expenditure of up to $100,000 out of those fund balances. And so I'm wondering whether it's appropriate to set a lower, if not much lower threshold here of 10% or maybe 5%.
Dr. Palmer, is Mr. Abbott still available? Okay, he's coming. I would love to get Mr. Abbott's thoughts on this. I know there's some concern about this is a project that needs to take place in the summer when the board does not meet frequently, and there is concern about project delays, but I'll let Mr. Abbott weigh in.
Yes, and I wish I could talk about years of experience. I'm going based upon previous projects we've had, most notably in the memo referring to the West project where it was set at 10%. Do we anticipate it being much less? Yes. Do we feel as if this is a well-planned project so far? Yes. It's a contingency of 15%. Using the West project as our most recent guide, which was at 10%, but that was with one prime contractor. And in this case, although we're approving 3 now, there will be a 4th at some point for plumbing. So I wish I could say I had 10 years of experience in this job to be able to truly say that. But this provides a contingency we would need to keep moving forward. I think putting in there about, in consultation with the board president and the board vice president, hopefully gives some assurances that any money that did have to be spent because of a change order is being properly vetted.
Ferg, are we saving money by going with 4 contracts as opposed to getting a general contractor and subcontracts?
Yes, we are. While $600,000 plus is a lot of money, in the scope of projects, it's not a large project, and we're saving the money of not having a company oversee this. While we're given the responsibility to the general contractor, the general construction company, we have our own people, Cirilli Associates and the architect that will be overseeing the project in addition to the operations department. And that does save us money.
Ferg, where did we come in on the bids compared to what Nick and the architect were projecting?
We came in right on target for the 3 of the 4 that we're looking to approve. When we originally intended to do this project last summer, summer of 2020, but with COVID hit, we were delayed in going to the market, and for COVID reasons, mostly, we felt as if this project may come in around $1 million. So we decided to postpone, and it also allowed us to go to market very early in the bidding season. So we feel as if we've gotten good prices in line with what they wanted, except for the one plumbing bid, which we are still working on.
Any other discussion? Okay. Ms. Fagora, can you please take a roll call vote?
Mr. Sullivan,
Aye.
Mrs. Walkman,
Aye.
Mr. Ballas,
Aye.
Ms. Semino,
Aye.
Dr. Huff,
Aye.
Mr. Cudis,
Aye.
Mrs. Lentz,
Aye.
Dr. Grandy.
Aye.
Dr. Grandy, the motion passes 8-0.
All right, thank you, Ms. Fagora. So that does take us to audience recognition for response to topics not on the agenda this evening. Again, as I mentioned earlier, this is a time for members of the district community to speak to the board about an issue before the board or may come before the board. The section is for items on the agenda, not on the agenda, sorry, this evening. It's a time for us to listen and hear perspectives and experiences from our community. And again, while we can't answer questions at the meeting, there's always an opportunity to follow up after meetings if there's a specific question for the district. Again, I'll remind those watching from home that if you wish to leave a comment, you can still do so before the end of the meeting by calling 610-892-3470, extension 1102, up until the end of the meeting. And those comments will still be transcribed and distributed to the board, made a part of the record, but not acknowledged during the meeting. We have a very large number of called in comments to read this evening. I think we have something like 60, so we will be reading for quite some time, but I'm going to start with checking in with our audience to see if there are folks who want to make a comment. Good evening. Just a reminder, so we just ask for a name, street for your home address. You don't have to give your house number. And then I'm not exactly sure how many people we have, but in general, since we have like 60 comments to read, we're asking people to try to stay,
I'm gonna be here all night now.
roughly a few minutes, like 3 minutes if you can. Those are our called in comments, or 3 minutes.
I've never heard anybody tell me to be short, but Derek Ryder, Beatty Road. So I want to thank, the board members, Dr. Palmer, who listened and worked with me and others as we advocated for fall sports earlier this year. It was a new process, an unknown of sorts, but it worked. But in hindsight, we planned too slow. Our neighboring counties and districts across the state were far ahead of us and concluded playoffs and state finals. We had half the games and no chance at a district or state title. This also occurred with winter sports. We delayed our start and we'll have less games, meets, and this did not sneak up on us. Here we are again. This is not sneaking up on us. It's February 8th. We most likely will not have elementary school back until late March, let alone the middle school or high school, as we are not even discussing those students or a plan. So I ask, don't let it sneak up on you. I'm here to discuss the logistics, slow moving or lack thereof, and why other districts, states are finding solutions with success and delivering on in-person education with full days. Not hybrid or the 2 hours for 2 days a week. Our goalposts continue to move back. We should be closer and ready to allow full-time in-person learning. We have schools in our boundaries and neighboring towns to look up to. It's working and safely. Why are we behind? For the sake of transparency and to cool down social media posts and insults, can we have the reasons why we are not moving to full-time in person? Is it the slow developing plan? Can you provide us the data on what the teachers would like to do? Ferg Appid spoke on this a little bit earlier, and we just don't know. Number one, do they want to teach full-time in person? Do the teachers want to stay hybrid? Do they not want to be in school at all? Or do they need to teach online due to personal health or household members? Not parents or family nearby, but in their home. As I'd like to visit my in-laws too, but cannot, as it is their choice. So please let us know. We need the information on what teachers are thinking, feeling, Are they scared? Whatever it may be, I as a parent, and I'm sure others want those answers, and the opportunity to return to school full-time in-person learning, as it is occurring around us and safely. So why do we still not have a plan? Until tonight, we're months behind. We cannot base our decision on fear alone. Even Dr. Rubin stated earlier, it's not transferring from student to teachers. Everyone other than those who want full-time in person have a choice. We do not. Is it the parents or is it the teachers? The union, which has set up the roadblock, not allowing full-time in person learning? I love teachers, love the coaches, love the administrators. They are family and they're friends. I'm not a teacher hater. Those advocating for full-time in person learning are not haters. We're looking to bring harm. We want to be informed exactly on the reasons we are not in school full-time. The information is not available other than we are in a pandemic. Well, the news flash is this is not ending anytime soon. Let's work around it safely, but not at a snail's pace. Show us what our teachers feel, want, or need. Let us help. Please move forward with full-time in-person learning sooner, not later, before the school year ends. And don't forget about the class of 2021 who have not been in full-time in-person school for close to a year. Thank you.
Thank you. And so I will invite the next person up who wants to speak, if there's someone else who wants to speak. In the meantime, Kelly, can you go ahead and read
Just the first
comment?
Sure. This comment is from Sarah Barron Samlin of Saybrook Lane in Wallingford. We have one child in the school district at this time and 2 incoming students. I'm calling with regards to the upcoming special school board meeting on Monday, February 1st, with regards to students returning full-time in person. Our child is currently in the hybrid program, and while we appreciate the desire for people to have kids go back full-time, and we do, my husband and I feel very strongly that we make sure to do that in an intelligent way. I'm a healthcare provider. I have several family members who are healthcare providers. At this time, hospitals are overwhelmed. There are multiple variants of the virus coming into the country and spreading in the country. Pennsylvania has one of the highest infection rates right now. I think that would be irresponsible of our township to go back to full in-time person school, even though the transmission rate is very low in students. We just don't know whether or not these kids are carrying these germs home to family members. I'm thrilled that there's a vaccine out there. I'm thrilled that people will be able to get it, but at this time, it's just not widely available enough to make it logical to change a system that is basically working for our kids. Right now, the hybrid program is working. Kids are learning. They're able to deep clean the schools between the student cohorts. I think that there is value in continuing with what we're currently doing rather than risking something and then having to disrupt our children's lives by going back to a cohort model if it's ineffective or if the virus starts spreading more widely in the school district. So please keep that in mind at this point. They've been doing this already for 4 months. Even if we go back full-time in March, that will be another 2 months, and there will only be 2 to 3 months left of the school year. I'm not sure it's worth it to disrupt the pattern that they've become accustomed to and to increase the exposure risk. I appreciate you taking my comment and concerns into consideration, and you'll make a smart decision.
Thanks, Kelly. Please, just name and street
Sure.
would be great.
John Lenart, West Rose Valley Road. First of all, thank you for allowing us to speak, and really appreciate the comments that were just provided by the other in-person speaker. I'm also in favor of in-person learning, and I know there's a concern about the holdup of teachers and school staff being vaccinated. But it's important to realize that the return to school plans that were initially developed without a vaccine on the horizon. Many of us may remember from last summer. I believe WSSD's own plan last summer was either fully in person or fully virtual until plan shifted midsummer. School experiences this past fall, in absence of vaccination, still showed school can be safer than the community in regards to COVID transmission, including the very many schools that were open with a minimum 3-foot distance. All the expert guidance takes into account the lack of widespread vaccination and risks to teachers, community, and students, while concluding that children need to return to in-person learning, and that indeed can be done safely, obviously with mitigation strategies. Also, a couple things. The data supporting full in-person learning in schools that practice these strong protocols is now overwhelming. As an example, in the recent CHOP webinar, the Rhode Island Commissioner of Education noted that the excellent safety profile of Rhode Island schools using 3-foot distancing. They also found that all virtual students had a higher infection rates than the kids who went to school. The very fact that local districts in Bucks and Monco are doing full in-person safely and now have been doing so for some time is a powerful form of data that I would hope the district would consider. So why are these districts able to provide safely for full IP for their kids when our district has not yet done that? The debate over school reopening is still skewed in favor of the risks from COVID. Yet, as we know, the decision to keep kids at home is not costless. The costs are depression, learning loss, and social emotional regression, amongst others. The longer kids are out of school, the longer it will take them to regain a healthy developmental trajectory. In some cases, the possibility of irrevocable loss is very real. These are the realities even for kids in wealthy suburban districts like ours. Thank you for your time.
All right, thank you. Kelly, do you want to read
Sure.
the next one?
Next comment is from Courtney Battelle on Glen Road in Wallingford. I'm calling to express my support for the board's proposal to return to full-time in-person learning. The data supporting full-time in-person learning in schools that are currently practicing strong safety protocols is by now overwhelming. In the recent CHOP webinar, the Rhode Island Commissioner of Education noted the excellent safety profile of Rhode Island schools doing 3 feet distancing, and they found that all virtual students actually had a higher infection rate than kids who went to school physically and in person. The very fact that our local school districts in Bucks and Montgomery County are doing full in-person learning safely and has been doing it for some time should also demonstrate support for our board's proposal. I really want to encourage the board to use current science and data as they make this very important decision about our children's learning future, because of the cost of keeping our kids at home is far too much. Depression, learning loss, social and emotional regressions are just a few of the costs. And the longer that our kids are out of school, it can be longer for them to develop a healthy trajectory toward all those factors. This fall, I made the personal decision in our home to not return to work so I can fully support my first and kindergartner's online academy experience. Maybe that's a benefit that I had of being newly widowed. I have flexibility, my children don't. After they lost their father this past April, my children had not had the social and emotional support from the school experience that we cannot simply replicate at home attending the online academy. I have since switched to the hybrid cohort model. I hope my children are afforded the opportunity to return to 5 days of in-person learning before this academic year ends. Thank you so much for taking my thoughts into consideration.
All right, thank you. Please.
Good evening. Alicia Steyer, 725 Windsor Place in Wallingford. I would like to take this time to thank you for this opportunity to speak, and thank you for your time and dedication to our schools this past year. It has not been easy, and the varying opinions can make it all the more challenging. The difference in opinions within the community has definitely been eye-opening this past week. It's important to point out that I think we all want to achieve the same goal, but the approach can be very different. The decision to go back full-time should not be based on which side speaks louder, but rather on data and evidence that proves it is safe for our teachers and students. Our teachers want their classrooms full again, but they want to feel safe. Wanting to feel safe in their workplace is very different from being lazy, which is still the rhetoric from some in our community. There are so many teachers in this district who not only teach here, but live here as well. I happen to be married to one. It is demoralizing that they continue to hear how they are being lazy and they don't want to work, because I can tell you that is so far from the truth. I know there are far more community members that support our teachers, but it's never easy to hear the complaints, especially in a year that they have worked so hard. We need to acknowledge that this pandemic is a process, not an event. We must adapt to the changes that occur. The criteria we use to open hybrid in the fall will most likely not be the same criteria to open full-time. Numbers are dramatically higher, and new variants have emerged that are far more contagious than the previous strains. This new information must be taken into account. Can we reduce spacing from 6 feet to 3 feet? Are the guidelines being changed from the medical experts to say that is safe in school settings? If the guidelines remain at 6 feet, will we remain hybrid or ignore the guidelines and essentially conduct our own experiment to see if 3 feet really works? Reducing the space to 3 feet and allowing full classrooms where class sizes will range from 20 to 27 students will most likely increase the exposure to teachers and students and potentially create outbreaks that will cause us to shut down. Can we say definitively that the virus isn't spreading in schools? Because unless we are testing, that's an assumption that ignores asymptomatic spread. Are we basing our data on schools that are testing consistently? Under what conditions are those schools open? Full-time, hybrid? Data can be presented in many ways and still be factual. We can base our data on Philadelphia schools, which have shown zero spread, but we know they have been virtual since last March, but it's still a fact. So if we go this route and reduce the space, will we be testing consistently to prove the virus isn't spreading within our schools? With a new timeline of March 18th, a start would give 5 full days before spring break. It seems like a more natural transition would be to start the Monday after spring break and allow more time for teachers to get vaccinated, numbers to come down, and planning purposes, since this process will require a great deal of planning. It is my hope that if this does get approved and our teachers will be front and center in the planning process. Just like we need to follow the science with the virus, we need to follow the guidance of our teachers who know what's best within the classroom. In closing, let's not forget that we have been open and back in person since early fall. Many schools have been all virtual since last March. Our administrators, principals, teachers, and staff have worked tirelessly to make this happen successfully because we have followed the guidelines. I hope we continue to follow the guidelines from our medical experts, and the decision to go back full-time is based on data and evidence and not assumption. At the end of the day, we can all agree we want our kids back in school full-time, but not if we are compromising the safety of our teachers and students. Thank you.
Thank you. Kelly, you want to read the next one?
This comment is from Mitchell Berger and Eileen Whiteman, Tanglewood Drive in Rose Valley. Our sons are students at Nether Providence Elementary School, and we are calling to voice our support for continuation of the current hybrid model for elementary education. We feel that the 3 days remote and 2 days in-person design balances safety considerations and student engagement. It also maintains the recommended standard of 6 feet minimum social distancing in the schools, as well as distancing on school buses. It is unclear when vaccination administration efforts will be sufficiently rolled out to effectively contain the virus. For the well-being of the students, teachers, and support staff who keep the schools and buses running, we would prefer to maintain the current hybrid model and not move to a 5 days in-person elementary school experience. Thank you.
Thanks, Kelly. Welcome.
Hi, thank you. I just wanted to say thank you to everybody on this board. That it's very clear how much you're all considering all of this so carefully to really try to make sure that the decisions that you make are going to be the decisions that are in the best way supporting everybody involved. And I know that's hard to do when everybody thinks that the boat is sinking at the same time. My name is Dan Halpern. I live on Devon Lane. My wife and I moved here with our 3 children from Lower Marion School District at the beginning of the school year. We moved here because we needed more space, but we wanted our kids to still have the best quality schools and a warm, safe community to grow up in. Our youngest daughter is 2 and staying at home, but our son is in 7th grade and our oldest daughter is in kindergarten. When we were deciding whether to send them to the online academy or the hybrid model, I visited their schools and I was amazed by the facilities and really impressed by the teachers and staff. I was so tempted to send them. I remember saying to my wife, is the disease really that bad? The schools are just so beautiful. This was why we came here, why we pay high property taxes. This was how they would make new friends. Instead, we sent them to the online academy. My father is 86 years old, asthmatic and recovering from cancer, and our only close family, and we see him regularly. As our son said, I don't want to go to virtual school. I just don't want to kill someone I love. Friends, I hate Zoom school. I am amazed by how well the school district is doing it and how well our kids are adapting to it, but it is still not the same thing as real school. But that doesn't make it bad. The pandemic is the bad thing. This is the best option we have for dealing with it for right now. I know we're worried about our kids' well-being, and I am too. One day last week, my daughter in kindergarten told me she wanted a robot so that she could have a friend who was allowed to come inside the house. And it broke my heart. I know they're all struggling with isolation. I know they're all struggling with dealing with Zoom school. I'm struggling not, I already have my hair pulled out, but if I didn't, I would pull it out now. And just to be trying to juggle everything and trying to keep them on track. And we're doing the best we can. And I know everyone else is too, and everybody has good reason to be upset. But I don't think that the situation that we're in right now is necessarily making our kids dangerously fragile and mentally unwell. In my family, I've seen that it's teaching them to be more mature, more compassionate, and in many ways more resilient. Our kids are learning to be independent and to lean on us. They're continuing to keep up with their schoolwork. They're still able to play with their friends who are in hybrid outside, but they're also learning to think in terms of more than themselves, having to make the best safe choice possible, even if it is not the one you would most wish for. Our kids aren't falling apart. They're having difficulty. Sometimes they get sad, sometimes they get depressed, but that's because they're living through a pandemic. That doesn't mean they're becoming weak. It means they are aware of the world around them, and that is a healthy thing. Whatever difficulties they have now are nothing to compare to what they would be going through if they got truly sick from COVID, or if they felt responsible for making someone they loved get sick or die, or if things had to shut down even further because of a massive outbreak here that could have been prevented simply by maintaining our current approach. So far, we've been following best practices. I'm sure we could do better than we are already doing in some ways, and it sounds like we're talking about ways of doing that tonight, and I'm really glad to hear that. But we've maintained quality education already with multiple options for our community's needs, and we've done it without super spreader disasters. That's a lot, and we should be proud of that accomplishment and working to build off of it, not trying to undermine it. And I don't think anybody wants to undermine it, but I think that we're considering decisions that could. I'm a former teacher myself, and I believe in the truth that life is full of unavoidable risks, and you should prepare the child for the road, not prepare the road for the child. But that doesn't mean you leave a landmine in the road when you could remove it. That's not an unavoidable risk. That's a foolish mistake. And so is forcing everyone back into hybrid 5 days a week right now. It could be, I think, maybe after spring break, we might be ready. Right now, the variants are starting to explode out. The fact that we're not seeing it quite yet here doesn't mean that it's not already happening. It was just starting when we didn't see it coming before. But they're already saying they're starting to identify it more and more, and we don't really know how they're going to react. Hardly anyone in our community is vaccinated now, and we don't know how these strains are going to make things much worse. There's been a lot of politicization of science and the arguments about what our schools should do, but I think we should be able to agree on the value of the most basic part of science, the scientific method. It's what I heard the body that was here tonight talking about and how they were making their decisions and analyzing the facts. The method is that you examine the facts and see where they lead us. You don't come up with a goal and rearrange the facts to make it seem necessary. Right now, the facts tell me, and I think they could be telling all of us, if we listen well, that switching to 5 days a week right yet and undoing the distancing protocols that we currently have is unnecessary for our children's mental health and dangerous to their physical health. That is even more true given how little we know about the new, more contagious variants of COVID, so why do it? I'm as hesitant as some of the people on the other side of this issue about whether all our safety measures are completely necessary. I know there are lots of people who have been infected with little effect, but that is also how the disease spreads to the people it kills. And that is why I don't feel right doing something that could be so dangerous just because it could be more convenient or more fun or even more satisfying. It's the same reason I don't drive 80 miles per hour in a school zone. I am ready to roll up my sleeves, think creatively, help with budgeting, raise money if needed, but let's do what's needed. Hybrid is working well enough. Let's build off of where we are now and do the research and planning necessary to safely get our kids back to school when we know that that's really likely to be the result. If there's any district that can do this, from everything I've seen, it's ours. And I hope we can do it together.
Thank you.
Thank you.
Kelly, you want to read the next one?
Sure. This comment's from Curtis Bixel on Calendar Lane in Wallingford. I'm leaving a message in regards to the school year and how I would like to strongly emphasize that we have come so far, and to alter our course with 3 months left in the semester would be foolish, putting our teachers in harm's way. We've come so far. It seems erratic and disruptive to put people's lives in danger. Thanks so much.
Go ahead.
Ready?
Yes.
Good evening. Thank you for giving me the opportunity to speak tonight. My name is Monica Zeitz and I live on Forest Lane in Swarthmore. My children attend SRS and Strathaven Middle School. I'm here to express my strong support for the plan presented this evening to allow elementary students the opportunity to return to full-time in-person school, especially given our rapidly declining COVID cases, as pointed out by Dr. Grande and Dr. Rubin tonight. At the last meeting, I shared guidance developed by a group of national experts in various fields, ranging from epidemiology, medicine, and public health to education and ethics. These national experts have carefully considered risk to teacher, student, community, as well as the new COVID variants, and have concluded that children and teachers can safely return to classrooms with mitigation strategies like masking in place. They have studied the school experiences from the fall in the absence of vaccination and with minimum 3-foot distancing, and seen that school can actually be safer than the community in regards to COVID transmission, which was also discussed at the recent CHOP Policy Lab virtual discussion on COVID in schools. We should all continue to urge our politicians to prioritize our school personnel for COVID vaccination, but we should not let this delay a return to more in-person learning. Dr. Rochelle Walensky, our newly appointed CDC director, stated last week, vaccination of teachers is not a prerequisite for safe reopening of schools. While I fully support the proposal to bring our youngest learners back full-time, the timeline is extremely disappointing. I realize that for some children, virtual schooling is working well. However, we cannot forget that with each passing day, there are many other students struggling socially, emotionally, physically, and academically. Given the complexities of bringing these kids back full-time, I hope that planning has begun for a phased return for our middle school and high school students early this spring. While it may be more challenging to accomplish, there is no guidance to suggest that they too cannot safely return to their classrooms full-time. Since speaking up at our last board meeting, I've been called immoral and despicable, among many other things. I can only imagine the hate mail and vitriol that has been directed towards board members. But I have returned tonight to show that those words are not going to shame nor silence me. I'm asking the board to also please be brave. The scientific evidence supports this proposal to allow our elementary children the opportunity to return to full in-person learning now. Our children are depending on you. When the time comes to vote, please vote yes. Thank you for your time and dedication to our community.
Thank you. Kelly, you want to read our next one? Oh, sure.
Right. I'm going to, at this point, read a petition. We received a petition from the WSEA, and we also received one from the WSESP. So the WSEA is the Wallingford-Swarthmore Education Association, and the WSESP is the Wallingford-Swarthmore Education Support Personnel Instructional Support Members. I'll begin by reading the professionals of the Wallingford-Swarthmore Education Association, WSEA, request that the Wallingford-Swarthmore School District Administration and the Wallingford-Swarthmore School District Board of School Directors delay returning our elementary schools to a full in-person learning model until the COVID-19 vaccine is distributed to WSEA staff and has reached its full effectiveness, making such a shift safe for both staff and students. At present, our elementary school hybrid plan allows families the choice to send their children to school while utilizing guidelines created by the Pennsylvania Department of Health and the Chester County Health Department. These guidelines enable all of us to keep a safe social distance of 6 feet while students still receive a quality in-person Wallingford-Swarthmore educational experience. It is our understanding that the school board meeting scheduled for Monday, February 1st will include a vote to return elementary students to 4.5 days of in-person instruction with only 3 feet of mandated social distancing. We believe that this decision will put our students, staff, and their families at further risk of infection if the date of this transition precedes the date on which all of our staff has been effectively vaccinated. Therefore, in the interest of the health and safety of all concerned WSEA members, are petitioning the school board and administration to delay returning our elementary schools to a full in-person learning model based on the following evidence. 1, despite slight decreases in positive cases in the most recent 7-day period, January 8th through January 14th, the Pennsylvania Department of Health Early Warning Monitoring System dashboard shows that Delaware County had a 9.9% positivity rate and 252 cases per 100,000. There was also a significant increase in the number of COVID-19 hospital admissions. These statistics place WSSD in an area of substantial transmission. 2, according to the latest guidelines from Pennsylvania Department of Education and PDOH issued on January 7, 2021, schools in areas of substantial transmission should be all virtual or hybrid, but not fully open. 3, the emergence of a new, more transmissible variant of the virus is circulating in our state and region. The Centers for Disease Control and Prevention statement on Friday, January 15th, 2021, predicts that this variant will result in yet another surge of coronavirus infections by March 2021, leading to increased hospitalizations and deaths. We certainly appreciate the challenges involved in making decisions regarding how open to keep our buildings. WSEA members firmly believe that in light of these imperfect choices, we must prioritize the health and safety of our students, teachers, and their families. Simply put, our first obligation as a school community is to protect the people in our schools. To that end, we suggest that WSSD remain in the current hybrid mode of instruction until the vaccine is widely available and our staff have been fully vaccinated. On behalf of all WSEA members, we want to thank the school board and administration for their careful consideration of this petition. And this was signed by Dave Waldman, president of the WSEA, and 295 members of the Wallingford-Swarthmore Education Association. The petition that we received from the Wallingford-Swarthmore Education Support Personnel, instructional support members, not exclusive of any other WSESPA members, in conjunction with WSEA, request that the Wallingford-Swarthmore School District Administration and the Wallingford-Swarthmore School District Board of School Directors delay returning our elementary schools to a full in-person learning model until the COVID-19 vaccine is distributed to WSESPA staff and has reached its full effectiveness, making such a shift safe for both staff and students. And the remainder of the petition reads the same as that from the WSEA. This petition from the WSESP was signed by 39 members of the WSESPA.
Thank you, Kelly. Please. Good evening.
Kelly Kegel, Beach Road in Wallingford. I'm back. Even though this meeting's not really designed to have people linger and talk, as a single parent, it's difficult to be here at 10:30 to be able to have my voice be heard, which I would assume there's a lot of people in this community that then, it takes away that opportunity from them. So 20 years of kids, my first time being active, coming to board meetings, I don't know how this is the design to have voices be heard. I feel like this in itself is an issue. We are in desperate need of leadership. I have a lot of compassion for the position that you board members are in. I feel like it's incredibly unfair even, especially the way that we've allowed conversation to become that a cry to have say it's crucial for schools, your children to be in school has somehow also aligned with being anti-teacher, immoral, someone that would harm people. I mean, it's irresponsible for our community to allow that messaging to even be going, through the community on out next door or Facebook or wherever this is happening. I don't have Facebook, but a lot gets sent to me. And, I'm going to ask a few questions here that I know can't be answered, but we have a lot of specialists that we bring in to give opinions. And I'm curious if anybody has seeked out a specialist to inquire about the mental health impacts this is having on our children. I don't know if we have had teachers be hospitalized this year so far due to COVID. I know we've had students be hospitalized for mental health issues. So are we seeking out a specialist to get numbers on that and all over the country? How depression and anxiety, suicidal thoughts, I know we talk about equity a lot. This is not equitable. It's not. It's also not sustainable. So have we reached out to anybody to find out how less privileged children are being impacted by school closures? It's frustrating to have us show passion for being equitable and really not walking that path. When I say that we're in need of leadership, we have teachers that have felt comfortable communicating on social media about conversations and reaching out to the community and how they feel. I'm friends with a lot of teachers in this district and think they're doing a great job. I am team teacher, but we are supposed to be representing our students. The teachers have jobs that a union protects them. People don't, it's uncomfortable to stand up here and to be saying this because this backlash that might happen, but the community is being misled and we do not have enough transparency and honesty, and it is allowing people to be pinned against each other and for there to be misinformation. Everybody knows there's a teachers union. It is what it is. It's something that's afforded to that profession. And great if I don't know how they work so well, but great if that's something that is a benefit to them. If teachers unions are contacting the board and asking that meetings be paused, we should come out and just say what it is so that we can then move on or deal with whatever issues come with that. It is what it is at this point. But to have everybody be going around and around and not have all the pieces to the puzzle to know how to get together and work and make some real progress is just delaying things. And the students are the ones that are caught in this crossfire. I don't have elementary students, but they should be in school. They need to be in school. I'm thinking of little kindergartners and first graders that are just not really even picking up maybe on some social cues, knowing when people are, they're picking up on fear on a face or excitement or the interactions. And I think it's great for people that are, their kids are doing well. My kids are doing well. I think that if your kids are doing well, we need to be advocating for the kids that maybe aren't in the same position as we are. So I think that in order for us to be moving forward, we need to have some transparency and some honesty. And we need to stop delaying things too. Can we have a meeting next week about this? Because it's misleading to have these meetings and these talks and then delaying it. And then people think they're having a vote and then all this misinformation that's going around. And now we're here again to talk about it, for a really long time. And then, we'll come back in 2 weeks. I mean, I think it's important to get to it one way or another. Again, I feel for you board members, but you are all some of us have. The students, some parents, we don't have anybody else really speaking up or advocating even for us. So you're who we have to hope can make some hard decisions for us, but ones that are right for students. And I'm not going to repeat a bunch of stats and things that I brought because everybody is doing that. And I don't even know if we're all listening at this point, but we need to have the kids back in school. And people that don't feel comfortable with that, you guys have worked really hard to give them an option. They have an option. And you cannot control the outside world. We have high school students that are washing dishes at Swarthmore Market. We have high school students that are stocking shelves at CVS. We have parents that cannot say they're afraid to go to work in this community or they cannot feed their children. They're not coming here. They're not making petitions. They're not saying everything correctly. They need us. So, I hope this doesn't create a lot of backlash. I hope teachers understand that I appreciate them and everything that they're doing. I hope you guys understand sometimes saying hard things it's exactly what it is. It's hard to do and it feels uncomfortable. But we need to be really moving in a different, this is not sustainable. It's not. Thank you for your time and thank you to the board. I wish I could see the people online, but thank you to those members that, whether we agree or disagree, have been open to conversation and hearing, hearing what people have to say. It's incredibly valuable. And I'm grateful to that opportunity. And it's most of you sitting here in front of me. So thank you very much. All right, transparency and honesty. Thank you.
I just want to, before I go to Kelly, just offer a quick comment, which is to say that, one of the things I feel strongly about in this entire process of decision-making is that we have to have a process. I realize people want a decision as quickly as possible, but we have to give our parents and our families a chance to be heard. And that is what we will do. The survey that we'll put out to our families will give us real data on how families feel about the proposed change. And without that, I personally don't want to make a decision based on dueling petitions and who can collect the most signatures. I don't feel like that's the type of decision that I want to go through. So I do believe we need a process. We're moving it as quickly as possible. There is no special secret going on behind it. You're watching this conversation happen tonight. You're watching the conversation we had earlier this evening. There's nothing, there's nothing else. This is our board discussion on this issue. And all I can say is, from the bottom of my heart, like we're trying as hard as we can, working as hard as possible to try to listen to as many people as we can, because at the end of the day, we do have to make a decision for the whole district. And we need to give people a chance to voice their opinion on this before we make a final decision. And we will do our very best to do that. Kelly, do you want to read the next comment?
May I offer a quick comment though too?
Sure.
I want to say that the decision and reiterate that the decision to postpone the meeting that happened with the snowstorm was a decision that was made entirely in consultation, the three of us, Dr. Grande, Dr. Palmer, and I made that decision, and we made that decision for the reasons that you just articulated. We were being overwhelmed with feedback. We did not have an opportunity to have an in-person meeting, and this is too important a decision and a conversation to not allow the opportunity for in-person. And there was nothing that went into that decision other than that. That was it. So I wanted to share that. This comment is from Nate.
Ms. Walkman, just before we go on, I know that we read the petitions from the teachers union and from the instructional support union, but we didn't read the names for logistical purposes so that I know, will those full petitions be incorporated into the minutes? Because I know that the speakers give their names, but this is a petition and we didn't read those names.
I believe so. Yeah.
They will
It'll be in the record.
Okay, thank you.
This comment's from Nate Brown, Waterville Road in Wallingford. I live with my wife, Joanna, and our children. I had a comment that I just wanted to make to the school board before the meeting here. So let me start by saying that I'm in favor of safely putting all of our students back into schools. Having said that, at this time, putting all of our students back into the building full-time is not safe. A decision to allow elementary students to attend school 5 days a week at 3 feet of social distancing, I think would be questionable at best and irresponsible at worst. The data surrounding in-school transmissions of this virus is murky. Only definitive confirmed in-school transmissions are documented, even though in many cases school transmission cannot be ruled out as a possibility. Admittedly, the 6 feet of social distancing is a guideline and not a mandate, but guidelines have been put in place for a reason. There are many widely accepted scientific principles that are known as theories, even though they stood the test of time for many years. Semantics is a very poor argument for opening schools to less than recommended social distancing of 6 feet. Yes, parents of our elementary students would be given the option to go to the online academy if this decision is made. So now parents will have the choice of either sending their child to a school in an unsafe environment or move them fully online to a classroom with a new teacher and new classmates in the middle of the most inconsistent school year they've ever experienced. Families like mine will have to choose. Will my autistic elementary child continue to go in person to get the social services and in-person support that she desperately needs? Or should I keep my elementary child home so my immunocompromised, fully online high school student be as safe as he can be? Maybe instead of trying to figure out how to fit all of our students in our classrooms, we could find a safer, better way to help our students that are truly struggling with the online system. Additionally, there's potential for the pandemic to leak into the 2021-2022 school year. Instead of focusing how to reopen our schools fully during the pandemic, maybe we should spend some time building a contingency plan in the event that we're still dealing with this next year. Also, CHOP has discovered that a number of children that have been infected with COVID, even though they are asymptomatic, have developed PMA, which is a blood clotting syndrome. The long-lasting effects of this syndrome is currently unknown and is being examined. We should not be taking chances with the potential long-term health of our youth. Finally, your own faculty and staff have made their voice heard through petition. This petition, I've been told, has requested that the decision to fully open elementary schools be delayed until at least the faculty and staff and any person that's going inside the building to perform their job are able to receive the vaccine if they choose to get it. As of January 22nd, Chester County Department of Health has communicated that mass vaccines for our teachers and support staff will not be coming anytime soon. We should not be making our school district employees choose between their health and their jobs. Honestly, the only reason I can see opening elementary schools fully is that some parents are complaining. If the decision to fully open our elementary school is made, then I guess we know what's important to the school board, although it shouldn't come as a surprise seeing how the high school staff and students requested to keep the high school schedule unchanged, but at the request of some parents, the entire high school model was turned upside down. Also, student athletes that are coming in close contact with others from our school and from outside of our school are now potentially going back into the student body. So it's clear to me that science, the desires of our teachers, our staff, our students, and the general concern for the health and safety of our youth and their families all play second fiddle to the vocal minority. Thank you very much for your time.
Why don't we go to the next one? I'll see if someone appears.
This is from Melissa Carden, Stratford Lane, Wallingford. I have two sons, one in 5th grade at West and one at the middle school in 8th grade. First of all, I would like to say thank you so very much to the school board and the teachers for how hard everyone's working during this very difficult time. I chose this area because of the school district, and I'm grateful for the high standards and the great education that my sons are getting. I'm calling to say I was grateful to see that the CDC has come out this week to say there's little risk of coronavirus transmission in classrooms. I know that there is an immense risk for students stuck at home, but I'm calling to let you know that I believe we should follow the CDC guidance. I think we should work towards in-person schooling. Specifically, I think we have to follow the data and do what's best for our kids. We know that they have loss of learning, and particularly I'd like to talk about mental health, anxiety, loneliness, depression. These are things that we're experiencing as a family, and I know many other families are also. In fact, I feel that if you're a family that's not experiencing it, you're probably in the minority, not the majority. So I would like to say I wholeheartedly support getting the kids back to school and support it with all of the proper guidelines. I think it's essential for the well-being of our children. And like I said, if we support the data, if we follow the data, then this is where it should take us. Thank you so much for all you do to educate our kids and keep everyone safe.
Keep on going. Yeah.
Don Crone, Rutgers Avenue, Swarthmore. I'm the parent of a 1st and 4th grader at SRS. As scientists, my partner and I have been carefully monitoring COVID cases in our area and nationally, and want to commend the school district on the decisions they've made thus far to keep our children, teachers, and community as safe as possible during this pandemic. We also want to thank you for holding a special board meeting to discuss bringing our elementary children back 5 days a week for in-person learning. We were 100% in favor of a return to school 5 days per week and encourage the school board to vote in favor of our children's health and well-being. Based on the CDC new recommendation to get children back in school and that children are not drivers of the spread of this SARS virus, coupled with a 30% drop in COVID cases nationally compared to mid-January, it seems like the right time. We know you're weighing the data, the recommendations, and the health and safety of our community, but I want to relay our own experience with hybrid learning in our household, which I'm sure echoes the experiences of many. Virtual learning is particularly challenging for our youngest learners. Our 1st grader was still learning to read and write. It's really challenging to both stay engaged and to learn via Zoom. I witnessed him attempting to write the mirror image of letters on his whiteboard to show his teacher the image on the computer screen because it's not in the right orientation. This is so incredibly problematic for learning letter formation, and he is really struggling with learning to read. In addition, there are regular tears and frustration with completing schoolwork and trying to juggle multiple Zoom meetings for each child while my partner and I both work full-time. This has been nearly impossible and an emotional toll on our household. We both run research labs and teach at the college level full-time, which requires us to work outside the home, and it's been a scramble to find childcare to allow us to continue to do our jobs. We're fortunate that we can afford to do so and have flexible work schedules, but it's been a considerable financial burden. The stress of making sure we can do our job and the kids can do their virtual school and be taken care of is significant. With that said, we recognize we are very fortunate and cannot even imagine the burden this is placing on the most vulnerable families and children within our community, whose parents need to work full-time outside the home and have less financial means and work flexibility. Offering them the possibility to attend school in person 5 days a week will have the biggest impact on those families that are struggling the most. We see the teachers working so hard to support students both in the classroom and at home. This must be completely exhausting, but we commend the job they've done so far trying to keep our students engaged when they're at home. For our teachers and children's mental well-being, we hope you will bring our children back into the classroom to learn from their wonderful teachers in person starting on March 4th. We urge the board to please let us salvage in a few months of what, we urge the board to please let us salvage in a few months of what so far has really felt like a lost and frustrating year of learning. Thank you. Deborah Caruncio on South Chester Road in Swarthmore. I have 2 children in the Swarthmore Rutledge School District, the Swarthmore Rutledge School, and they are both in 1st grade, Nate and Sam. We are in favor of in-person school 5 days a week based on the most recent scientific data available and based on a number of opinions and healthcare figures in the community, to include those at CHOP and the American Academy of Pediatrics. I am also a nurse and work in the field of oncology. Our kids are falling behind on academic and psychosocial issues. We were advised that this would be a few weeks. It is soon going to be 1 year since our kids have been in school for 5 days a week. And this is why me and my spouse feel that our children should be back at school 5 days a week based on the most recent scientific data. Please help get our kids back to a normal way of life. Thank you. This is Allison Collings, Fox Lane in Wallingford. My son and daughter both attend Wallingford Elementary School, and this is a message for Dr. Palmer and the school board with regards to the meeting that is occurring tonight to review the return to school plan and timeline for elementary students. I wanted to call to express my concern about the lack of information that has been provided to the community up to this point on this plan that I understand, based on what was mentioned in last Monday's meeting, will be voted upon tonight. This plan is a big shift for everybody involved, staff, teachers, students, and families. We all need time to consume this information when it is presented, weigh the pros and cons, and determine the right path forward. The board members need to hear from their constituents, incorporate that feedback into their vote. Therefore, I implore you to please postpone any action on this plan in tonight's meeting. I also want to express my concerns about this plan. We are going into what is deemed one of the most dangerous, heightened parts of this pandemic, with new variants and strains now coming into the United States. We are learning that we are not able to get our citizens vaccinated as quickly as we'd like to, yet we are now being proposed a plan for our elementary school students to go back into school at full capacity and have their teachers go back in and teach at full capacity without having the protection of a vaccine ahead of that. I know we all value our educators. We all value our children's lives and families, and I think this is an egregious mistake. Please, please consider that this is not a necessary decision. There are families that are in the cohort model and that is working for them. By making this decision, you're taking that option away from them and forcing them to either put them in school at full capacity in a dangerous environment or change them from the classroom they've been in for more than half of the year with a teacher they have a relationship with and move them to the online academy. This is a lose-lose situation. I beg you to please think about this, take some time, and not make any rash decisions around this plan. Thank you very much. And I'll finish with Liz Corson's and then we can pass it to the next. Liz Corson, Pritchard Lane, Wallingford. I am both a teacher at SRS, a parent of West Strathaven High School alum, and a resident of Wallingford. I'm calling to urge you to wait to implement the full in-person learning model until teachers and staff have been vaccinated. Like everyone, I desperately want the full in-person learning model to already be happening, but we are currently in a pandemic with more virulent strains already in Montgomery County. The risks to returning to full in-person learning model are many, and these risks can be reduced if 1, all teachers and staff are vaccinated, 2, the ability to open all classroom windows is addressed, 3, the question of how children will safely eat both snack and lunch in the full in-person learning model with 3-foot nose-to-nose distancing is addressed. If those 3 issues are not addressed before returning to the full in-person model, we put our community at risk. Our teachers and staff, our older community members, which include my 81 and 82-year-old parents, and the many seniors living in our school district, most of whom are also not yet vaccinated, and any other community member who's not yet vaccinated, which is the vast majority of our district. I just made an appointment for my parents to get the first vaccine at the start of March. They will not have immunity until April, and I was lucky enough to sign them up for an appointment after trying for 2 weeks. I urge you to wait to return to the full in-person learning model. The WSSD community who do not have children currently in the schools have not been informed of this plan and they will absolutely be directly impacted, especially if or when the more virulent COVID strains arrive as predicted in March, at which time this plan would mean whole classrooms would be quarantining for 2 weeks at a time instead of one child quarantining at a time, as we are currently able to do with the 6-foot spacing. Thank you for all your work to do what is best for our children at WSSD while also considering the entire WSSD community.
Okay, I'll take the baton on the next group. The next one is Jennifer Costello Siri on Saybrook Lane in Wallingford. I'm calling in regards to the meeting this evening about bringing elementary kids in full time. I do support this. However, I know you understand that people do have concerns about it. You know, I've been looking at all the research. It seems that the benefit to having as many kids as possible coming to school seem to outweigh the risk. I'm personally am more concerned about my 6th grader who had been happy and thriving throughout elementary school and now has been very depressed and anxious and unfortunately been home by herself 3 days a week and unmotivated. My 4th grader seems to be doing better than her, kind of just skating by, but her sister is really having a tougher time. I almost wish at the middle school age, maybe due to my own personal issues, that was going more often. Although I know the younger kids need to be at school more as well, I can say that in the health provider in the area that I've seen more and more children who are having mental health difficulties due to not having school and other activities, a lot more depression, a lot more anxiety. I tend to just work with middle school and up, but I'm definitely seeing a lot more kids come in for a session and talking to my colleagues that this has recently really increased. So my hope is they can get into school more. I know there are concerns around this and I understand that people are nervous, but from everything that I've been reading about and learning is that the benefits of having them at school far outweigh the risks. I trust that our district would be really vigilant for enforcing masking and keeping good distancing. Thank you. Next up is Rebecca Davis on North Princeton Avenue in Swarthmore. I'm calling to strongly state that I hope schools will not go to 3-foot distancing or have all staff back in the building until all teachers and other building staff have been fully vaccinated and that accommodations are made for staff of any kind who have medically vulnerable family members, such that staff may still receive their salary and benefits. Thank you very much. The next one is Louis DiCarlo on Wilder Road in Wallingford. I'm a taxpayer. Children should be back in school full time. Next up is Terry DeCaesar. Thank you. My grandson, Luke Cherian, is in Mrs. Ire's 1st grade hybrid class at West, and I'm the schoolwork monitor on Monday, Tuesday, and Wednesday. First, we would like to commend the school district on the outstanding job it has been doing in meeting the needs of children and their families in this very challenging school year. They've made it possible for families to choose their own comfort level in managing their children's schooling in the midst of this pandemic, and have made sure they do so following the science. The hybrid model has been exemplary in keeping children safe through carefully enforcing social distancing and masking. Our family has been very impressed and very pleased, which is why now we are confused and upset by the sudden efforts to get elementary school back to full in-person class by March 1st. Based on all the recent reporting about the current stage of this pandemic, we are worried the district is not continuing to follow the science. Our understanding of where we are based on listening to many experts is that we are in the midst of the deadliest stage of this pandemic. While there's been a bit of plateau in the past week or so, none of the experts are predicting that the worst is over. Even President Biden has said on many occasions that over the first few months of his administration, we will see COVID deaths climb to over 500,000 by March, which seems like we are on track to meet the new variants, which in some cases are more deadly and have a much higher rate of spread, could bring those numbers even higher. Many experts are recommending double masking. All experts are continuing to emphasize social distancing. We wonder how on earth the children will be able to socially distant when the numbers in the classroom will be doubled. As far as getting protection from the vaccine, the Biden administration has just received a promise of 200 million more doses, but those won't arrive until at least May or June. In the meantime, trying to get a vaccine is like winning the lottery. I'm 67 years old and I own a child daycare center which serves 65 children and employs 18 staff. I and my staff are on several lists for the vaccine, and based on what we are being told, we are not expecting to receive it until at least the spring. It's highly unlikely that the majority of teachers, parents, and grandparents at Wallingford-Swarthmore School District will be vaccinated by March 1st. We feel very good about the safety of the current hybrid model for Luke. However, going to full in-person class would force us to choose the online academy for Luke's safety and the safety of our family. This would deprive Luke of 2 days of normalcy, 2 days of in-person instruction, and 2 days of pure interaction. We hope you will not make this sudden and ill-informed decision and keep the current model as it is until the science shows that it's safe to do so. Thank you for your time and consideration. Next, we have Kristen Dole from Haverford Place in Swarthmore. As someone who has been pretty closely following the latest CDC, CCHD updates, I was surprised and confused to learn of the suggestion that conditions have warranted a change to full-time in-person learning. I, like many, would love to see my kids return to 5 days a week in person and wholeheartedly agree this is how their educational needs can best be met. But I also, like many, am not willing to compromise health and safety to achieve this. Our board has rightfully from the start relied on bodies such as CDC and CCHD for their leadership and guidance as relates to matters of data, medicine, and science. This reliance has brought us to the point we are today with having delivered roughly 4 months of hybrid instruction in a relatively safe manner. So today I'm respectfully asking the board, number one, why the shift in the absence of shifting guidance from these bodies? It seems to me the guidance has not changed, but the interpretation has. Number two, with the understanding that this is an incredibly difficult situation to navigate, why weren't parents surveyed as we were in late summer before the hybrid model was offered? For families whose children have participated in the hybrid model, this is a huge change and we are left with an impossible decision. Pull our kids from the current teacher classroom and opportunity for some in-person learning, or accept the risk, which we firmly believe they and we will be incurring. Number three, if this proposal goes through, what additional PPE will be put into place to keep both our students and staff safe? My understanding is that social distancing above and beyond masking is key. As a school psychologist administering in-person evaluations, the medical guidance I've received is that additional PPE, I think there's a typo here, required in circumstances when 6 feet is not attainable. Next up, we have Emily Ekman, Westminster Drive in Wallingford. I'm calling in today to show my support for the Wallingford-Swarthmore School District teachers and staff who have come to work during a pandemic every single day, who have showed such care and understanding during an incredibly hard year. I myself had the most amazing opportunity to grow up in this town and attend school in the school district. 4 years ago, we made the decision to move our family back into the district after having our set of boy-girl twins. I truly have cherished my time in the district as a child, and I hope my children will eventually cherish memories once they start. I have an overwhelming feeling and desire to oppose the vote this evening to bring kids back full-time to school at this moment. Our teachers deserve to get vaccinated before we decide to add more kids and decrease the number of school distance. My kids have had the option to attend the online academy. Have all of our teachers had that option as well? Do my kids have hard Zoom days on Zoom? Sometimes they do it. Is each day easy with math and English? Not always. We are making the best out of the year and are staying positive that next year may bring back some normalcy. My children are SRS in kindergarten with Miss Cooper Smith. She has been amazing, not only with our children, but our parents as well. We are truly lucky to have her this year, and what a pleasure to have her as part of the school district. I would not be surviving this year without her help. With all due respect, I expect more from our board and our leadership. Why do you feel these teachers should be Why do you not feel these teachers should be vaccinated before we bring more kids in and go to 3 feet distance instead of 6 feet? I find it completely inappropriate and what a slap in the face after these teachers and staff have worked so hard for our students so far this year. These teachers deserve respect and patience from parents in this district. Their health is just as important as ours. Our children deserve to work in a safe environment and our teachers to work in a safe environment and to give them the opportunity to get the vaccine before we bring more kids into our school and more cases of COVID occur. Does everyone on the school board know every single health issue of our teachers in this district? How many teachers have sick children at home? Do you know what teachers have elderly parents living with them? Do you know what teachers have cancer or autoimmune disease? I urge you to think about these questions before you vote. Have any of the board members walked in the halls of the school? Have you gone into the classroom and asked how these teachers are doing? Just because they look healthy doesn't mean they are. I just look fine like any other parent in this district. However, don't always judge a book by its cover. As I sit in my chemo chair today, calling in to support our teachers, you think about life. I'm fighting for my life every single day. Please do not put these teachers in the same position as I am. Let's do this safe and not rush. Let's give these teachers the respect and dignity they deserve and have them vaccinated before you send them into a war zone of germs. Let's take care of the ones who take care of our babies. We all want to be in school. We are all longing for the day of normalcy. That lifestyle is going to come back, but it's going to take teamwork and it's going to take time and patience. I know not everyone on the board agrees, but we could use less eye rolls and head shaking when it does not fit your agenda. Jen Lentz, we need to do better. We need to treat people with respect on both sides. We are all watching. These teachers deserve our love, our empathy, and our compassion, not snarky, hurtful comments. This year has been about the hands of the people who are trying their best to make the best plans for our kids' education during such a horrific pandemic. I've always thought of Wallingford-Swarthmore School District as a leader in Delaware County. Let's lead and show other districts we not only care, but we also care for our teachers. Garnet Valley School District has this idea. Why do we not? Our kids wouldn't be who they are if it wasn't for our teachers and staff in this district. Let these teachers get vaccinated and set a good example for the other communities around Delaware County, set the standard high and be the leading district. I thought they joined. Next up is Andrea Fabricator on Briarwood Road in Wallingford. I'm calling to voice my concern about the plan to vote to fully return the elementary school kids to full time. I wish I had more and more notice about this in advance of this vote. I believe that both the vote and the decision to return the elementary school children to full time, I feel is rushed. I think that if there is no plan to wait until every teacher that wants a vaccine has been able to be fully vaccinated, then this feels unsafe. If there's not an abundance of clear and convincing evidence that social distancing of 3 to 4 feet is as effective as 6 to 8 feet for students, teachers, and staff, then this is unsafe for the entire community, not just the children and faculty and staff that are there. I believe this is an unacceptable burden to force families to have to decide between doubling their children's daily exposures or having to change teachers 2/3 of the way through an already chaotic and unstable year. I think that if there are no plans and resources for regular COVID testing for all teachers, staff, and kids, then this plan is premature. I feel this plan is not aligned with current CDC recommendations for safe operation of schools. This is irresponsible. It seems rushed. I hope the board will hear and consider these concerns. Next up is Anthony Fabricator on Briarwood Road in Wallingford. I would like to have this message read into the record at tonight's district meeting. I would like to voice my concern about the plan to fully reopen the elementary schools. The lack of ample notice for community members to voice their concerns as parents and ask important questions is unfortunate and unacceptable. It is unsafe and premature to return to full in-person learning for elementary students before every teacher, administrator, and staff member who wants to be fully vaccinated is fully vaccinated. It's premature to fully reopen the school before there's clear and convincing evidence that reducing physical distancing to 3 to 4 feet is in fact safe. It's not acceptable to force families to decide between doubling their kids' daily exposure or their own daily exposure, or changing teachers 2/3 of the way through an already chaotic and unstable year. If there's no plan and no resources for regular COVID testing for all teachers, staff, and kids, the plan is premature and unsafe. If the plan does not align with current CDC recommendations for the safe operation of schools, it's irresponsible. This seems rushed, and I hope the board will hear and consider these concerns from all community members before holding the vote. Next up is Marshall Feaster on Highland Avenue in Wallingford. I'm calling to encourage the school board to vote to return to full-time in-person learning as soon as possible. The children of our community desperately need social interactions, in-person instruction, and attention from our highly skilled educators. The adults of our community need to be able to count on schools to be open so that they can be productive members of the community and so they can earn income needed to pay the taxes that the schools need to operate. We know that some families will choose to continue remote learning until they are comfortable to return to in-person learning. The concept there is choice. As of now, families who wish for full-time in-person have no choice. Show us that we are the top-rated school for a reason, be a model for other school districts, and show them WSSD can safely provide a world-class in-person education. Thank you for your time. Next up is Elizabeth Feldman, North Swarthmore Avenue in Swarthmore. I'm really looking forward to getting students back into the buildings and moving in a more normalized direction. I want to make sure we're doing this with the utmost care and consciousness towards safety and sustainability. However, I really have some concerns and several questions regarding the plan to go to 3-foot distance spacing in grades K to 5. I've had the privilege of attending the following school districts board meetings: Rose Tree Media, Radnor, Lower Merion, Upper Darby, Marple Newtown, Garnet Valley, Upper Merion, Central Bucks, Council Rock, Penridge, Neshaminy, Palisades, Quakertown, Beaverton, and Wissahickon. I've been privy to every one of these school districts' reopen plans to even open in hybrid from all virtual. Central Bucks had to go to 3 feet because of their classroom size and classroom capacity. This is really not a novel plan, and many, if not all, school districts are struggling with the same issues we are, including but not limited to: will the health department approve the plan? Will PDE approve the plan? Is 3-foot distancing a violation of the attestation? Is it safe to do without vaccinated teachers? Do we have the right mitigation in place per all of the guidance in order to move to 3 feet? All the hours, it seems, is planning for COVID and its effects, which will be around at least through the 2021-2022 school year. They've all budgeted for the continuation of the cyber options, surveillance testing, substantial masking requirements, and renovations to their ventilation system. They've also planned for the inevitability of a fluid shift between in-person and virtual instruction as needed due to infection rate. They've been applying for and getting a number of grants to support these efforts. Also, they opened the last couple of weeks after discussing to keep their kids in clusters. There's no mixing with other classes at all during the day or the week. This is in the middle school and high school as well, and it will take a lot of thought and time to set up middle school and high school clusters to stay together all day long. Additionally, I commend Owen's pandemic response team for their early intervention education program since late February. That's Elwyn's. We get daily briefings and twice weekly readings to prepare and react to the changing landscape of this pandemic. I've been looking at all of these plans and ideas with an extremely keen eye, and all but WSSD is planning and preparing for the new variants. We don't know if the vaccines work effectively against the Brazil and South African variants, which are more transmissible and deadly. They do suggest, however, that Pfizer and Moderna do offer some protection against the UK variant. The JAMA meta study suggests that the evidence for reducing distancing is not as strong as the mass media would suggest. There's a lack of credible data about in-school transmissions, especially since no one is tracking asymptomatic transmission. I would hope we would consider the proposed reduction of safety protocols and mitigation measures only after our teachers are fully vaccinated. We know that even when they're vaccinated, we still need rigorous infection control protocols. So I'm proud to say that WSSD has been open to in-person instruction for 18+ weeks. Many schools are still all virtual and have not been reopened. I'm really excited to get our kids to return, but also return safely and sustainably. In-person instruction can only happen with trust and community commitment to safety and compliance. We need to prioritize safety and put in all possible infection control and mitigation protocols if we want to prioritize keeping schools open. We all have to commit to masking, distancing, testing, and being truthful on the screening form. Now, here are my questions. Are you consulting with the health department and CHOP policy lab on your plans? Will KN95 masks, face shields be provided to teachers? Will we require more substantial masking for students? Have you visited the other school districts for doing 3 feet distancing? What districts have you met with? What have you learned from that? Does it inform your plan? How is the timing of the shift work? How will we accommodate kids and families who want to move to online academy from hybrid due to the less than 6 feet distancing? Are you accounting for paraprofessionals and other staff in the classroom? Will you continue to space adults 6 feet? How strong is your surveillance testing and contact tracing? How many tests are we getting and how will they be divided? How much time will families have to decide about what they want to do with their children? Are we relying on flawed information to make safety decisions? How will you keep specialist teachers safe as they move from class pod to class pod? Will we be escalating our cleaning protocols? We heard that students in online academy are academically outperforming the in-person kids. So what is your plan for helping in-person kids to catch up? Can you confirm that all schools have ventilation systems that exchange the air 4 to 5 times per hour? What will you do about the disparity in class sizes between the elementary schools? Some may be able to distance better than others. I really do hope there will be thoughtful planning and the necessary systems to keep everyone's staff and students as safe as possible. At this point in time, I don't have the confidence in the district's ability to keep people safe given the protocols we have in place. I want us to be able to return students to classrooms safely and sustainably. Thank you for your service and dedication to our children. I think I hand off at that point to Matt.
I have the next 10. Bill Foster, Strathaven Avenue, Swarthmore, PA. Regarding the proposed full reopening of K through 5, I don't think this makes sense until the district employees and district contractors are fully vaccinated against COVID-19. The COVID-19 vaccines are highly effective at preventing serious disease and hospitalizations, including serious disease from the increasingly widely circulating, more contagious and fatal variants of concern. These vaccines are really revolutionary with respect to their speed of development and efficacy, their ease of reconfiguration in response to virus mutations, and their ability to simultaneously activate 2 important types of antivirus immunity. All of this progress is fantastic positive news that we must take advantage of before a full school reopening at any grade level. Waiting until staff are fully vaccinated is especially important right now, given the rise of the more transmissible viral variants that have driven European countries that had fully reopened schools to transition to fully closed schools. We should keep their recent experience in mind in making this decision, but also remain hopeful and focused that we can vaccinate all staff and move on to full K through 5 reopening soon. It's just not yet. Sally Fowler, East Country Club Lane, Wallingford, PA. I do not have an elementary school student, but I do have a senior in high school, and I want to express my concerns over opening the elementary schools prior to the teachers being vaccinated. I really think in the times we have right now, where there's increased strains that our teachers could be more susceptible to, I think it'd be very good for them to be vaccinated before having a full classroom of students sitting closer together, eating all together with no masks during eating. That's the biggest point, not being able to isolate or provide distance when they're maskless and during the winter times when you can't go outside for lunch. I believe that it would be in their best interest to have the teachers vaccinated and then reopen elementary schools. Thank you for your consideration, and hopefully you make a safe decision for all, including the teachers. Lindsay Goldsmith Markey, Brookside Road, Wallingford. I wish that this plan had been introduced and defended to the community well in advance of this evening's vote. Since it was not, I offer some conditional statements to the board in hopes that they will be used as guidance to make a safe and responsible decision. If the district has not garnered the support of the elementary school teachers and provided realistic professional options for all of those who disagree or are comfortable, then this plan is not tenable for our educators. If the district does not intend to wait to implement this plan until every single teacher that wants to be vaccinated, then this plan is not safe for our teachers. If the district does not have an abundance of clear and convincing evidence from multiple peer-reviewed, respected science and public health sources that social distancing of 3 to 4 feet is as effective as social distancing of 6 to 8 feet for our elementary school students and for the teachers, administrators, and staff who work in our elementary schools, then this plan is not safe for our community. If the district does not have a plan in place such that children who do not feel safe doubling the number of other children that they're exposed to each day at school do not have to change teachers 2/3 of the way through what has arguably been the most tumultuous school year of their life, then this plan is not emotionally acceptable for our children. If the district does not have plans in place and the resources secured to implement regular COVID testing for elementary school students and staff, then this plan represents a premature move to increased exposure. If this plan is not in alignment with current CDC recommendations for the safe operation of schools, then it is unwise and irresponsible. If each board member does not have the intention of listening with open ears to the voices of the community and then using that feedback to inform their vote, then the potential adoption of this plan constitutes a breach of justice in our community. I sent an email to you all on Friday urging to you to slow this process down and hold off on voting until the community has more time to process the plan and respond. I gave you access to the results of a Google form where you could see names of WSSD community members who support that letter. As of the time that I recorded this message, 168 people had signed it. I urge you, in this time of virtual interaction, where we have lost some sense of what it is like to be present with other people, to imagine 168 people standing with you wherever you are, 168 people in front of you asking you to slow down, to think, to hear our voices. Nicole Gordon, Angle Drive, Wallingford, PA. My husband and I have 2 children who go to Wallingford Elementary School. I'd first like to thank the school board and the administration, and especially the teachers, for all that they have done to help our school and our students navigate these challenging times. Up until this moment, I've been very pleased with how the health and safety of our students and the health and safety of our teachers has been a priority for our school board and for our administration. I have to say, though, that I feel like the decision to move full-time for parents to choose full-time or to choose full virtual is hasty. In order to do this, I believe that you would have to relax the 6 feet social distancing in classrooms. My daughter in 5th grade has 27 kids in her class, and there's no way that if everyone chose to come back, they would be able to maintain 6 feet of social distancing. I was watching the board meeting from last week, and I understand that you're citing some surveys, but from my understanding, the CDC and the Chester County Department of Health are still recommending 6 feet. I work in a district and they're considering bringing students back, some students back on a staged reentry, and they're still maintaining 6 feet. When I speak to my daughter about it, because we've been very safe in trying to help her, but really be aware, my 5th grade daughter, she's concerned because it feels like people will be too close because we've drilled 6 feet into them. We are so close to having our teachers vaccinated. I appreciate that you're looking at a testing program, but with the new variants coming up and with the cases still not under control, I believe we're still in a high spread county, that I feel like this is a hasty decision, and I don't feel like it's fair to the students who chose hybrid or kids that are virtual for them to have to then choose to have a brand new teacher. I can't afford to have my kids virtual 4 days a week. I can't afford to have them virtual 2 days a week. And so essentially I don't have a choice regarding this. I'm disappointed that you're moving this quickly without surveying parents about whether or not most parents want this or not, and without giving a little bit more information about how you're going to maintain the safety. This district has always put the health and safety first for their teachers and their students. I'm just disappointed. I'm really, really disappointed that this is being talked about and being done so hastily. I want to thank you for your efforts up until now, and I want you to believe that are postponing a full return to learning until there's more information and until our teachers have been able to be vaccinated. Thank you so much. Marta Guron, Meadow Lane, Wallingford. I'm calling because I want to voice my support of opening the elementary schools to full 5 days in person. My daughter is at the elementary school and she has lagged, basically a grade level in reading behind. Virtual learning is not for her at all whatsoever. I work full time. My husband is unemployed and is trying very hard to find a job. We have a 5-year-old. We have a middle school child as well. And honestly, we can't be everywhere at once. It's just not possible. The school district hasn't given us any options for having any kind of full daycare, and we haven't really been asked at any point if our children have a safe place to be with access to food or internet, any of those things. No one's ever asked me that anyway, and you know they don't know. I know my kids are one of the fortunate ones in that sense. We at least have a roof over their heads and they can eat, but I'm not sure that's true of everyone. And given the new commitment to diversity, equity, and inclusion, I think it's absolutely critical that the district is able to provide as much in-person education for any student that needs it, whether it's for physical resources, mental health resources, or just the ability to be around other people and not have the distractions of being at home and having to deal with internet that is not great sometimes, and Zoom that kicks you out and being marked absent even though you're there. The number of times I've had to call about my student's absences in middle school, even though he's right there, is frustrating. I have other things to do, and I have to sit there and basically prove that my child is there. That's not a good use of anybody's resources. Also, the symptom tracker. I don't know why it's being sent at 1 a.m., 6 a.m., and 7 a.m. Most people I know asleep between those hours, so I generally fill it out without seeing my children. When my child was ill, I did not send him to school as you're not supposed to, but then it was a whole big thing trying to make it so he could Zoom in. It's a big giant headache and there aren't good policies. They're not consistent with what the research shows. I'm a PhD chemist. I know about data and we're not following it. We're following our understanding from March and April, and our understanding is a lot better now. A lot of studies that have come out show the same thing. The studies that have been used to refute the safety of opening schools have been in other situations where there are way more students, where there's way less space. The whole masking thing is different. There's so much more data that shows, in fact, the transmission of COVID is much, much less when students are in school, because when they're not in school, they're somewhere else. If they're somewhere else, that means they're mingling with more people in the community. It just makes sense. Whereas allowing them to be able to be in kind of one tight-knit community, there's just less transmission. The folks who want to remain virtual absolutely should have that choice, and there's no reason to believe that's not the case. I also want to add I'm an educator myself. I've been in person since August. It's not impossible, and I don't feel unsafe. I've never felt unsafe in my situation. I believe from what I've heard from various teachers of not only my institution, but even at district institutions, there's plenty of teachers who will be more than happy to teach in person. So I really believe we need to get a little more creative and make this happen for our kids. Thank you so much. Dr. Darcy Hayes, 909 West Hill Avenue, Swarthmore. I previously emailed the board, but I thought it necessary to have his comments reflected in the record. It is unconscionable to me for the board to consider voting on a proposal to negate prior public health advice regarding the classroom and maintaining appropriate physical distancing without the input of local public health and pediatric experts. As CHOP Policy Lab was a frequent collaborator on prior decision-making, I respectfully request that the board delay their votes to enable such time for these valuable public health experts to check in and for the community to have time to digest their input. I will also note for the record that as of today, Monday, February 1st, according to the CDC COVID data tracker, our most recent countrywide 7-day total indicates 295 cases per 100,000 individuals, which is indicative of the highest risk of transmission within schools per CDC metrics, and that the Pennsylvania Department of Health labeled this number as their highest risk category of substantial, which triggers their recommendation for the consideration of blended learning for elementary schools only versus full remote learning. Well, though, I certainly acknowledge the board's autonomy in decision-making and understand that these metrics are recommendations rather than requirements. I ask that it be noted for the record that if the board votes to resume full 5 days a week in-person learning for elementary school at the expense of physical distancing, the board will be doing so against both state and national current public health advice. Informed decision-making is critical when lives are at stake, and I'm quite distressed and what appears to be very rushed timeline to push forward a critical decision in the absence of formal public health input. Justin Hensel, Plush Mill Road, Wallingford. I fully support the motion to return the elementary schools, and all other schools for that matter, within the district to full-time, 5-day-a-week instruction. Our children need a daily structure and normalcy of school Their mental, physical, and social well-being depend on it. The data on the virus in our state and county, according to pa.gov, warrants a safe return of our students and staff to the classroom. The hybrid system has run its course. The asynchronous learning day on Wednesday is another lost day of learning, and to believe a school district administrator would try to support this asynchronous day to count toward the 180 days of instruction required by the Commonwealth is absurd, and I hope taken out of context as reported in the Swarthmorean. This has not been easy for any of the parties involved, but just as every other industry has figured out how to operate in this environment, the school district needs to as well. Thank you. Nancy Hotham, Calendar Lane, Wallingford. I'm calling to request that you delay the vote for full reopening elementary schools in the Wallingford-Swarthmore School District. I don't understand why it's being rushed. My concern is that every teacher has not been fully vaccinated. And until that time, you should not be putting the children in there 5 days a week. Has the school board talked to teachers, specifically in the elementary schools? Have they visited the elementary schools? If the school board members have not visited an elementary school within the last 2 months, there's no way that this should pass. Every school board member should be in those buildings to see what it's like in an elementary classroom. If you're afraid to go in those elementary schools, then those classrooms should not be packed with students. Thank you. Laura Hunter, Cornell Avenue, Swarthmore. My son Gavin is a first grader at SRS. I just want to leave a message that my family is strongly in favor of our schools fully reopening. We believe that this can be done safely with staff and students. My son is a first grader. He's never experienced a full year of in-person learning. I'm deeply concerned about not only him, but all students falling behind academically, socially, and emotionally. As a working parent, I rely on a network of childcare to cover virtual learning in the various days off. And I worry about involving people from different communities that actually make it less safe compared to just remaining an SRS pool bubble. So I'm overall very, very in favor of the school fully reopening. Thank you. Maribeth Kearns, Wilder Road, Wallingford. I have 4 children in this district, and I'm calling in support of the return to full-time in-person education at the elementary level. I'm hopeful that this positive change will lead to the return to full-time for the middle and high school students as well. As a nurse for over 20 years, I have always been in support of decisions made on the basis of scientific evidence and facts, as opposed to the ones driven by fear or personal opinions. I think the time has come to put aside the what ifs and what might happen and take a hard look at what is actually going on as a consequence for schools remaining even partially closed. The mental health of our students, especially teenagers, is suffering and suicides are on the rise. I personally have shared with the board my 10th graders' severe struggles this year, and I sincerely hope that no child will become a statistic before changes are made. Schools across our country, state, and our county, state, and country are proving that the return to full-time in-person education is possible and safe. I implore the board to make our students their priority and move forward with the decision to transition. Thank you very much.
Thank you, Matt. Rochelle Kelly, West Country Club Lane, Wallingford, Pennsylvania. I'm calling about the special board meeting that's scheduled for Monday, February 1st to discuss the elementary schools. It's imperative for our children to return to in-person learning at least 4 days a week. They're losing valuable time and our at-risk children are at a true loss. Other area schools return to full in-person learning with ease. It can be done safely and effectively. Science tells us that children younger than 8th grade are at the lowest risk. In our district, we gave our families options. If in-person learning doesn't work for you, they can choose the online academy. But for those of us who have chosen the cohort model, we need more than 2 days a week. Our children need consistency to learn interpersonal communication skills and to be held accountable. They need this consistency to effectively learn math, writing, and all forms of language arts. Please send our elementary age children back to school. They really need us now. David Laird Jr., East Rose Valley Road in Wallingford. I'm calling to comment, excuse me. I'm calling to comment on the recent discussion about sending the elementary school children back to school in person while ignoring the CDC recommendation and spacing students at least 6 feet apart. Why would Wallingford-Swarthmore even consider ignoring the scientific experts whose knowledge base on COVID-19 is far beyond almost all community members? Wouldn't these decisions be better left to the experts? What other industry is currently functioning in an environment with 24 or more people in a room with less than 6 feet to socially distance and for longer than 15 minutes? Center doctor offices know. Many have reduced their appointments. Even when patients are seen by fully vaccinated staff, patients are asked to wait outside or more are spaced far apart in waiting rooms. Almost all businesses continue to have their employees work from home until COVID-19 is under control and an acceptable level of herd immunity has been reached. It is horrific that we cannot accompany our loved ones to hospitals or emergencies, or even be in a hospital to comfort sick family members as they're dying alone from this deadly virus. And why is this? Because it's not safe. We're in a global pandemic with a virus that continues to mutate and is producing new, even more transmissible strains. Yet Wallingford-Swarthmore School District is considering sending their school personnel into these unsafe conditions, knowing very few of them have been vaccinated. This is unconscionable. The vaccine is on the horizon. We're almost there. How can we risk the lives of our teachers, administrators, bus drivers, support personnel, and the community as a whole? Because we could not wait a few more months until the vaccine can be disseminated to those who need it. Pandemics do not simply end because we are tired of following the protocols necessary to ensure the safety of ourselves and others, or because we want our children back in school and like to return to normal. Pandemics end when we can take the necessary steps to prevent the spread of the virus and vaccinate our population. A large part of the child's education is learning to become responsible global citizens and socially aware community. How do we tell our students that the desires of a small group take precedence over the good of an entire community, and that we will ignore the state guidelines for eradicating the virus and jeopardize the safety of others? Is this the lesson we want to impart to our students? I implore the school board to do what is ethically and morally right. Do not cave to the pressures of this vocal minority that is putting their self-serving individual agenda above the safety of this whole community. Get our teachers and school personnel vaccinated first and reduce the spread of the virus. Only then should Wallingford-Swarthmore School District agree to reconsider our educational plan and continue to follow the recommendations of the CDC. Thank you for your time and consideration. Colleen McCarthy, Walnut Lane, Wallingford. I'm calling to comment on the push to bring students to an elementary level back full time. I believe this to be a very reckless decision, and I don't understand how, when the virus is still active and showing newer, more easily transmittable strains, we would fully open schools. When parents made the decision for the hybrid model, we did so because it helped bring students back safely. Why are we going to upset things now, sending students back in person? It is not fair for the parents who are comfortable with the hybrid model, but not with the full in person, to now go entirely virtual. It's not fair to these students to change their teacher and classmates halfway through the year. And what about our teachers? A decision like this is a slap in the face to the dedicated teachers who've worked so hard to help our children during these unprecedented times. How can we ask them to go back to full classes without even being vaccinated? Teachers in PA fall under the 1B category of vaccination, and people in the 1A category struggle to find an appointment. Who knows when teachers will be fully vaccinated? We can't risk our teachers' health to send students back full time. I always believe Wallingford-Swarthmore to be a district that respects and cares for their teachers, but a decision like this to send elementary school back fully shows the exact opposite. Thank you. Kevin and Jessica Mickelberg of Plush Mill Road in Wallingford. First, let me say we support the opening of all schools. However, given the focus of this special board meeting, we believe that the guidelines have evolved and evidence suggests that there are a smaller number of cases on younger children. The reward to students returning to an in-person learning 5 days a week far outweighs any potential increased risk associated with transmitting the virus. More specifically, this past year has proven to me that my elementary school student needs a structured and more focused learning environment. He needs to continue the growth and development as a student, including teaching him and reinforcing skills needed to excel in middle school. Therefore, we are fully putting our support behind the return to 5 days a week in-person learning at the elementary school level. Thank you. Colleen Murphy, Westminster Avenue in Swarthmore. I'm calling today regarding the vote to return to school at 3-foot distancing. As a parent and a community member, this effort does not feel safe to me. We have teachers in our school district who are afraid. These are family and friends. They're real people and they deserve to have their concerns heard. I wonder if you've visited a school or talked to a teacher. Ask their concerns. Have you heard them? Listen to what it's really like in the classroom at this time. If you do not have the support of teachers, I don't see how you can move forward with a decision like this. I assume the new distancing measures are in place with new plans regarding exposures. Have the teachers been made aware of this? Have they had input on these things that will affect them? Our teachers are parents, family members, and caregivers. They deserve to have a voice and they deserve to have their concerns heard.
I feel fortunate to be in this district. We have a really good online program in place right now. If you drive an hour into other school districts, those families are not so fortunate. They do not have systems in place that work like ours do. I'm asking that you slow down and provide teachers with all the information and all the plans and ask for their input before making a decision that affects them so much. Thank you for allowing me to voice my concerns. I know there are not easy answers here.
Okay.
Which, okay. Bob and Liz Oaks? Good, okay. Woodward Road in Media. The reason we're calling in advance of tonight's board meeting is to urge the board to not vote on the school reopening plan for elementary schools, particularly given that the plan is being presented for the first time tonight and the meeting was just announced on Friday. This is a very important decision for those in the community, particularly those children in elementary school. There's a wide range of opinions and concerns about it within the community, and the community should be given an opportunity to hear the plan tonight, think about it, and to provide feedback about the plan to their elected school board members in advance of any vote. There is no reason why the board could not vote on this plan in a week or two and still reopen the elementary schools in March if it chooses to do so. So for those reasons, we urge the board to postpone a vote and to give the community a chance to respond to the reopening plan. Also, at the next meeting, we would like to understand what specific research and guidance the district is relying on for the decision to reopen elementary schools at full capacity at the beginning of March. We expect the district's plans for reopening the elementary school to full capacity with specific safety and testing measures. We want to hear a clear and specific explanation of what those measures are and what will change the procedures currently in place when classrooms have half the number of students. We would also like to understand what the district is doing to ensure that elementary school teachers will have the opportunity to be vaccinated in advance of a full elementary school reopening. We want our kids back in school full time. We also want to know that there's a coherent plan in place supported by our current guidance that addresses teachers and students. Thank you to the administration and school board for all the work that you have done and will do on behalf of our kids. Michael Oliette, Martin Lane in Wallingford. Sciences have estimated transmissibility of the new coronavirus mutants is 50 to 70% enhanced compared to the original strain of the virus. This means our current mitigation efforts will be 50 to 70% less effective. As is the case with the virus mutations that provide it an advantage, it's reasonable to assume that these new variants will become the dominant circulating strains in due time. Couple this with a slow vaccine rollout, it's our social responsibility to demonstrate increased vigilance with infection mitigation strategies and redouble our efforts to get citizens vaccinated. Bringing students back to the classroom and increasing person-to-person contact contradicts the social imperative in front of us and places our teachers, school staff, and vulnerable populations at an increased risk. This is not the right time to be increasing people density, especially in the face of a largely unvaccinated population and the emergence of more transmissible strains of the COVID-19 virus. Lisa Porter, Grandview Road, Media. I just wanted to leave a message stating that I was in full favor of all elementary schools returning back full-time. Thank you. Whitney Pasternak, Drexel Place, Swarthmore. I'm calling because I'd like to share my opinion on the idea of opening schools prior to having teachers fully vaccinated. I get it. I think that there are a lot of kids that need some more support, and I think that by now the teachers in each and every classroom know exactly who those kids are. Prioritize those children. But to open the school 5 days a week when things are working right now, our numbers are low because of the good things that we're doing, by keeping the space 6 feet apart, as close to that as possible, by being able to have enough space and enough support to keep the children and the teachers safe. Until the teachers are vaccinated, it is not fair to ask them to take on full classrooms of kids and changing the guidelines and changing the rules that have been working. It's not fair to ask them to do that. There are kids that are struggling, I agree. Prioritize those children and those children only, and the others can stay either hybrid and/or virtual as you see fit. The middle school program and the way that it is set up and how the classrooms are set up is working great. And there's flexibility there too. Elementary school is not as flexible. I get it. but it's not fair to ask the teachers. We're so close to being at a place where they will be protected once the state prioritizes them and they can get their vaccinations. Then I wholeheartedly agree. 5 days is an option. Thank you for your time. Joseph Qualtieri, McGill Road, Swarthmore. I'm the parent of 2 elementary-aged children in the school district. They've been attending the online academy and will continue to do so regardless of what is decided tonight. I take medication that compromises my immune system, and so exposing myself isn't an option. I believe that it is responsible to even consider returning to full in-person school. Any child who becomes a carrier of the disease, however asymptomatic, they're bringing it home to infect older immunocompromised members of their family and the community. Also, while we believe COVID-19 is more mild in children, we have no idea what the long-term effects on their development will be. I'm sympathetic to the need for children to socialize, but these are exceptional times and we need to find a way to help them safely. It's imperative that we prioritize public health over all else. Forcing people back to school and work without mass vaccinations is a dereliction of our responsibility to each other as individuals and as a society. Lastly, it is an egregious act to risk the health of the teachers and other staff members in our school, including all support staff, custodial staff, etc. Teachers should not be expected to put their lives on the line. This is especially true when they've been doing an incredible job of teaching and supporting the children in a virtual setting. Children cannot learn, and teachers cannot teach unless they are alive and healthy. I've been amazed at the ability of the teacher, staff, and students to adapt to something none of us are expected. Furthermore, returning to school and the conditions for that return should never be done without full collective bargaining with the teachers union and their members. The workers need a say and what risks they feel are appropriate. I, for one, would fully support any teacher or staff member that refuses to put themselves or the kids at unnecessary risk, and I'd vigorously push back on any attempts to force them into an unsafe workplace. Thank you for your time.
Thanks, Jen. Next one's from Franny Riley, Ogden Avenue, Swarthmore. Dear Wallingford-Swarthmore School Board, Dr. Palmer, Ms. Kasner, Chester County Health Department, Delaware County Health Department. I am writing to request that the school board vote against sending our children in grades K to 5 back to school 5 days a week and vote in favor of continuing to adhere to the Chester County Health Department's guidelines for social distancing in schools. I am making this request with concerns for the safety of our teachers, students, and community as outlined below. Safety of our teachers. The CDC released updated guidelines on January 20th, 2021, resources for teachers and staff that continue to emphasize that students should have 6 feet of separation. The CDC identifies the guiding principles to keep in mind as follows. The risk for COVID-19 spread increases with increased close contact with others. The more people who teachers and staff interact with, and the longer those interactions last, the higher the risk of COVID-19 spread. Close contact is defined by the CDC as someone who was within 6 feet of an infected person for a cumulative total of 15 minutes or more over a 24-hour period, starting from 2 days before the illness onset, or for asymptomatic patients 2 days prior to test specimen collection until the time the patient is isolated. The petition to change 6 feet spacing requirements to 3 feet in classrooms that was recently circulated emphasized that the Chester County Health Department's guidance is simply guidelines to consider, not a mandate. I am concerned with this line of thinking. Does mask wearing also fall into this category? What examples are we setting to protect our teachers if we selectively decide to ignore these guidelines? These guidelines were established for the safety of our teachers and students. If we selectively ignore these guidelines, what is the risk? In Georgia, 3 Cobb County educators died from COVID-19 in 1 month. That is the risk that we face when we decide to selectively ignore guidelines. In addition, the petition cites to preliminary data that provides that with 3 feet distancing, droplet transmission is minimal when both parties are masked. What does this mean for lunch? What does the data show about transmission when students are 3 feet apart and not masked? Will teachers also be in the lunchroom when students are 3 feet apart and not masked? What risk does it pose to them? How will we properly clean the schools to the level that they are now if the students are in every day? If we do not know the answers to these questions, we should not use our schools as scientific experiment to find out. Finally, a super majority of our teachers have not been afforded the opportunity to receive any doses of the vaccine. While certain healthcare professionals have started to receive their first vaccine and/or second vaccine, our teacher students and many community members have not had that same opportunity. The idea of now increasing the teacher's risk of exposure when they are so close to being able to receive the vaccine and the benefits of the vaccine is dangerous and morally unacceptable. I appreciate that the school board passed a resolution to vaccinate teachers now, but I also appreciate that the school board openly acknowledged that to date, not a single vaccine has been received by the district. Our teachers deserve better and should be treated with the same consideration and respect given to our healthcare professionals. Safety of our students. We do not know enough about COVID-19 to knowingly increase the risk of exposure to our students. Even if students show mild symptoms or are asymptomatic, the long-term effects may be serious. Ohio State recently conducted a study on student athletes that had tested positive for COVID-19 and found that COVID-19 had been linked with myocarditis at a higher frequency. Sorry, doctor.
Myocarditis.
Thank you. At a higher frequency than other viruses had been based on limited studies. In addition, a recent study of 100 patients recently recovered from COVID-19 in Germany found that a cardiac magnetic resonance imaging revealed cardiac involvement in 78 patients and ongoing myocardial inflammation in 60 patients, which was independent of pre-existing conditions, severity, and overall course of the acute illness, and the time from the original diagnosis. Both of these studies concluded that the ongoing investigation was needed to determine the full impact of COVID-19. If we were able to protect our students by adhering to the Chester County Health Department's guidelines of 6 feet of social distancing as adults, why wouldn't we? Had there been any discussion of the high school in Israel that was reported in the JAMA publication? Data and policy to guide opening schools safely to limit the spread of SARS-CoV-2 infection dated January 26, 2021. As background, in Israel, within 2 weeks of reopening, a large high school outbreak occurred when 2 students with epidemiologically unrelated infections attended classes while mildly symptomatic. Testing of more than 99% of at-risk students and staff identified 153 and 25 cases respectively. Contributing factors to this outbreak included crowded classrooms with insufficient physical distancing. For example, student density in classrooms exceeded recommended values. Exemption from face mask use and continuous air conditioning that recycled interior air in closed rooms during a heat wave. The recommendation from the CDC in this article is all recommended mitigation measures in schools must continue, requiring universal face mask use, increasing physical distance by densifying classrooms in common area, using hybrid attendance models when needed to limit the total number of contacts and prevent crowding, increasing room air ventilation, and expanding screening testing to rapidly identify and isolate asymptomatic infected individuals. If the recommendation is the densifying of classrooms, why are increasing the number of students? As a parent, I appreciate that the school board and administrators develop plans to return to school in person in alignment with the guidance provided by the Chester County Health Department. If the school board is making the decision not to adhere to the guidance established by federal, state, and local health departments, What guidance will they be using? If many other parents elect to switch their children to the online academy, the number in the online academy may fluctuate wildly. How will the district ensure equity among the various classes? Will there be a survey for parents to complete regarding a decision to switch? Do parents have the flexibility to change their schedules for full-time in-person instruction and then change again if there is a spike in cases and the school has to shut down? Safety of our community. As previously stated, certain healthcare professionals have started to receive their first vaccine and/or second vaccine. Our teachers, students, and many community members have not had that same opportunity. On a weekly, if not more frequently basis, we receive notifications about positive COVID-19 cases in schools within our district. It is the intent that these notifications will decrease by having students 3 feet from one another. In addition, we know that COVID-19 is highly contagious along with new strains that are emerging. When a student notification is sent, there is risk that the student unknowingly has also been in the community. If we increase the exposure to students, are we also increasing the exposure to our community? Do we have a responsibility to adhere to this Chester County Health Department's guidelines to not only protect our teachers and our students, but also our community? The risks appear greater now to the teachers, students, and community, given the high levels of infections and the emergence of new strains. What is the upside to this petition? It would appear that the downside risk would be greater, and raising the risk to the stakeholders in this would appear to be unnecessary and unwarranted. In the end, it could be successful, but is it worth the risk? The plan implemented has been successful given the adherence to the guidelines set forth by the various health agencies. In sum, we have all worked together to ensure the safety of ourselves and each other throughout this pandemic. Our researchers are diligently working to produce and distribute vaccines. Our teachers and community are frantically looking to receive the vaccine. For the safety of our teachers, students, and community, we are requesting that the school board continue to follow the Chester County Health Department guidelines. This is not the time to take chances. We have all been challenged by the toll that this terrible virus has taken on our community. We are hopefully weeks away from vaccinations being distributed to our community. We therefore implore you to continue following the successful plan that is in place in the hopes of returning to a safe normal in the near future. Next one's from Carolyn Robin, Vassar Avenue, Swarthmore. I am calling to share my concerns about the district plan that would disrupt the consistency that we've been trying to provide our very young children in this world in which they've lost so many good things that bring them joy and foster development. I would like the board to please prioritize keeping children with their teachers. I am a licensed child psychologist and researcher who specializes in attachment, relationships, and trauma. The importance of close, trusting relationships for weathering challenging situations cannot be overestimated. Any plan that has the potential to shuffle children between classrooms this late in the year, like March, I ask you to reconsider. We selected the online academy for many reasons, one of which was providing consistency to our daughter's daily and weekly routine. I was pleased to hear that you would take a vote only after receiving feedback from the parent surveys. Transparency and community input are critical in a time filled with so much fear and equality and uncertainty. I hope that the voices of parents with children in the hybrid programs and find this change preemptive and disruptive are heard. We are still so early in the vaccine rollout, just coming down off the peak of cases. And perhaps most importantly, our teachers are not yet vaccinated. Please listen to the teachers and please get them vaccinated before class sizes double. Thank you. Scott and Jen Rogers, Bickmore Drive, Wallingford. Dear Wallingford-Swarthmore School Board, The new proposed elementary school schedule is of serious concern to us as residents of Wallingford. Wallingford-Swarthmore School District teachers have not been vaccinated, so the discussion of increased face-to-face instruction time should be postponed. In addition to teaching at Strathaven High School, we are the parents of a cohort student in 5th grade at MPE. We do not want our son attending school for any more than the 2 days he's already there with his cohort. We do not want our son in the classroom with any more students than are in his established cohort. We do not want him in a school building that has chosen to lower its safety standards, including lowering the social distancing to 3 feet. We made the decision to put him in the cohort based on the current schedule, the district's pandemic safety plan, and our son's learning needs as a student on the autism spectrum. This new proposal violates any trust we have in the administration to keep our child, his classmates, teacher, and staff safe. To switch our son with autism to an online academy at this point in the school year has the potential to be incredibly devastating to him. In addition, it would complicate the services he receives as per his IEP. Changes to the elementary schedule will be extraordinarily stressful for our teachers and staff. They're working unbelievably hard to provide an excellent education to our students during a pandemic. To install a new, less safe schedule is negligent. We do not want our colleagues put in any more danger than they already are. They deserve to be safe and feel safe at work. Changes to the elementary schedule will mean that our beloved art, music, library, and PE teachers will see 125 plus students a day in their classrooms. While classroom teachers have classes of 20 plus students, our special teacher will have the entire student population cycling in and out of their classrooms. Changes to the elementary schedule will mean that our treasured special education teachers, speech and language pathologists, OTs, PTs, along with instrumental music teachers will have to remake their schedules for each individual student they teach. This is a gargantuan task. You've already required these highly trained professionals to do this twice already this school year. Please do not add any more stress to their workload. This could also have a potential for lack of services due to the confusion of changing schedules yet again during this pandemic school year. As I stated in my presentation to the school board on November 9, 2020, we all yearn for a pandemic-free school year, but there is a long way to go before that can happen. The ultimate goal should be to keep our children, faculty, and staff safe. Safety should not be compromised to cater to a loud, vocal group of parents who think they know what is best in education. This reopen group does not represent everyone in the school district. Those of us who put safety at the forefront deserve to have our voices listened to as well. The demands of the reopen group are dangerous. Are you willing to accept the sickness, suffering, and potential deaths that could occur from your decision to put children, faculty, and staff into unsafe school buildings during a pandemic? Please postpone your vote on this matter until all Wallingford-Swarthmore School District employees are safely vaccinated. The next one is from Catherine Roeder, Hastings Avenue, Wallingford. My daughter is in 1st grade at MPE. I am calling to please ask you to return to 5 days a week in person for schooling. It is super important for not only my daughter's well-being, but also for the other children in the school district. I truly feel as a parent that they learn better in person from a teacher, just from our experience with doing virtual learning. She just learns so much better when she's at school. The days that she is home, whether it's Wednesdays or Mondays and Tuesdays, are just filled with tears and frustration on both our parts because she's so emotional and just would much rather be in school with her teacher and her friends. So I'm asking you for her well-being and for ours to please vote for 5 days a week in person. Of course, as a parent, planning for the teacher's safety and for her safety, but I know the plan that you would propose that they'll be able to continue their social distancing. I would even welcome, if they need to have plexiglass at each desk. This is what the kids would have for personal space and some distance in between them. I'd be totally fine with that. I know there's plenty of other school districts and other states even that are already 5 days a week, and they've been 5 days a week the entire year. So I'm asking that you consider sending them back 5 days a week. I know there's a lot of parents that are opposed to this, but the whole intention of us doing in person, even with 2 days a week, was to eventually get back to 5 days a week. So for those parents who were not interested in that, then they should have chosen the online academy, and they still can choose the online academy. The parents that truly want our kids in 5 days a week should not have to go up against those parents that are not willing to have their kids going to school more days. We shouldn't have to compromise. You can offer the online academy for those that aren't willing to go in person 5 days, and then offer 5 days a week for those that are. I think it's really paramount that we get the kids back in school. There's so many kids, which is just so much better, and are falling behind because they're not getting the instruction 5 days a week. I just hope you can really consider 5 days a week in person for the well-being of our children. Thank you. Kate Samaras, North Swarthmore Avenue, Swarthmore. I have a daughter of Rosa Samaras in first grade at SRS. I'm calling to put my support behind returning the kids to school full-time. I feel my child is being left behind with the virtual learning. She is definitely not learning as much as she or I would like this year, and her socialization is definitely falling behind as well. Thank you. Next one is William Shaw, West Wiltshire Drive, Wallingford. I'm calling to express my support to have in-person schooling 5 days a week for elementary school. And actually the entire district should be 5 days a week. But the issue right now is to keep the kids, the elementary school kids, at 5 days a week. There's the online academy for those of you who either have extenuating circumstances, and we need to keep that. However, for the rest of us, the kids need to be in school 5 days a week. They're falling behind. The mental health aspects of it, horrible for those kids, the impact's there. There's no reason medically, from a scientific standpoint, these kids should not be in the classroom 5 days a week. Everybody from Anthony Fauci to the CDC, anybody who's looked at the science, who follows the science, honestly agrees that there's no reason kids should not be in school. The rest of the world has been doing it. The United States is the outlier, and there's no reason for that. Thank you. Next one is Jessica Stillman Lloyd, Willow Road, Wallingford. I respectfully request the Board of School Directors delay the vote for 5-day in-person learning for K-5 until March, or when the teachers are vaccinated. Parents, teachers, and administrators all know that the best place for children is a full-time in-person schooling. However, we've already been down this road for a year. What is another few weeks to determine if we'll be able to meet vaccine goals? I would also like to invite consideration of a full-time classroom for K-2 spaced throughout the buildings, with older students remaining hybrid as a compromise. This will keep building density population low, give our youngest learners the education they need, and protects the healthy adults in the building. I respect the difficult work you have all done this year, making impossible decision after impossible decision. It would be a terrible shame to rush into this decision when you're so close to the finish line. Let's just wait until after we know when the teachers will be able to get vaccinated before we commit the risk of their health and safety. Thank you very much. Next one is from Ed Strauss, Riverview Road, Swarthmore. My wife and I have children in the 5th and 7th grade. Last August, at the very last minute, the board voted to go all virtual. We elected to send our children to school in another state. We are pleased that they have been safely attending classes live and in person 5 days a week since last August. Their school has followed all state and federal guidance and has had only a couple of children come down with the COVID virus, each of which made a quick and full recovery. In addition, our children have been involved in competitive team sports and other activities continuously since August with no adverse effects. While it is a difficult decision, both financially and emotionally, we felt it was important that they have in-person learning. Before making our decision, we asked our children if they wanted to be in the classroom, and they both emphatically said yes. Both children did not gain anything from the virtual experience last spring. In fact, they regressed. As the scientists are telling us, it is safe for children and teachers to be in the classroom full time. Our experience demonstrates this to be true. It is unwise to delay sending the children back to school. As the studies are showing, they are suffering both academically, socially, and emotionally. Please vote to open the elementary schools as well as the middle and high school. Children in our district need you to do the right thing. The next one is from Hannah Thomas, Linden Avenue, Rutledge. I would like to register my strong support for students' full return as proposed in the meeting tonight. I have a kindergartner and a third grader at SRS who have been struggling to keep up with virtual hybrid school. Virtual school does not work well for elementary school children, and their learning has been significantly affected over the past year. I do believe that their mental health, especially for my third grader with ADD, for whom the hurdle of hybrid learning poses an additional learning barrier and affects his sense of worth. Children have borne a significant burden in this pandemic, yet the data does not show that school drives community spread. Virtual school was acceptable at first while everything was being figured out, but continuing to keep school virtual is no longer acceptable, especially for young children. I'm very thankful for the Herculean effort put forth by the teachers to make possible all that they have done over the last year. What they have been able to provide virtually and in the hybrid program is remarkable. They should be commended and thoroughly recognized. I wish for teachers to be safe. However, the essential nature of school needs to be recognized as well. Virtual school is not a long-term solution, and our kids need to be able to go back. Thank you for steering us as a district through this crisis and making thoughtful, evidence-based decisions. Thank you. And next is Alice Turbeville, Cornell Avenue, Swarthmore. My two children, John and Matilda, attended Swarthmore Rutledge Elementary, and I work at the college as the Assistant Vice President for Finance and Assistant Treasurer. Part of my responsibilities is to oversee COVID testing and contact tracing for the faculty and staff. So I'm very familiar with the decisions that school board has before it. I also serve on the board of a charter school in Chester, and I know exactly the decision that you have and the factors that you're weighing in making this decision. There's a few aspects to our district that I think point to it being a safe environment for us to take the advice of the CDC and bring students back at the 3-foot distance in classrooms. Those data points I wanted to point out is that the cases at the elementary school level in the district are extremely low. And if the contact tracers that have performed to duties on this cases have not pointed out any community spread within the elementary school, then we know we're doing what we can to reduce the number of positive cases through our masking procedures in the school. These cases likely came from outside exposures which couldn't be prevented. Whether you have school in session 5 days a week or not, our kids have been incredibly resilient and compliant in all the new procedures that we have in place. I don't think that'll change if we bring them back 5 days a week. The other thing to keep in mind is that protocols can change. And if you open the school 5 days a week and find that there is any community spread, of course, you're going to put in additional procedures or go back to a hybrid policy. The last thing I wanted to mention is about your rapid testing program. I'm extremely excited that teachers are going to get access to rapid testing. At Swarthmore, we've been doing PCR testing in the fall, and that has really opened our eyes to the number of cases out there. So adding that additional mode of certainty around exposure is really a positive thing, and it should give your teachers that much more confidence to come in school and know their status during the rapid testing. So I applaud you for getting that in place, and I hope that you can continue it. Good luck with your decision making.
Okay, Marianne Watson, Washington Avenue Media. I would like to register my strong support for students' full return to school as proposed in the meeting tonight. I have a first grader who has been struggling to keep up with hybrid virtual school. Virtual school does not work well for elementary school children, and our learning has been significantly affected over this past year. It takes a toll on our mental health, especially for my first grader who is possibly dealing with a mental disorder, and for him, the burden of hybrid learning poses an additional learning barrier and affects his sense of worth. Her sense of worth, sorry. Children have borne a significant burden in this pandemic, yet the data does not show that school drives community spread. Virtual school was acceptable at first while everything was being figured out, but continuing to keep school virtual is no longer acceptable, especially for young children. I'm very thankful for the Herculean effort put forth by the teachers to make possible all they have done over the last year, but what they have been able to provide virtually and in hybrid is remarkable. They should be commended and thoroughly recognized. I wish for teachers to be safe. However, the essential nature of school needs to be recognized as well. Virtual school is not a long-term solution, and our kids need to be able to go back. Thank you for steering us as a district through this crisis and making thoughtful, evidence-based decisions. Kelly Whitehead, Shepherd's Lane, Wallingford. I have a 5th grader at Wallingford Elementary and an 8th grader at the middle school. I'd like to begin tonight by thanking our school principals who have worked so hard to make this year work for our children. Though it's not perfect, it's nice to see my children engaged in learning and happy to interact and be with their teachers and friends. You've made lemonade out of lemons, and I can't thank you enough. I'd also like to thank our teachers. You are the glue that holds this district together. You are everything that is good and right in our schools. Thank you for working so hard this year. You have no idea how much so many of our families appreciate you. And now for the matter at hand. I'm deeply concerned with the board's proposal to ship our K-5 students back to school full-time. This proposal is rushed and misguided. We are still in the deep throes of this pandemic with high case numbers, high hospitalizations, and record death numbers. And all of this, there is new, more contagious variant that has surfaced, a variant so aggressive that double masks might soon be necessary. While the vaccines are out there, the only ones in our community who've been fortunate enough to receive them are the elderly nursing home recipients and our healthcare providers. Our teachers are not in this group of recipients. Additionally, and most importantly, the CDC is still recommending that everyone remain masked and socially distanced at 6 feet. The CHOP policy lab, which we have followed from the beginning of the pandemic, is recommending the same. Returning our K-5 students 5 days a week would pack our overcrowded classrooms and have children distanced at just 3 feet apart. Are you aware that the 5th grade classes at West have 27 or 26 students in each of them? Do you realize that measuring 3 feet for social distancing is measuring nose to nose, not desk edge to desk edge? I don't understand how you can even begin to think that this is safe. Why are we suddenly ignoring the recommendations from the CDC and the CHOP policy lab? None of the experts are recommending that social distancing be reduced to 3 feet. And if we aren't following the CDC or CHOP, then who are we following? Are we just making up our own set of rules as we go along? This seems nothing short of reckless and irresponsible. Prior to tonight's meeting, the board received a petition signed by over 650 district residents asking that we continue to follow the recommendations of experts and keep our kids distanced at 6 feet in the classroom. You have also received a petition signed by almost all of our 319 teachers and another petition signed by most of our classroom aides. You've received countless letters from parents urging you to continue following the advice of the experts. We are all saying the same thing. Follow the science, follow the CDC recommendations, follow Dr. Fauci's recommendations, follow the CHOP policy lab recommendations, follow these recommendations as you have been, and do what is best for our students and their families, our teachers, and our community. Let's get back to the classroom when the experts agree that it's safe to return. Thank you. Mark Williams, Strathaven Avenue, Swarthmore. As a democratically elected school board, your job is to make decisions that represent the interests of the public. The people have spoken. Nearly 1,000 voices are asking you to delay this vote. This alone should give you a reason to postpone opening of schools to all students. Unfortunately, the perception of many in this district is that the board has already made its decision that this is not truly up for debate. To make such an important decision that affects so many stakeholders before both sides have had a chance to present their cases will be unconscionable. Yet here we stand with an emergency meeting called with only 1 week's notice given to the public and only a weekend to review the actual plan without adequate time for discussion or survey of parents, teachers, and other stakeholders in the district. It upsets me to see the growing animosity directed toward teachers in our district that I've seen posted on social media by supporters of the 5-day plan. They accuse teachers of being lazy and selfish, which exposes their own ignorance and their previously held negative views of educators. Our teachers are having to adapt all of their lessons to engage the students online while also meeting the needs of students in the classroom. They're trying to satisfy both groups, which has added countless hours to their prep time, and yet despite the extra work, the faculty and staff are begging you not to ignore the 6-foot distancing guidelines. I grew up in this district and returned to raise my children here, and I cannot remember the last time the relationship between teachers, administration, and school board was so poor. I guarantee that all of the teachers want to be in the classroom when it is safe. They ask you to allow them to continue practicing their profession in a safe manner, but they do not trust you. They're not confident that you will put aside your own personal agendas and the urgencies of a vocal minority in favor of the will of the majority and the guidance of the Chester County Health Department and PDE, who from the outset of this pandemic, this board so they would follow their recommendations. The patronage of staff, many of whom live in this district, do not want to be part of your science experiments, nor do hundreds of other families in this district. I ask that you consider the voices of your constituents who clearly do not agree with moving forward with the plan at this time, and to follow the guidance of the public health agencies who the board stated from the beginning will be the authority in this matter. Bridget Kelly, Maple Avenue, Swarthmore. Dear Wallingford-Swarthmore School Board, Dr. Palmer, Ms. Gassner, Chester County Health Department, Delaware County Health Department. I'm writing to request that the school board vote against sending our children in grades K through 5 back to school 5 days a week and vote in favor of continuing to adhere to the CDC HD guidelines for social distancing in schools. I'm making this request with concerns for the safety of our teachers, students, and community as outlined below. Safety of our teachers. The CDC released updated guidelines. The CDC released updated guidelines on January 20th, 2021 that continue to emphasize that students should have 6 feet of separation. The CDC identifies the guiding principles to keep in mind as follows. The risk of COVID-19 spread rises with increased close contacts with others. The more people who teachers and staff interact with and the longer those interactions last, the higher the risk of COVID-19 spread. Close contact is defined by the CDC as someone who is sitting within 6 feet of an infected person for a cumulative total of 15 minutes or more over a 24-hour period, starting from 2 days before illness onset, or for asymptomatic patients, 2 days before or 2 days prior to test specimen collection until the time a patient is isolated. The petition to change 6-foot spacing requirements to 3 feet in classrooms that was recently circulated emphasized that the CCHD guidance is simply guidelines to consider by mandate. I'm concerned with this line of thinking. Does mask wearing also fall into this category? What examples are we setting to protect our teachers if we selectively decide to ignore these guidelines? These guidelines were established for the safety of our teachers and students. If we selectively ignore these guidelines, what is the risk? In Georgia, 3 Cobb County teachers died from COVID-19 in 1 month. That is the risk we face when we decide to selectively ignore guidelines. In addition, the petition cites preliminary data that provides that with 3-foot spacing, droplet transmission is minimal, but both parties are masked. What does this mean for lunch? What does this data show about transmission with students and 3 feet apart and not masked? Will teachers also be in the classroom if students are 3 feet apart and not masked? What risk does this pose to them? How will we properly clean the schools to the level that they are now if the students are in every day? If we do not know the answers to these questions, we should not use our schools as scientific experiments to find out. Finally, a supermajority of our students have not been afforded the opportunity to receive any doses of the vaccine. Certain healthcare professionals have started to receive their first vaccine and/or second vaccine. Our teachers, students, and many community members have not had that same opportunity. The idea of increasing the teacher's risk of exposure when they're so close to being able to receive the vaccine and the benefits of the vaccine is dangerous and morally unacceptable. I appreciate that the school board passed a resolution to vaccine teachers now, but I also appreciate that to vaccinate teachers now, but I also appreciate that the school board openly acknowledged that today, not a single vaccine has been received by the district. Our teachers deserve better and should be treated with the same consideration and respect given to our healthcare professionals. They serve our students. We do not know enough about COVID-19 to knowingly increase the risk of exposure to our students. Even if students show mild symptoms or are asymptomatic, the long-term effects may be very serious. Ohio State recently conducted a study on student athletes that have tested positive for COVID-19 and found that COVID-19 has been linked to myocarditis at a higher frequency than other viruses have been based on limited studies.
Kelly, with respect, that was 3 minutes for that one. That was over 3 minutes. I timed it.
Okay. This is also, it's the same, it's a duplicate
Yeah.
from another, thank you.
Yeah.
Are we okay to move forward?
That's fine. The whole thing will be in the record.
Okay. From Neil Young, Crest Lane, Swarthmore. I want to offer my full support for the reopening of the elementary schools that is being discussed this evening. 2020 and now 2021 have been economic hell for educational disasters. There are 22,000 deaths in Pennsylvania alone, so nothing I say should trivialize and diminish this tragedy. I only hope that vaccines are delivered effectively and quickly, and of course, we should all pay attention to the governor and the CDC advice on keeping safe. Closing schools was a reasonable and prudent measure when we knew little about the virus. I'm grateful that the district could offer an educational program through most of the year, and I thank all of the frontline teachers and support staff for their commitment. The risk of COVID remains real, but the empirical evidence is that our K-5 students have not been a source of disease spread. What is also clear, at least to me, is that iPad-based learning is not as effective as classroom instruction, and children need face-to-face interaction with their teachers and their fellow pupils. We likely simply don't know the long-term impacts of nearly a year of mass virtual instruction, but I can't imagine it's positive. Children who have the most educational needs, whose homes don't have the luxury of quiet spaces and high-speed internet, parents who can't supervise lessons, hire tutors, or contemplate private school, these people need the high-quality education of Wallingford-Swarthmore. They seem to me to be the ones who suffer most from continued remote education. I fully acknowledge the risk of COVID. However, medical facts suggest that children are rarely severely infected and the risk of spread can be managed with masks, social distancing, and basic hygiene. There's a risk to everything in life. In a school environment, we allow and encourage sports. The figures may be a little dated, but the CDC has mentioned 2 million injuries, 500,000 doctor's visits, and 30,000 hospitalizations annually as a result of school sports. But yet we've managed risk because we know the benefits. I feel respect for children's conditions hidden and invisible. That means full-time in-person instruction is not suitable for them. I understand too that other parents have different views of risk. The option of virtual school for those families is something I must fully support too. However, my overall impression is that the vast majority of parents want their children in school full-time with as normal teaching and learning environment as possible. I trust that the medical and scientific evidence supports the plan proposed by the district. I urge the board to be responsive to the needs of parents, most importantly students, and vote for the proposal to reopen fully our schools as soon as possible. Dr. Michael Zadilla, School Lane, Wallingford. I'm a professor at Temple University and the dad of 2 boys in the district. I'm calling to ask the board to place a higher value on our teachers' lives and safety, especially the older teachers, over any desires for personal convenience of a return to school. There are many loud voices in the minority that have been clamoring for an irresponsible rush back to the schools from the very beginning. Please don't be swayed by the disproportionate volume of the minority and the arguments that dance around the following facts. Some have argued that the school is not a place where transmission is significant, and while there's some truth to this, this is because transmission is mitigated only by proper social distancing and masking. Doubling the occupancy of the school while simultaneously stretching the occupancy by the same students from 2 days to 5 days and putting kids into crowded spaces to unmask and eat will erase the effectiveness of our precautions so far. Teachers are dying of COVID across America, and the school board should not be willing to risk increasing the risk to our teachers' lives. Others have argued that the vaccinations are forthcoming and therefore the time to begin the transition back to regular life is now. However, this is not true because cases are still in a phase of the highest occurrences so far, and because the vaccine rollout in Pennsylvania is slow. Finally, because the vaccine is not effective until the second dose. We should revisit the return to school once and only once every teacher has had both doses. Our teachers have worked hard and sacrificed much with too little thanks. I implore you not to endanger their health nor undervalue their safety and their sacrifice. Please vote no. Thank you for considering my arguments. Shannon Elliott, Cedar Lane, Swarthmore. I'd like to thank the board and the staff and administration for doing the work to create a plan to bring our elementary school students back to school for 4.5 days a week instead of 2 days a week. At this point, it seems that all are in agreement that getting the kids back for more in-person learning is important and necessary for their short and long-term wellness. If there is any doubt that the effort may be too late in the year, I would say that my 4th grader would disagree. Even 1 month in the school building full-time would make an impact on her well-being. In addition, I'd like to add that a major stress point for me is ensuring that our teachers feel part of the solution and are actively involved in the safety planning. The CDC says vaccines are not necessary if the proper mitigation and safety plans are in place. We cannot get our teachers vaccinated, which is ideal, ahead of a full return. If we cannot get our teachers vaccinated, which is ideal, ahead of a full return, then please make sure they're fully involved and informed on what the safety plans will be to keep them and our children as safe as possible. Collaboration will be key if there's an expectation of a compromise to make the return happen ahead of the vaccine. The teachers are key to the success of this district, so please be sure they're well prepared for this next phase returning to school. Greg Gregory of Pembroke Road, Wallingford. I'm calling to ask the board to take a big step back and the apparent rushed approach to getting kids back into the school by simply reducing the spacing requirements from 6 feet to 3 feet. I can appreciate that last week the board did not take a move to make sure that the community was involved in this discussion. As of today, the board has suggested, to my understanding, a proposed timeline for voting to get kids back to school and having parents vote on this. However, this does suggest that we have all the information available. The CDC has indicated that later this week, they will be providing updated information on social distancing guidelines. Why would we want to put in motion a timeline for voting for WSSD if we don't even have all the information available? I think today's board meeting could be a good first start, but the objectives of today's meeting should not be to put in place a vote for a timeline. If there's anything that I've learned from my 20 years of experience, which includes a doctorate in immunology, both having worked on over 30 vaccines and infectious disease treatment, that evidence is key, and right now both sides are only bringing to the table anecdotes. Moreover, it is critical that the school carefully assess that we are providing the same level of education engagement with students and teachers when we consider online academy versus in-person versus hybrid. Personally, one of my kids has already rotated through 3 different teachers. They've all been great, but the idea that moving from the hybrid model to the more students in person and having yet another rotation to students when we only have, X number of weeks available left in the year seems ludicrous to me. Thank you again to the board as well as to the community for letting me share my thoughts. Janet Click, Georgetown Road, Wallingford. I'm the parent of a Strathaven graduate, and I am an alumni myself. The reason for my call this afternoon is to ask the board what precautions it plans to take to ensure an acceptable level of safety for paraprofessionals, especially those who work directly with students one-on-one who are not vaccinated and have often felt as though their concerns are ignored. At times, these paraprofessionals are subjected to an unacceptable level of risk to students, staff, and other community members. What I want to know is how can the district ensure their safety and welfare? Thank you. Simi Maman, Devon Lane, Wallingford. So I'm here to give, I guess, a sort of speech or debate against why they should change the hybrid program and take it away. I disagree with that, so here's my thoughts on it. Dear WSSD School Board, my name is Jimmy Milan, and I am in the 7th grade at Strathaven. I want to speak to you directly tonight because I personally do not think it is a good idea to get rid of the hybrid program. Doing so will dramatically lower safety protocols by increasing the amount of students in the school at one time and reducing social distancing. We know that social distancing is part of the protection for students and henceforth our families and friends. I can empathize greatly with the people who feel they need normal life back. In fact, I moved here this year. I know pretty much nobody. Sometimes my social life feels like it's in ruins. I haven't seen my biological dad in about a year because he lives in New York. I have recently even had my bar mitzvah completely on Zoom, completely online. Try and spend about a year practicing, preparing for it, and I still find my bar mitzvah meaningful despite the circumstances. In fact, I found it possibly even more meaningful than it would have been in person because it was a moment of joy and great achievement that was able to happen during these difficult times that people put in the effort to still make it happen. But despite all the hardships the pandemic has thrust upon us, I'm still excelling in school even after skipping a grade, and math I admit is difficult. I am so happy. I'm still resilient and I'm still finding a way to get through this and enjoy life. It's always better to prepare the child for the road and not the road for the child. And this is not a good idea to let convenience be a reason to give into an easy way out in exchange for putting safety as a secondary priority. This virus is dangerous. Vaccines are scarce. Rushing aside health and safety is never a good decision. Because of this, I'm here tonight on behalf of my teachers at Strathaven Middle School and the friends I am starting to make my family. I implore you to keep safety protocols as high as they can be, not to go fully in person right now. Even kids and adults can get through this without having to compromise on their well-being and all their lives. Lauren Minsky, Knoll Road, Wallingford. Dear board members, I'm sure that you are inundated right now This is just a short note to observe that the Harvard Global Health Institute guidance that you cite notes that, quote, trust is not merely a matter of community spread. It is also a question of how school leaders make decisions, how well they do it incorporating educators, paraprofessionals, and other staff in decision-making processes, how well they do it communicating around decision-making, and how well their decisions include an aligned focus on the health and safety of everyone in the building, students, but also educators, paraprofessionals, and other staff, end quote. I ask that you please consider this portion of the guidance as seriously as you're considering a cherry-picked social distancing recommendation, and that too in isolation from all other required safety measures. As you and your board moves forward, please prioritize rebuilding our community's sense of solidarity and trust. If you choose to navigate these extraordinarily challenging waters via highly personalistic relationships appointments, and by attempting to go rogue with respect to federal, state, local, and CHOP public health guidance, you will continue to inflict serious damage on our community and the social relationships that are its greatest strength. First, do no harm. With kind regards and best wishes. Lisa Popek and Eric Behrens, Devon Lane, Wallingford. We have a 5th grade daughter in the online academy. Our homeschool is NPE. I'm calling to express our concerns about the potential return to 5-day in-person instruction at 3 feet. My daughter doesn't enjoy online school. It's different, and difficult not being in the classroom. She misses the camaraderie of her friends. She and we look forward to the fall when she is back in person, this time at the middle school. I fully believe that safe full-time in-person learning is achievable. I do not believe it's achievable right now, however, when our community of teachers and staff remain unvaccinated and when significant mitigation efforts remain lacking in the district. Ending hybrid instruction now when positivity rates are high in the surrounding community would be reckless. WSSD schools are the heart of this community, but they should not be at the heart of community spread. Cramming students and teachers into enclosed spaces where social distancing cannot be practiced will endanger everybody's lives. On the front lines are our valued teachers and staff, but if this virus spreads, it will reach beyond the schools. Instead of considering this abrupt change, I would suggest concentrating district efforts on a robust extended school year program to benefit our children with learning differences and special needs, perhaps even expanding the program to include other children whose learning has been hampered by the disjointed year. Beyond that, of course, would be concentration on a program for the fall that would be safe for our children, our teachers and staff, and by extension, our community as a whole. Thank you today for the opportunity to speak.
I'm actually going to finish with reading some additional calls that came in, but still need to be officially transcribed. The first one is by Lisa Brumball Hill from Glenwood Avenue and Media. I implore you to hold off on voting tonight and bringing children back full-time without a comprehensive plan being released to the WSSD community, and additional time to address questions and concerns. My daughter's 5th grade class at West, as well as the other 3 5th grade classes, have 27 students each. I'm very concerned how they and their teachers can stay safe in a crowded classroom, as she would love to have to be back in school full-time. We stand behind our teachers and feel their worries and wishes should be at the top of the list of considerations when making a return to school plan. The hybrid model has been very successful at reducing transmission rates in our schools while providing quality education to the students. It is unfortunate that some parents keep their students and think their students are falling behind or being neglected. Nonetheless, this is a whole community that needs to be considered. Thank you for your time. The second call is from Allison Carpin from Martin Lane in Wallingford. I'm calling to comment with regard to the reopening of the elementary schools. I'm currently very concerned about this plan because of the coronavirus mutations. I think this is a really bad social move at this point in time. We also know that we've had a slow vaccine rollout and social pressure that's going to result in new COVID variants. So I think our responsibility needs to be around increased vigilance and increased vaccination, and we need to hang tight before we bring students back to school. I have another call from Amy Caruso from Colonial Drive in Wallingford. I'm calling in my support for the reopening of elementary school in the Wallingford-Swarthmore School District as soon as possible, as proposed by the board in the special meeting for the 4 full days a week. This is long overdue, and I do not feel that this should be delayed any longer. Our children need to be in school and need to be learning for both their social and mental health. There is science to back this up and to support this decision, and there's been a lot of positive information coming out of the CHOP lab, which has been used as one of the primary sources for the board in making decisions over the past year. We commend the board for bringing this recommendation and this decision to the community this evening, and I fully support it and ask that you vote in favor. There's been a considerable amount of time now that has been spent working on coming up with ways to manage and to make this a suitable situation. In addition, we've been very appreciative of the increase in time at the high school, which just started last week, and the new semester of going to the 4 half-days. So any continued reopening, we support and we applaud the board, and we also commend the option for those who cannot or do not wish to go to continue with the online model. And that shows a lot of prudence, and I think it offers something for everyone. Thank you very much. I have another call from Stephanie McDonough on Waterford Way in Wallingford. I have 4 children in the district, and between them, they have had at least 23 teachers or other staff in the building. We see how hard they are working, and we greatly appreciate all they have done to make this year okay. My kindergartner loves her teachers and classmates. She loves going to school and doing her work. She hates Zoom. She hates the iPad. She checks every morning for her teachers to see her submitted work. She listens to avoid comments and repeats herself words that should not be hard to see. And this is only one peek at the downside of virtual education. I urge you to approve the plan to fully reopen our elementary school. The plan has a long lead time, which should allow for adequate planning, the implementation of the testing program, as well as increased vaccinations in both our community and our educators. Schools across the country have opened safely for full-time instruction. Another call from Jesse Cherian of South Providence Road in Wallingford, PA. My son is Luke Cherian. He is in the 1st grade at West. I was surprised as a parent and also as an employee of Penn Medicine. I've been pleased at how the hybrid option for people, which my son is in, is balanced. The need for some social interaction with a lot of social distancing and masking. That's possibly because there are so many fewer children in the schools, and I think it would be really a mistake to look at going back March 1st. If you look at the project, they're talking about 200,000 people dead by May. We have at least 4 really contagious new variants that are showing up. And again, as an employee of medicine, I can tell you that we are very far from being able to vaccinate teachers. We're now just getting to people, and also people with serious health conditions. So there's no way that by March, teachers will be vaccinated. The 3 pillars are masking, ventilation, social distancing, and having that many children back in school with very little correlation to reduce social distancing, I think, is a recipe for disaster. And at this point, we cannot in good conscience then move him back full time. That would be really negative for his development. So I really urge the board to delay and talk to health experts and to make this decision based on what is best for the health of the teachers and the students. I'm looking at this holistically. I know it's difficult and there's pressure on the school, but I feel really strongly as a parent and someone who works for a health organization that this would be a mistake. Holly Bergen, East Valley Road in Wallingford. I'm calling in regards to the plan that's going to be discussed and voted on tonight with regard to the elementary school and reducing the spacing from 6 feet down to 3 feet. And I'm calling because I wish this plan had been introduced and defended to the community well in advance of this evening's route. If the district does not garner the support of the elementary school teachers and provide realistic professional options for all those who disagree or are not comfortable, then the plan is not tenable for educators. If it does not intend to wait to implement this plan until every teacher that wants to be vaccinated, this plan is not safe for our teachers. If the district does not have an abundance of clear and convincing evidence from multiple peer-reviewed respected science and public health sources and social distancing of 3 to 4 feet as an effective as social distancing of 6 to 8 feet for elementary school students and for the teachers, administrators, and staff who work in our elementary schools, then this plan is not safe for our community. If the district does not have a plan in place, such as the children who do not feel safe doubling the amount or doubling the number of other children they're expressed to each day at school, do not have to change teachers 2/3 of the way through this tumultuous school year that's been already, and the plan is not emotionally acceptable for our children. If the district does not have plans in place and the resources secured to implement regular COVID testing for elementary school students and staff, then this plan represents a premature move to increase exposure. If this plan is not in alignment with current CDC recommendations, as well as recommendations put out by PDE for the safe operation of schools, then it is unwise and irresponsible. If each board member does not have the intention of listening with open ears and the voices of the community, and then using a feedback to inform their vote, then this potential adoption of this plan constitutes a breach of justice in our community. And finally, one more from Sandra Gatch from Pine Ridge Road in Media. I just wanted to call and let you know that I'm in favor of returning to school for 5 days a week for elementary students. My son is in second grade and he is missing being in school. In addition, my kindergarten son attends Mother of Providence and has been in school 5 days a week since September. He has 20 students in his class. They are appropriately masking and there are 3 feet spaced in their classroom, and the school has not had any issues. They may have had a case here or there, but certainly no more than any of our elementary schools have had thus far this year. I really feel it's in the best interest of all students for their mental state, as well as their academics, to be in school with a certified teacher. It's being safely done in parochial schools. It's being safely done in Interborough. It's being safely done in districts in Bucks County, and it can be safely done in Wallingford-Swarthmore. Thank you so much.
That was the last one.
That's it.
Okay. All right, thank you, everyone. Again, as I mentioned in my opening comments, I know that there are many strong views and opinions about how we proceed and how we consider our plans for the remainder of this school year. And I just want everyone to know that we've heard you. Again, we've received many, many emails. We've read them all, and we listened carefully to all the comments that were made this evening, both in person and called in. And I do want to just say that there will certainly be a chance for everyone to be heard again on the survey that goes out to our families. And I hope everyone will certainly share their views when they complete that. It takes us to the part of the agenda where we would normally ask if there are any school board reports. Are there any school board reports? Okay. Do we have any old business? Do we have any new business? All right, this meeting is adjourned.
Good night, everybody.